isolation, job loss, poverty, loss of their place of residence, and stress about the future. So will he, at the very least, ensure that statutory sick pay is increased to £320 a week, the universal credit is not cut, that the continuation of the protection of private tenants goes on after the end of this lockdown, and that above all else, he ensures that every child in every school and every student has a chance to learn online by provision of a computer and, yes, free universal broadband for all in our society. Minister?
I thank the right honourable gentleman, who seems to be really recapitulating what his right honourable colleague has already asked me, as though he was still doing his old job. But I don't necessarily want to repeat all the points that I've made. Obviously, we're investing heavily to support jobs and livelihoods throughout the country. On mental health, he's right to draw attention to the risk of increased suffering caused by the privations of lockdown. That's why we're investing hugely in mental health provision, another 13 billion plus 18 million support for wonderful mental health charities across the country.
So Desmond Swade.
Pubs can't compete with supermarkets for off sales. Even within a household, you can't play tennis or golf. Notwithstanding the assault on liberty and livelihoods, why are these regulations pervaded by a pettifogging malice?
Prime Minister?
Pettifogging, yes. Malicious, no, Mr. Speaker. The intention, and I'm going to have to take the hit here, the intention is to stop the virus, to protect the NHS and to save lives. And to do that, we have to engage in restricting transmission between human beings. And I know that my right honourable friends and colleagues, honourable right honourable members, will find all sorts of reasons to oppose all sorts of restrictions. But in the end, Mr. Speaker, we have to look at the overall budget of risk caused by transmission between members of the human race, and that is what we're trying to restrict.
Let's head up to Greater Manchester with Lucy Powell. Lucy Powell.
Thank you, Mr. Speaker. I've just come from a call with the big business organisations, and I know the Prime Minister is meeting with them later on. So let me give him the heads up. Businesses are on their knees. It's been a year of lost trade and mounting debts. Cash grants are welcome, but they're not enough, and most won't get them anyway. What they desperately want is not more sticking plasters, but a proper long-term plan to help them survive to the spring and then thrive beyond it. It can't wait until the budget because many will be bust by then. So can he urgently tell his Chancellor to come to this House with a proper plan for jobs and businesses? And please don't insult us by re-rehearsing what he's already done, because honestly, it's just not enough.
Prime Minister?
Well, Mr. Speaker, she asked for a timetable, as indeed many colleagues on both sides of the House have done so, and business rightly wants as much certainty as possible. I think what we have now, for the first time since this pandemic began, is clear sight of the end and the way to the end. And we've set a deadline, as she knows, of the middle of February, 15th of February, to vaccinate the first 4 cohorts. And I'm sure she will appreciate that those groups comprise the overwhelming majority of those who have already, alas, died from COVID. So she will readily appreciate the implications of that for our ability to reopen our economy. And she will also understand, I hope, the implications that could have, if all the conditions that I've already described are satisfied, the implications that could have for businesses across the country. So I do believe there are real grounds now for them to be very hopeful and very confident about the months ahead.
Thank you, Mr. Speaker. Mr. Speaker, we've all seen the data, and people, normal people, really understand and do understand the need for this lockdown. But like so many people across this House, so many members opposite and on these benches, I worry about our economy, jobs, businesses, mental health, children's educational attainment. So perhaps the Prime Minister could tell us how normal people in Milton Keynes and beyond, will know that things are getting better.
Prime Minister.
Mr. Speaker, I thank my honourable friend, and he's absolutely right about people's feelings across the whole country. They want a sense of when they're going to get better, and I've tried to give that today. I really think with the pace of the vaccine rollout, if it can accelerate in the way that I think everybody would want, we will reach an important moment on the 15th of February, and as I've said many times in this House, I do believe things will be much better by the spring.
Let's head up to Warrington North with Charlotte Nittles. Charlotte Nittles.
Thank you, Mr. Speaker. Special schools weren't mentioned in the Prime Minister's speech, but they'll be remaining open over the course of lockdown. Can the Prime Minister please therefore advise the House what advice and support they have received to stay open safely for the often vulnerable young people who need them, and whether SEN school staff, students and their parents will be given priority access to the vaccine to keep them safe?
Prime Minister.
I thank SEN schools, their staff, parents, pupils for everything that they're doing, and all the work that's being done, by the way, by teachers across the country to continue to look after the children of key workers, vulnerable kids as well. And the point she makes about vaccination, which is one that I think many colleagues across the House have made, bringing forward the case for this or that group. I think it's vital that we as politicians leave that to the Joint Committee on Vaccination and Immunisation, who are driven by a desire to stamp out the disease as fast as possible and to reduce mortality.
Let's head to Surrey with Jeremy Hunt. Jeremy Hunt.
Thank you, Mr. Speaker. I fully support these measures and recognise just how difficult the decisions are. Before Christmas, we were told that testing was happening at the PHE facility at Porton Down that would tell us within a couple of weeks whether the vaccines worked against the new strain. I wonder whether the Prime Minister could update us on the latest on that. And if there is a glitch with the vaccine programme, are we implementing a plan B involving, for example, mass testing of high transmission areas, deprived communities, and so on, so that we can properly isolate as quickly as possible anyone who could transmit the virus?
Mr. Speaker, there is no reason to think that any new strain of the virus is vaccine resistant. And on his point about testing, I can say that mass lateral flow testing in communities across this country will continue to be rolled out because we still believe in its usefulness.
Let's head to Brentford with Ruth Cadbury. Ruth Cadbury.
Thank you, Mr. Speaker. As my right honourable friend, the Leader of the Opposition, said, whether it's on exams, financial support, border measures or test and trace, this government seems to sit and wait for the situation to reach boiling point before it acts. However, throughout the pandemic, most other governments have acted early and with clearly communicated contingency plans. So will the Prime Minister acknowledge that the problem here is his wait-and-see leadership strategy and that he urgently needs to revise this so that the government can get a grip?
I thought I understood the Honourable Lady to be attacking the government's wait-and-see position on the vaccines, Mr. Speaker. But I really don't. Well, I really don't think that anybody in their right mind could accuse the government of moving too slowly in that respect. And indeed, I think she might add it to her script that this country has vaccinated more than any other country in Europe put together.
The great Brady.
Thank you, Mr. Speaker. I welcome the Prime Minister's assurance that this House will be consulted on the lifting of restrictions, should it be possible, before the end of March. But can I say to him that many of us are concerned at being asked to approve a lockdown which could continue until the 31st of March. Can I ask my right honourable friend to reconsider and to offer the House a vote at the end of January and at the end of February as well, not on whether to lift restrictions, but on whether to continue them or not?
Prime Minister.
Mr. Speaker, I thank my right honourable friend and just repeat what I've said several times now, that I can't believe it will be until the end of March that the House has to wait before having a new vote and a new discussion of the measures we have to take.
To Scotland with Carol Monaghan. Carol Monaghan.
Thank you, Mr. Speaker. We've had Christmas on, Christmas off, schools in, schools out, eat out to help out, stay at home. It's simply impossible to decipher the Prime Minister's COVID strategy. So given that the efficacy of the vaccines is not yet known against emerging strains, can he assure us that his strategy is not based on vaccines alone? In order to get our schools back, can he assure us that teachers will be a priority for vaccines? And could he detail his long-term COVID exit strategy?
Minister.
I think possibly, Mr. Speaker, the best thing I can say in answer to that question is to repeat that we have, and I think it's very, very important to repeat this, we have no evidence that any strain of the virus is vaccine resistant, and I think it's very important that the Honourable Lady should be express full confidence in the vaccine programme, because that is going to be indispensable to our way out of this crisis.
Jenna Davis.
Thank you, Mr. Speaker. Educating our children and giving them the best possible start in life is one of society's most important jobs, which is why I know the Prime Minister has not taken the decision to close our schools lightly. Yesterday, I spoke to the Director of Children's Services at Durham County Council about ensuring that Bishop Auckland's pupils will still be able to access learning. So on that, can the Prime Minister confirm that the government will do everything within its power to ensure that every child across the country has access to high-quality, remote education during these closures?
Prime Minister.
I thank my honourable friend for her campaigning for education in Bishop Auckland, and repeat what we've said, what I've said already today about everything that we're doing to roll out to help support remote learning of all kinds. I know it's a tough time for children, teachers and parents, but a huge amount is being done to supply remote devices and to encourage remote learning of all kinds.
Thank
Thank you, Mr. Speaker. Given the example of elections being held in other countries, including the elections held overnight in Georgia, can the Prime Minister confirm that it's his intention that the local elections in 2021 go ahead as scheduled on the 6th of May and not be delayed any further?
Prime Minister.
Of course, Mr. Speaker, that's what the law provides for, though obviously we'll have to keep it under review.
Liam.
Mr. Speaker, can I congratulate my right honourable friend on getting a world-leading vaccine strategy going? Clearly, its success will depend on both the availability of the vaccine and the number of staff to administer it. As a qualified but non-practising doctor, I've volunteered to help with the scheme and would urge others to do the same. But can I ask the Prime Minister why I've been required to complete courses on conflict resolution, equality, diversity and human rights, moving and handling loads, and preventing radicalisation in order to give a simple COVID jab? Can I urge him to get the NHS and the Department of Health to drop the bureaucracy, drop the political correctness, and do all they can to actually get the vaccine programme moving?
Prime Minister.
Well, I thank my right honourable friend. I can tell him I was fit to be tied when I read, because I read an account of what he's described several days ago, and I'm assured by my right honourable friend, the Health Secretary, that all such obstacles, all such pointless pettifoggery has been removed, and there should be absolutely nothing to stop him volunteering to be a vaccinator.
Let's head up to Blaydon with Liz Twiss. Liz Twiss.
Thank you, Mr. Speaker. The decision to close schools this week was inevitable, but we do know that it will have a detrimental effect on many children, especially the most disadvantaged. School staff across Blaydon, like those at Crookhill School in my constituency, are responding brilliantly to the challenge, but it's just not the same for children as being in school. Will the Prime Minister commit now to working with teachers, trade unions and others to plan how we can level up the educational and life chances of our disadvantaged pupils post-COVID?
Prime Minister.
Yes, indeed I will, Mr. Speaker, because we must tackle the impact of differential learning that the last 12 months have had, and we will be looking in particular at the advantages of one-to-one tuition, which I think can be transformational, not just for kids who are falling behind, but for all kids.
We now head to Wales with Stephen Crabb. Stephen Crabb.
Thank you, Mr. Speaker. Without question, one of the most important things this government did in the first lockdown was to strengthen universal credit. And that's been a lifeline, not just for people who've lost their jobs, but also for people who've kept going out to work during this pandemic. People on low wages in retail, delivery jobs, people doing cleaning jobs. Now, our plan is still to cut that support back by £20 per week in less than 3 months' time. I know the Prime Minister understands this issue, but does he agree with me that now is really not the moment to weaken our welfare safety net, and that by giving families on low incomes greater security for the year ahead by extending rather than cutting support is the right thing to do?
Prime Minister.
I fully understand the point that my right honourable friend makes, and all I'll say is that we'll of course keep this under review.
Tricia Brennan.
Thank you, Mr. Speaker. The Prime Minister will have heard across the House the concern for 3 million British taxpayers who've been excluded from support since March last year. They've had a terrible Christmas and New Year, and they're looking at another 3 months with no support at all. So it's no surprise then that their thoughts about the Chancellor's 90-second financial statement on Twitter felt like a kick in the teeth for those people with nothing. So does the Prime Minister believe that the excluded are important enough to get their own statement? And if so, when will the Chancellor be coming to this House to deliver it so that those taxpayers do not feel they are completely abandoned by this Prime Minister?
Prime Minister.
Mr. Speaker, with great respect, I don't think she could accuse my honourable friend, right honourable friend, the Chancellor, of not keeping the House informed. I'm sure he'll be using the earliest opportunity he can to update her and the rest of the House about the massive package of economic support that we're offering both the self-employed and others across this country.
Steve Batten.
Thank you, Mr. Speaker. I welcome my right honourable friend's statement that these new regulations will be reviewed every 2 weeks. But can my right honourable friend reassure me that come mid-February there will be a presumption rather than a prospect of an easing of restrictions? I understand there cannot be a cast iron guarantee. We're in a moving situation, but my constituents would like there to be a presumption, especially when it comes to schools.
Prime Minister.
Yes, I think I share her constituents' instincts. Perhaps a cautious presumption is what I would advise them to make.
Let's head up to Liverpool with Ian Byrne. Ian Byrne.
Thank you, Mr. Speaker. Ofcom estimates that 1.8 million children in our country are digitally excluded with a lack of access to equipment or broadband. And I place a bet with the Prime Minister that this does not include a single pupil from his former school of Eton. Digital poverty is a class issue. The Labour policy of universal free broadband that he denied in 2019 is now desperately needed. Can the Prime Minister outline how he will solve the issue of digital poverty, which is widening the already vast educational inequalities in this country, so not one child is left behind during this lockdown?
Prime Minister.
He'd of course know what the government is doing to roll out to gigabit broadband across the whole of the country, to give every part of the country access to superfast broadband. But in terms of the needs of people who don't have access to broadband yet, of course he'll have heard what we've said about the mobile phone, the internet providers who are coming together today to provide cut price access for those who need it across the country. I think that's the right thing to do.
Dr. Ben Spencer.
Thank you, Mr. Speaker. Once we've vaccinated the high-risk groups, so the vast majority of people who are at risk of death from COVID are protected, what will be the metrics in decisions made around moving areas down the tiers and reopening schools?
Prime Minister.
Grateful, Mr. Speaker. The metrics would be exactly the same as they were under the previous tiering system, so that we look at the rate of reproduction of the disease, we look at pressure on the NHS and the other factors that he would expect.
Let's head to Birmingham with Steve McCabe. Steve McCabe.
The weather's even worse now than it was last March, Mr. Speaker. Will there be a repeat of the Everyone In initiative for rough sleepers, with the Prime Minister guaranteeing a repeat of emergency funding at least the same level as committed last March?
Prime Minister.
Mr. Speaker, I think one of the consolations of the previous lockdown was that we did succeed in helping so many people off the streets, I think about 29,000, and we will continue to do everything in our power, and I think that the Honourable Gentleman raises a very, very important issue. We'll do everything in our power to prevent people from finding themselves sleeping rough or homeless during this winter, and that remains the policy of the government.
Lucy Appin.
The vaccine is a massive achievement of which we're right to be proud, and the Prime Minister should be congratulated for all his efforts in that achievement. We must cut away all barriers to speeding up the rollout, bin bureaucracy, incentivise 24/7 working by PHE, and pay bonuses, use drive-thrus, pharmacies, mobilise troops and volunteers. Will my right honourable friend make this rollout a dynamic, can-do, logistical, British miracle, saving lives and livelihoods, and not waste a single day taking us out of this lockdown hell?
Prime Minister.
Well, I think that my honourable friend perfectly captures the mood of the country about the vaccine rollout. That is what we all want to see. We want to see a great national effort now, and she's right to call attention not just to the role of the NHS and GP clinics and GP services and hospitals, but also the vital role that can be played by pharmacies, the role of the armed services. We want to bring them all together to roll out this vaccine as fast as possible, and the picture she paints is entirely correct.
Let's go to Scotland with Martin Day. Martin Day.
Thank you, Mr. Speaker. Surely those who cannot work because of government restrictions should be compensated and supported. So given that the Chancellor has said that coronavirus restrictions could continue for months to come, will the Prime Minister commit to continuing furlough for as long as is needed and extending sector-specific furlough payments to the hardest hit sectors? And will he ever do anything for the 3 million who have been completely excluded from any support?
Prime Minister.
Mr. Speaker, they have not been excluded, and we continue to support people across the country. Furlough will indeed be continued for further, as he knows, and he should just bear in mind what I said to his right honourable colleague. It is thanks to the might of the UK Treasury, the fundamental strength of the UK economy, that we're able to make this support available across the whole of the UK.
Let's head to Essex with Stephen Metcalfe. Stephen Metcalfe.
Thank you, Mr. Speaker. Can I thank my right honourable friend for his statement and commend him for his actions? It's obvious our clearest way out of these restrictions is to deploy the vaccine at speed and scale to protect those most of risk of serious illness. Will you therefore lay out plans not only for the first 4 groups in the JCVI list, but also how we intend to get the vaccine to other key groups that keep our country running day to day, such as teachers, police officers and home carers?
Prime Minister.
Well, my honourable friend, thank him. Well, we will have studied the JCVI's list of priority groups, and we will be setting out indeed, my honourable friend, the Health Secretary, will be setting out a programme for rolling that vaccine out, or those vaccines out, beyond the first 4 that I've already described.
Let's head up to Manchester with Jeff Smith. Jeff Smith.
Thank you, Mr. Speaker. My constituent Ross has had no work since the first lockdown and is one of the people who've fallen through the gaps in the self-employed support scheme. His only income now is £598 per month universal credit. His rent, council tax and bills are £590 a month, so he's living on £8 a month. Could the Prime Minister live on £8 a month? And if not, will he ask the Chancellor to look again at how we can help the people excluded by the self-employed support scheme?
Prime Minister.
Well, Mr. Speaker, I know that this has been raised many times already today by members across the House, but I must repeat what I've said. The 13.7 billion has gone to support the self-employed already. Further measures, I've no doubt, will be forthcoming, but the overall package of support is £260 billion across the whole of the country.
Heading down into Cheshire to Esther McVeigh. Esther McVeigh.
The Prime Minister will know that blue-collar conservatism was instrumental in persuading the supermarkets to return the business rate relief that they did not need. We asked them to do this on the basis that there are many who have gone without support during this pandemic, and it was on that basis that they returned that money. So will my right honourable friend ensure that that £2 billion returned by the supermarkets will go to those who have not had any of the support so far, who have been excluded, because they cannot go another 3 months without any income?
Prime Minister.
Absolutely, Mr. Speaker, and I thank her and her fellow blue-collar Conservatives for that initiative. I think it was entirely right, and I think that those corporations, those supermarkets were entirely right to return that cash. But I can tell her that overall, when you look at the government's support packages, they go overwhelmingly towards the poorest and neediest in society. They are fundamentally a very, very progressive package of measures.
Remaining in Cheshire with Derek Twigg. Derek Twigg.
Mr. Speaker, cancer treatment has again been delayed. Even a 4-week delay is associated with increased mortality. Many cases were delayed longer than 4 weeks in the first lockdown. Today, Mr. Speaker, the Health Service Journal reports that the NHS is having difficulty in agreeing payments with private providers for surgery and treatment. Will the Prime Minister take action to stop any profiteering and ensure private providers use their capacity for NHS patients requiring urgent surgery, and urgently bring a detailed plan to this House on how the government intends to ensure that cancer patients get the treatment they need in good time?
Prime Minister.
Yes, Mr. Speaker, I certainly can. One of the reasons for wanting to keep COVID under control in the way that we hope to do with this lockdown is, of course, to allow the NHS to continue with cancer treatment and other vital services. And he makes an excellent point about the need for all provision now to be dedicated to fighting COVID or providing essential services for the British public. And he can expect to hear more about the way in which we intend to cooperate with private providers.
Let's head to North Wales with Rob Roberts. Rob Roberts.
Thank you, Mr. Speaker. So far, Welsh Government has had an additional £5.3 billion in additional funding for COVID, but is still sitting on more than £1 billion in unallocated money, while my businesses in Delyn are in serious danger. Can my right honourable friend apply any pressure on the Welsh Government to provide more assistance to Delyn businesses, or could those funds be reclaimed by UK Government so that we can step in to help businesses where Welsh Labour is letting them down?
Prime Minister.
Well, I think my honourable friend raises a very, very good and important point, and he is right to take that up with Welsh Labour, to hold them to account, and to insist that the Welsh Government spends that money where it needs to be spent.
Let's head to Leeds with Hilary Benn. Hilary Benn.
Thank you very much, Mr. Speaker. Can the Prime Minister tell the House when every child in my Leeds constituency and across the country will have access to a laptop, and when every parent who needs help will be able to afford the necessary broadband or phone charges so that their children can connect up to their lessons, their teachers and their classmates? And who should they contact if they can't?
Prime Minister.
Mr. Speaker, he's raising the very important needs of his constituents in respect of broadband connectivity, of laptops, and I totally understand their concerns. I think obviously we're massively expanding those and rolling them out, but I think for the detailed answer that he needs about each of his constituents and of those in need, I will have to write to him, if I may, setting out exactly when they can expect the help that he's talking about.
Sir Edward Lee.
I thank the Prime Minister for listening to our representations on keeping places of worship open. And doesn't this show how, if we work together with a pragmatic approach, we can reopen the economy sensibly? And on this scene, many of us who will vote for the government tonight, out of loyalty or because we want to preserve the government's authority, are worried that with every successive lockdown, they are less and less effective, because whilst every death is tragic, young people will have noticed reports that out of a population of tens of millions, only 400 have actually died who are healthy between 16 and 60. So will the Prime Minister tell people like me in these priority groups that there has to be an element of self-reliance, self-isolation, and actually looking after our own health, and we can't just rely on successive lockdowns? And particularly with the point of carers, I noticed that the Gainsborough testing centre was turning away people who were not showing symptoms. Surely we want to encourage all carers of all elderly people to go in and be tested. So let's get rid of all these bureaucratic hurdles and get more reliance on self-reliance.
Yes. Well, my honourable friend is absolutely right that we need to encourage people to go ahead and be tested, and I think he should encourage all the people of Gainsborough to do that if where they have symptoms. And as he will know, there are initiatives available for community testing with lateral flow testing that I think should be encouraged by colleagues across the House. I know are being encouraged by colleagues across the House. I totally support that. But I also think that the British public and this House overwhelmingly supports measures to protect the NHS and save lives. And you know, he makes a valid point about the way that coronavirus impacts on the population. It does fall disproportionately on the elderly and the vulnerable, but those lives must be saved where we possibly can. And I think that is what people of all generations in this country want to do.
Mr Speaker, can I thank the Prime Minister and Government for all their help that they've given so far over the last 9 to 10 months. But however, can I highlight the aviation and the aerospace sectors, which have almost entirely shut down since the beginning of the pandemic. And as of the 4th of January, UK flight volumes were 73% below the pre-crisis levels. There are now legal restrictions on travel, and some countries have banned any arrivals from the UK. This is having a catastrophic effect an impact upon aviation and aerospace and the millions of jobs that rely on them. Yet these industries have received no sector-specific support, unlike others such as hospitality. In light of the unique impacts being felt by these sectors, could I ask the Prime Minister to provide sector-specific support to aviation and aerospace to see them through this very deep crisis?
Este.
Well, the Honourable Gentleman has raised this with me before, and he's an ardent campaigner for aerospace, and he's quite right, it's a vital industry for our country. As he knows, we have time to pay in other packages of support, but we will be ensuring that we do everything we can to get the aerospace industry in the UK back on its feet as fast as possible.
Thank you, Mr. Speaker. Every vaccination jab in the arm should be viewed as a pupil who can return to the classroom. And it's absolutely vital that we view it with that equation. Can I say to the Prime Minister, I've not always followed him through the division lobbies on these restrictions, but I will do so today, because it's absolutely clear to me that the vaccination changes the game and rids us of this pandemic. But can I ask him to ensure that the vaccination is available to the rural areas, such as the one that I represent in rural Rother, where we don't have the GP network or indeed the hub in place as of yet?
Well, I'm really grateful to my honourable friend for his support and for what he has just said, and we want to roll out the vaccine across the whole of the country as fast as possible. I think it is, I hope, common ground in this House today that we are right as a country to be putting those jabs in the arms of those who are most at risk of mortality first, because that is the way to reduce the death toll, and that indeed is the way that we hope to get our country back on its feet as fast as possible.
To Twickenham with Munira Wilson. Munira Wilson.
Much, Mr. Speaker. We're now in a race against time to save lives, save jobs and restore our freedoms, which is why we need a 24/7 vaccination programme, bringing vaccination to every high street in the country. So I welcome the Prime Minister's comments about the role of community pharmacy. Will he confirm that it's not just a few big chains that will be involved, but the thousands of independent community pharmacies, such as Goods Chemist in Twickenham, who stand ready, waiting and able to vaccinate, but have been knocked back? They will provide vital capacity and be able to reach people that other mass vaccination hubs cannot reach.
Well, I must say that the Honourable Lady is absolutely right to draw attention to the potentially vital role of community pharmacies. There are about 12,000 in this country, as I'm sure she knows. In my experience, they're great places. They're hygienic. The staff are knowledgeable. They're professional, and I think they can. We've already signed up hundreds to the campaign, and there'll be many more. I can assure her to follow.
Speaker, I think it is exceptionally welcome that the UK has consistently tested more people than any other country in the world. And I think that this House owes a debt of gratitude and thanks to Kate Bingham and her team for procuring the vaccine at such large amounts and such diversified quantities, something that the EU vaccination scheme never managed to achieve. So can the Prime Minister just reassure me and the members of the South West that we will see the vaccine rolled out and that the lockdown will not be extended beyond any necessary point than it needs to?
Yes, indeed, Mr. Speaker, and I thank him for his words about the vaccine task force, which, as I say, was satirised by the right honourable gentleman opposite, which I think was a mistake. And we will do everything we can to roll out that vaccine to his constituency and all constituencies across this country.
Thank you very much. Mr. Speaker, on Sunday, the Prime Minister came on national television and, looking into the eyes of the British people, announced and told worried parents that it was perfectly safe for them to send their dearly loved children to school. The following day, after being buffeted around by scientists, the opposition leader and devolved governments, he announced that it was not safe for children to go to school and promptly closed them all down. So does the Prime Minister agree that these constant last-minute U-turns and this erratic approach to policy making is not conducive to assuaging anxious people who are desperately seeking stability, certainty and assured leadership?
Prime Minister.
Well, Mr. Speaker, I really must ask the Honourable Gentleman opposite to withdraw what he's just said, because I did not at any stage say that schools were not safe. That is absolutely not what I said. And he, in all fairness, he should correct that. And I give him the opportunity to do so if he chooses to.
The Prime Minister closed down schools, so therefore they are not safe for people to return.
I think it's now on the record the Prime Minister's actually put what he did say on the record. Right, let us move on to Craig Whittaker in Calder Valley. Calder Valley, Craig Whittaker.
Thank you, Mr. Speaker. I've been contacted by several dentists and dental assistants who've been told locally that they do not qualify as health workers for early priority under the vaccination rollout. I am aware that my honourable friend, the member for Mole Valley, a dentist himself, has campaigned tirelessly for dental teams to be in Category 2 with other healthcare workers. I wonder if my right honourable friend, the Prime Minister, can advise for clarity whether dental teams are in fact in Priority 2 with other healthcare workers for the vaccination rollout.
Well, like my honourable friend, I'm a big fan of our colleague, the member for Mole Valley, the great dentist, and I can tell him that all dentists in patient-facing roles and members of their dental teams who may have social contact with patients are eligible to be offered the COVID vaccine, and we encourage them all to take it if they're offered it.
Let's head to Dame Margaret Hodge. Dame Margaret.
Thank you, Mr. Speaker. My local hospital, Queen's, is one of many hospitals that is facing critical pressures with the supply of oxygen to patients. Demand for oxygen is running at 100% or more of the supply available. Will the Prime Minister assure me and my constituents that action is being taken to ensure safe and secure supply of oxygen? And can he tell me what contingency plans he has in place so that hospitals aren't overwhelmed and closed, critically ill patients aren't moved, and every patient receives the right amount of oxygen when they need it?
I'm very grateful to the Right Honourable Lady, and I will immediately look into the matter she raises about oxygen at Queen's Hospital. It hadn't been drawn to my attention before, but we'll be making sure that we get back to her as soon as we can.
Let's head to Hampshire with Damien Hines. Damien Hines.
Thank you, Mr. Speaker. And of course, the invisible shield goes first around the most vulnerable, and it's the JCVI that determines that sequence. But once the highest risk groups have been vaccinated, can I encourage my right honourable friend with the JCVI in looking again at prioritising key workers, including teachers, because of the special role that teachers play in our society and because we prioritise education?
I fully understand the point that my right honourable friend makes, and I'm sure that it will be borne in mind by the JCVI as they continue to make their judgments.
Let's head up to Lancashire with Cat Smith. Cat Smith.
Thank you, Mr. Speaker. The Chancellor announced a financial support package via a 90-second video on Twitter yesterday, but with him not coming to the House, it does make it very difficult for us to ask questions, so perhaps the Prime Minister can help. Yesterday's announcement on grants didn't say how long this new one-off grant support is intended to last, so perhaps the Prime Minister can tell us what will happen on business support should the current lockdown have to be extended or the vaccine rollout delayed.
Mr. Speaker, I think the Chancellor was very clear about the £4.6 billion with its consequentials that he announced to the House, and I really must say I don't think that anybody could fault the Chancellor for his willingness to come to the House and explain what we're going to do.
Let's head up to Rutland with Alicia Kearns. Alicia Kearns.
Thank you, Mr. Speaker. Would the Prime Minister join me in thanking the extraordinary efforts of the armed forces, especially those in Rutland and Melton, to defeat this virus? But at this time of national crisis, some of our enemies are seeking to exploit opportunities to undermine us. So can the Prime Minister reassure me that our vaccination programme will extend to our armed forces personnel and reserves most at risk from catching COVID in the course of their duties, especially those deployed abroad on mission-critical operations, so that their safety and ours is protected?
Minister.
Well, I thank our armed forces from the bottom of my heart, and I share very much what she's just said. They've played an outstanding role throughout this pandemic, moving patients to hospital where that was necessary from remote places, conducting testing, and now playing a big role in vaccines as well. And I'm sure that they're, like every other part of the public sector, they will be considered by the JCVI as they come to make their decisions about the allocation of the vaccine.
Let's head to Hackney with Diane Abbott. Diane Abbott.
Thank you very much, Mr. Speaker. The Prime Minister will be aware that as school lessons move online, for poor families in areas like Hackney, the cost of pay-as-you-go broadband is completely prohibitive. He's talking about coming to cut price arrangements, but what so many families need is access to free broadband, an excellent policy which was in Labour's 2019 manifesto. No child should be deprived of an education because their parents can't afford the broadband costs. So will he look again at the question of providing free broadband when it comes to accessing online education?
Minister.
Yes, indeed, Mr. Speaker, but I think the arrangements that are being put in place by the mobile phone companies and others will cover the vast bulk of the cost at the very least. But I'm happy to come back to about exactly what is being offered.
Let's head to Somerset with Ian Littlegranger. Ian Littlegranger.
Thank you, Mr. Speaker. In the Bridgewater and West Somerset constituency, we do accept that lockdown was vital, and we do appreciate, Prime Minister, the extra help for businesses. But will my right honourable friend urge you to consider the way government help for local authorities is being paid? Somerset County Council has been given huge grants and then diverted much of the money to balance their books, which I don't think is what this was ever for. These cowboys want to become a new unitary authority. It is a contract using that cash that was meant to fight COVID. Prime Minister is Somerset born and bred, and I please urge him to put a stop to this so that the money is going to the people that need it most, which is the people of Somerset.
Well, he's quite right. My honourable friend is absolutely right to highlight what's going on in Somerset, where the county obviously has a duty to use COVID grants for that purpose and not for any other. And I thank him for drawing attention to what's going on.
Let's head up to Scotland with Alan Smith. Alan Smith.
Thank you, Mr. Speaker, and Happy New Year. To govern's to choose, and there's been a lot of tough decisions made by the UK government, and we've supported a number of the business support mechanisms that have been announced. But according to the House of Commons Library this afternoon, the UK government has chosen to spend £3.3 billion of borrowed money on the stamp duty freeze, which is a vast subsidy to the middle classes who are buying and selling domestic property who don't need subsidy. Does the Prime Minister regret prioritising that and excluding so many people, small companies, freelancers in the productive economy who do really need support?
Minister.
Mr. Speaker, that's entirely to upside down and misrepresents what the package of support has done. If you look at the £260 billion, it is overwhelmingly progressive and it goes disproportionately to support the poorest and neediest in society. And that's what I think this House and this country would expect.
Let's head to the Deepings with Sir John Hayes and wife.
Thank you, Mr. Speaker. Millions of Britons live in remote rural places, including many here in Lincolnshire. The Prime Minister will know that isolation fuels fear, which exacerbates disadvantage. So he will know too that only vaccination will bring the safety that assuages those fears. Will the Prime Minister reassure my constituents that local doctors' surgeries will be equipped and supplied enabled to vaccinate the vulnerable, not later, but sooner?
Yes, it's our intention, and Mr. Speaker, that doctors' surgeries, which clearly play a crucial part in the vaccination programme, will be equipped as fast as possible with supplies of the vaccine, as plentiful, I hope, as the copies of wisdom that I see adorn my honourable friend's shelf. That's what we intend to do. And I may say how delightful it was to see his wife Susan briefly in the background.
Let's head to Yorkshire with Imran Hussain. Imran Hussain.
Thank you, Mr. Speaker. When the Chancellor announced his support schemes for businesses and workers last year, I repeatedly warned him that their coverage did not go far enough and that many people in Bradford would be unfairly excluded, putting jobs, businesses and the livelihoods of the self-employed at risk. Will the Prime Minister therefore listen to my calls and the calls of campaign groups like Excluded UK to ensure that the same mistakes are not made and guarantee that everybody in Bradford who needs financial support during these difficult times will get it?
Yes, of course, Mr. Speaker. We will listen to the calls of Excluded UK as we listen to all such calls. And I repeat the message that I've been making today, that the support packages are there to help businesses protect jobs and livelihoods across the country, but they benefit disproportionately the poorest and the neediest.
Sir Christopher Cho.
Mr. Speaker, can I ask my right honourable friend what the public health justification is for criminalising gatherings held exclusively between those who have already been vaccinated for more than 3 weeks, where there is no risk of infection or transmission? Will my right honourable friend use his libertarian instincts and immediately introduce an exemption for such gatherings so that the many people in my constituency in the octogenarian group will be able to celebrate Brexit sooner rather than later?
I don't think any power on earth is going to prevent my right honourable friend from celebrating Brexit, but his iron logic is of course applied to the restrictions which we've been forced to bring in. And all I can say, Mr. Speaker, as I think most members across this House understand, is that the whys and wherefores of each restriction are not necessarily susceptible to iron logic, but cumulatively they are there to protect the public, and I believe the public understands that.
Sent to South Wales with Alex Davis-Jones. Mr. Davis-Jones.
Diolch, Mr Speaker. The Prime Minister will be aware that the Welsh Labour Government has committed to providing the most generous financial package available to businesses across the UK. Sadly, in Pontypridd, even the very best support available hasn't been able to prevent mass redundancies and business closures. My constituents could have been helped if this Tory government had stepped up to the plate sooner and committed to the Union when Wales went into an earlier lockdown. Could the Prime Minister therefore explain why Wales continues to be an afterthought and what steps he will be taking to prevent people in Pontypridd from being excluded from any future support?
Well, Mr Speaker, Wales is actually at the forefront of our thoughts and continues to be. We're anxious to continue to support the people of Wales in any way that we can. I think the salient point that I take from today is there's £1 billion that the Welsh Labour government has failed to spend in the way that they could, and I would urge them to get on and do that. But the UK government will continue to support Wales as we support the people of the whole United Kingdom.
Let's head to Norfolk with Jerome Mayhew. Jerome Mayhew.
Mr Speaker, in Norfolk, those most at risk from COVID have already received 27,000 vaccination first injections since the 9th of December. They're now available in our hospitals and 11 primary care networks, including the excellent Fakenham medical practice in my constituency of Broadland. From Monday, these sites will be joined by many others. We're ready to do whatever it takes to keep up with vaccine supply. So what are the chances of securing more than 2 million doses of vaccine per week?
Mr Speaker, I thank him for what he's doing to campaign for vaccines in Broadland and indeed to scale up at speed across the country. I've said what I've said about the pace of the rollout that I want to see. That's already, as I think the Health Secretary would confirm, extremely challenging for our GPs, for our hospitals. It's a big target. It's a big ask of the country. And as he will know, because he may have heard me say this several times already today, this government has been going faster than any other country in Europe, and we intend to remain out in front.
59 is withdrawn, so we're going to David Jones in Wales. David Jones.
Thank you, Mr Speaker. In March last year, the government and the devolved administrations very laudably adopted a united response to the pandemic with a clear, jointly agreed message that was easy to communicate. But since then, they have pursued different approaches with different terminology and different messaging, which can, and I believe does, lead to confusion. So could my right honourable friend please work with the leaders of the devolved administrations by following the example of the 4 chief medical officers who have worked closely together and returning to the consistency and clarity of messaging that prevailed last March?
Well, I think that my right honourable friend makes a very important point about the occasional dissonances between the UK government and some of the devolved authorities, though actually, if you look beneath the political surface, you look beneath some of the argy-bargy that goes on, the fundamental message is the same. And I think it was very telling that the 3 devolved administrations and the UK government came together to enact the same, fundamentally the same package of measures at the same time yesterday and today.
To Cambridge with Daniel Zeichner. Daniel Zeichner.
Thank you, Mr Speaker. I've listened closely to the Prime Minister, but at no point have I heard him apologise to education leaders, teachers, students and parents for the chaos earlier this week. He rightly asks the public to change our behaviours, which is in all our interests, but there is a reciprocal obligation on him too. So what does he learn from all this, and what will he do differently in future?
Mr Speaker, I certainly wish to pay tribute to everybody involved in the education sector, the teachers, parents, pupils, everybody who's made a heroic effort to cope with this pandemic. And I think perhaps what he and I would agree on, that it was important to do everything we could as a country and the government to keep kids in schools if we possibly could. And indeed, I believe that was the policy of the Labour opposition, at least on Monday morning. And indeed, I understand why the opposition wanted to keep schools open. We all wanted to keep schools open. Alas, the pandemic has not made that possible, and we've got to take the steps that we've taken. I hope that he will also support them.
Let's head to our mission with Dame Cheryl Gillen. Dame Cheryl.
Thank you, Mr. Speaker. PHE data shows that younger adults with learning disabilities and autism are up to 6 times more likely to die of COVID. Please, can they be added to the priority vaccination list immediately? And during previous lockdowns, vital exemptions included being able to exercise more frequently for autistic people. These were incredibly important in helping them cope and continue to have that much needed routine in their lives. Will the Prime Minister confirm that these will apply for the new lockdown so that autistic people are not left stranded? And will he commit to accessible information about this being published as soon as possible?
Yes, indeed, I will, Mr. Speaker, to commit to better and fuller information if that is necessary. Though it is, of course, as she knows, a general principle of these restrictions that people have more freedoms when they need to exercise for health needs.
Let's head to Devon with Ben Bradshaw. Ben Bradshaw.
Thank you, Mr. Speaker. If, as reports suggest, the government intends requiring people arriving in the UK to have a negative PCR test within 72 hours of their arrival, how will British people currently abroad in areas where it's difficult to get quick turnaround PCR tests get home? And I should declare an interest.
I think that the people of this country would want to see, as I do, proper protection, as I believe that the benches opposite want to do, see proper protection against the readmission of the virus. And I'm sure the honourable gentleman understands that too.
Let's head up to Burton with Kate Griffiths. Kate Griffiths.
Thank you, Mr. Speaker. I recently had the chance to volunteer at our local vaccination centre, hosted by Burton Albion Community Trust. And I'm grateful to the work of Dr. David Atherton, chair of our local primary care network, and all his colleagues involved in the rollout of the vaccine to residents across Burton and Uttoxeter. Can I ask the Prime Minister to consider the consent process when looking at ways of speeding up rollout? At the moment, I'm advised that individual consent by a healthcare clinician takes 10 to 15 minutes. This means 41,000 hours to consent and vaccinate the priority groups in East Staffordshire alone. Will the Prime Minister consider a national consent model to help speed up this process?
My honourable friend makes a very interesting suggestion, and but I should stress that we have no plans to make vaccines compulsory in this country. However, we want to make it as smooth and as easy as possible, which I think is her objective, and I think she would join me in wanting to encourage everybody who is offered a vaccine to take it up as soon as possible.
With Pete Wishart. Pete Wishart.
And thank you very much, Mr. Speaker. I wonder if the Prime Minister's had a cursory glance at Scotland and seen the massive approval ratings for our First Minister in her handling of the COVID crisis. And has he observed the clear leadership she has offered our nation? Does he ever sort of think about comparing his poor performance with her and wish that he could offer the same type of leadership to the UK?
Mr. Speaker, I must confess I haven't given that particular matter any thought because I've been occupied entirely with protecting the NHS, fighting coronavirus and saving lives, and I might respectfully say that is what should be his priority as well, rather than these, if I may say, slightly abstract political considerations.
Remaining in Scotland with Douglas Ross. Douglas Ross.
Throughout this pandemic, the UK government have provided the Scottish government with billions of additional support, but we know hundreds of millions of that remains unspent. These are vital funds that could help to protect jobs and support businesses. So is there anything further that can be done to encourage the Scottish government to get these monies out to Scottish businesses as quickly as possible?
I think the best thing I can do is encourage my honourable friend in the excellent work that he is doing in holding the Scottish Nationalist Government to account, and encourage them to get on and use the funds that the UK government is giving the people of Scotland to support jobs in Scotland.
Heading up to Yorkshire with Alex Sobel. Alex Sobel.
Thank you, Mr. Speaker.
I'm sure the Prime Minister will agree that councils have borne the brunt of COVID, and particularly during lockdown have given all our communities maximum support. Leeds has incurred £40 million of additional costs as a council, not covered by the grants the government have given, and will now face further lockdown costs and have an overall £100 million budget shortfall, in main part caused by years of central government underfunding. Will the Prime Minister speak to his good friend the Chancellor to grant local councils a one-off payment to offset the additional costs incurred by COVID-19 to ensure the financial stability of councils this year and next?
Prime Minister.
Of course, Mr. Speaker, I know that many councils find themselves under great pressure, though some have handled their budgets better than others. We've given 4.6 billion, I believe, to support local councillors. We'll continue to support them. And I thank, by the way, the staff and the workforce of councils for the huge and vital role that they all help to play in fighting this disease.
Teresa Phillips.
I received a worrying call this morning from the chair of the Barnet Council Health Overview and Scrutiny Committee, indicating that it may be that only 13 care homes in the borough have received vaccinations. Will the Prime Minister intervene to make sure the frail elderly and their carers in Barnet get the vaccinations they need as soon as possible?
Prime Minister.
Yes, Mr. Speaker, I will. I think since I've said that I want to have maximum transparency, I think I can. I do want to see an accelerated rollout of vaccination in care homes. So far, I believe that 10% of care home residents and 14% of care home staff have received the vaccine, but that clearly needs to be stepped up.
Let's head to the Ronda with Chris Bryant. Chris Bryant.
Thank you very much, Mr. Speaker. It's been great to see vaccination already starting in the Ronda, but obviously we can only give it when it arrives. And the Prime Minister quite rightly said earlier that we should be prioritising for the vaccine those who are at risk of mortality. Well, Rhondda Cynon Taf has the highest, unfortunately, the highest rate of death per 100,000 of any local authority in the country. We have a very large percentage of people who are extremely vulnerable, and we have a higher than average percentage of people who are working in the NHS. So can I urge the Prime Minister, as a matter of urgency, to prioritise communities like the Rhondda and make sure Rhondda surgeries are not just getting 70 or 80 doses of vaccine a week, but hundreds, so that we can vaccinate everybody at risk?
Well, he makes an eloquent point about the way in which many people in the Rhondda will naturally fall into the high qualifying groups to be identified, or that already have been identified by the JCVI.
We now head up to Yorkshire with Jason McCartney. Jason McCartney.
Thank you, Mr. Speaker. I welcome the Chancellor's £4.6 billion in new lockdown grants, but can the Prime Minister please look again at more support for hospitality, pubs, breweries, the entertainment industry, tourism, weddings, the self-employed and those excluded so far, and specifically maybe look at delaying the tax return deadline to help freelancers and the self-employed, and also look at extending business rates holiday and the VAT reduction, and finally look at setting up a hospitality and tourism recovery fund.
I thank my honourable friend, and I know that our right honourable friend, the Chancellor, is going to consider all measures necessary to allow the hospitality sector to bounce back just as fast as we can get them out of the restrictions that business currently faces and get them bouncing back. And that will depend, as the House has heard extensively today, on our ability to roll out this vaccine. But above all, it depends on our ability to follow the rules, the restrictions, the guidance of these measures. And I hope very much that honourable members will support them this afternoon.
In order to allow the safe exit of honourable members participating in this business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order. Okay. Order! I call the Secretary, Gavin Williamson, to make a statement.
With permission, Mr. Speaker, I'd like to make a statement regarding schools in national lockdown. The last thing any Education Secretary wants to do is announce that schools will close, and this is not a decision that the government ever wanted to take. I'd like to reassure everyone that our schools have not suddenly become unsafe, but limiting the number of people who attend them is essential when the COVID rates are climbing as they are now. We must curb the escalating cases of COVID throughout the country and prevent the National Health Service from being overwhelmed. That is why today I am setting out the contingency plans I had prepared but that I had hoped never had to implement. I'd like to thank all of our teachers, all of our education staff and our social workers for all that they have been doing to keep children and young people safe and learning. During the lockdown, early years settings remain open nationally to all, providing vital early education and childcare. Schools will be open too for those vulnerable children and the children of critical workers. Those at university will predominantly study online, although there are a small number of exceptions, including those studying medicine, healthcare and education. Unwelcome though this latest lockdown is, and I'm very conscious of the real challenges that parents are facing with their children at home, we are far better placed to cope with it than we were last March. We are now better prepared to deliver online learning. This is an important step forward in supporting children to make the progress with their education that they so desperately need, and we'll also do what we can to help their parents. I'd also like to thank all of those parents and carers who are having to step up once more to take on the challenge of home learning. We have set out clear, legally binding requirements for schools to provide high-quality remote education. This is mandatory for all state-funded schools and will be enforced by Ofsted. We expect schools to provide between 3 and 5 hours teaching a day, depending on the child's age. If parents feel their child's school is not providing suitable remote education, they should first raise their concerns with the teacher or head teacher, and failing that, report the matter to Ofsted. Ofsted will inspect schools of any grade where it has serious concerns about the quality of remote education being provided. We have also significantly stepped up the digital support we are providing to schools and parents. The fantastic Oak National Academy continues to provide video lessons for all ages across all subjects, and yesterday the BBC announced it will be delivering the biggest push on education in its history, bringing 14 weeks of educational programmes and lessons to every household in the country. Our delivery of laptops and tablets continues apace. We've purchased more than 1 million laptops and tablets and have already delivered over 560,000 of those to schools and local authorities, with an extra 100,000 being distributed this week alone. By the end of next week, we'll have delivered 750,000 devices. We're also working with all of the United Kingdom's leading mobile network operators to provide free data for key educational sites. We're very grateful to EE, 3, Tesco Mobile, Smarty, Sky Mobile, Virgin Mobile, O2 and Vodafone for supporting this offer. We've also been delivering 4G routers to families who need to access the internet. Another area where we have learnt lessons is on exams. Last year, all 4 nations of the United Kingdom found their arrangements for awarding grades did not deliver what they needed, with the impact felt painfully by students and their parents. Although exams are the fairest way we have of assessing what a student knows, the impact of this pandemic now means that it is not possible to have these exams this year. I can confirm that GCSEs, A-levels and AS level exams will not go ahead this summer. This year we're going to put our trust in teachers rather than algorithms. The department and Ofqual had already worked up a range of contingency options. While the details will need to be fine-tuned in consultation with Ofqual, the exam boards and teaching representative organisations, I can confirm now that I wish to use a form of teacher-assessed grades with training and support provided to ensure these are awarded fairly and consistently across the country. I know students and staff have worked hard to prepare for the January exams and assessments of vocational and technical qualifications, and we want to allow schools and colleges to continue with these assessments where they judge it is right to do so. No college should feel pressured to offer these, and we will ensure all students are able to progress fairly, just as we will with VTQs in the summer. I know there is understandably concern about free school meals. We are going to provide extra funding to support schools to provide food parcels or meals to eligible children. Where schools cannot offer food parcels or use local solutions, we will ensure a national voucher scheme is in place so that every eligible child can access free school meals while their school remains closed. Finally, I would like to turn to our programme of testing for the virus. There has been a brilliant concerted effort in secondary schools and colleges to deliver testing for the start of this term. And none of this work to roll this out is going to be wasted. Regular testing will take place of staff and students in school and in due course help us to reopen schools as soon as possible. Testing is going to be the centre of our plans to return children back to school, back to the classroom, back to college as soon as possible. Mr. Speaker, I never wanted to be in a position where we had to close schools again. I believe that schools should always have their gates open, welcoming children and always being at the heart of their community. The moment that the virus permits, all our children will be back in school with their teachers and their friends. But until then, we have put in place the measures we need to make sure that they continue to progress. And for this reason, I commend this statement to the House.
Shadow Secretary of State Kate Green.
Thank you and a happy new year, Mr. Speaker. May I begin by paying tribute to the Deputy General Secretary of the NASUWT, Gareth Young, who tragically died shortly before Christmas. I'm sure the House will join me in sending condolences to his loved ones and to his friends and colleagues in the Union. Mr. Speaker, I thank the Secretary of State for advance sight of his statement, but it's disappointing that he didn't make a New Year's resolution to avoid U-turns or chronic incompetence. Once again, where the Secretary of State goes, chaos and confusion follows, and it's children, families and education staff across the country who pay the price for his incompetence. So, Mr. Speaker, I can suggest a New Year's resolution for the Secretary of State, that he at least resolve to start answering my questions. Every pupil who's not in school must be able to access education. We must do everything we can to safeguard learning throughout this lockdown. And I pay tribute to everyone who's made it possible to keep pupils learning online, the incredible teachers, leaders, support staff in schools and colleges, and those like Oak and the BBC who are doing a huge amount to make learning accessible. I welcome the Secretary of State's commitment on digital devices, and I'm glad he's listened to Labour and to the charities across the country who called for zero rating of educational sites. But Ofqual estimate that up to 1.78 million children do not have access to a device. Can he guarantee that under his plans, every child who needs a device will have one as soon as possible, and that every one of those children will be able to learn remotely? And may I repeat the question that the Leader of the Opposition asked the Prime Minister earlier? Will the welcome data deal done with mobile providers take effect immediately? I welcome his comments on free school meals, and I hope he can guarantee that every child eligible for this support is already receiving it. If not, can he assure me that within days they will do so? Mr. Speaker, months ago, the Education Secretary gave a cast iron commitment that exams would go ahead. At that moment, we should have known they were doomed to be cancelled. I wanted exams to go ahead fairly, but I was always clear that there must be a plan B if that was not possible. For months there was no sign of any such plan, although the risk that exams couldn't happen has always been predictable. The Secretary of State says he will be providing support to teachers to award grades. Can you tell me when they'll receive the support, what form it will take, and confirm that it will be available in all schools? And can you tell me exactly what will be done to ensure that all grades are fair, consistent, and support pupils to move on in their education or employment? I heard what he said about technical and vocational exams. But frankly, he's failing to show leadership on the exams taking place in January. And he's leaving it simply to schools and colleges to decide what they should do in difficult circumstances. Will he now do the right thing and cancel this week's BTEC exams, as parents, colleges and the Association of Colleges are calling for? Mr. Speaker, staff in every part of our education system have faced a hugely challenging job and done extraordinary things to keep children safe and educated throughout the pandemic. Too often, though, the Secretary of State has refused to listen to their concerns or engage meaningfully with the expertise of professionals on the front line. He can start to make it up to them today. Is the JCVI working on a strategy to vaccinate all education staff, to keep them safe and get children back in the classroom? And does the Secretary of State believe that they should be prioritised for vaccination to keep them safe and allow schools and colleges to reopen? Early years settings remain open to all children, but the Secretary of State has failed to explain how this will be safe for staff and families. So can he tell us what scientific advice he's received that made him think they will be safe? And can he honestly say that he is following the science? And whether providers are open or closed, can he finally reconsider the unjustifiable decision to move early years funding in line with current occupancy, which will push tens of thousands of providers to the brink of collapse? Finally, Mr. Speaker, I turn to the return of schools in the months ahead. The decision to close them is not one taken easily or lightly. And while it is the right thing to do to control the virus and save lives, it has huge consequences for children's learning and development. And that's why Labour have always said that schools should be the last thing to close and the first to reopen. But yesterday, the Prime Minister couldn't guarantee that children would be back in school before the summer. Can the Secretary of State tell us when he expects children to be safely back in the classroom? Mr. Speaker, at every stage of this pandemic, young people have been an afterthought for the government. And now we're back where we were 9 months ago, with schools closed and exams cancelled. There is time to act, but the Secretary of State must act now to ensure all pupils can learn remotely, that families are supported, and the most vulnerable are safeguarded.
State.
Well, thank you, Mr. Speaker, and I'd very much like to join with the Honourable Lady in paying tribute to Gareth. I had the great privilege of working with Gareth as his time as Deputy General Secretary of NASUWT, as well as his colleagues there, and very much our thoughts and prayers are with his family and also his friends and colleagues. The Honourable Lady raises a number of very important points. The rollout of digital devices, our commitment to deliver 1 million digital devices across the country. We'll be getting 750,000 of those devices out by the end of next week, supporting schools, delivering on their full allocation of devices that they need, and looking at how we can go further. It's been a great privilege to work with those brilliant teachers, inspiring leaders who and helped fund and support them in setting up the Oak National Academy, a brilliant online school that is actually being viewed not just right across this country, but right across the world for the quality of teaching. And we want to see that used more and more as a vital teaching resource. The Honourable Lady is right to raise concerns about free school meals, how important this is for every one of our constituents. And that is why we're putting the funding and support in place, because there's many parts of the country where it will be best for those schools and they want to deliver those free school meals themselves. In other parts of the country, they won't be able to do that and will want to do it as part of a national voucher scheme. That is why we'll be standing that up over the next few days and making sure that schools are not out of pocket, but most importantly of all, that children and families are supported at this incredibly difficult time. And she asks about whether there'll be support for teachers in terms of the training and the guidance and the help across the country as we move to teacher-assessed grades, and I can absolutely confirm that that will very much be the case. We've always been aware that there could be a situation where we would not be in a position to be able to proceed with examinations. But we've always had a clear view that the best way of assessing children is through examination. So I will not apologise for being enthusiastic to ensure that we have been able to be in a position to roll out exams. But we do recognise where we are as a result of this pandemic, we have to take a different course. And that is why we're taking the route that we are. And the Honourable Lady raises about technical and vocational qualifications. And as the Honourable Lady will know, it's very important that we give colleges, schools and providers, all providers, including independent providers, training providers, the flexibility. Because there's a lot of young people who will actually need to complete some of their professional competency qualifications in order to take up work and job opportunities, whether that is those who are doing electricians courses or gas courses, where they actually do have to do practical assessment in order for them to be able to get the qualifications to take the work and the jobs and the opportunities that we want to ensure that the door is kept open for them. So that is why we've taken the decision to give providers the discretion, because they will be the ones who best and most accurately understand the needs of their students and those who need those qualifications, possibly to be able to progress into a job that they wouldn't able to do if they didn't have that option. The issue of vaccination. The government has already set out the important need to vaccinate those who are most likely to be hospitalised, most likely to, if they catch this disease, to be the ones who will be not just hospitalised but most at risk of death. But like her, like everyone in the education community, I very much want to see all those who tirelessly every single day through the week and every week keeping schools open for those children of critical workers and vulnerable children, for making sure that when we people are getting vaccinated when schools are fully reopened again. But Coupled with this is a really important step forward in terms of the mass testing programme that we've already started rolling out in schools. The mass testing programme in schools will be one of the largest testing programmes that this country has ever seen. It is ready to go, it is ready to be implemented, and it will be an important plank in ensuring that we can get schools opened at the earliest possible opportunity. And it won't surprise the Honourable Lady, but we do listen to the best scientific and public health advice in terms of the decision to keep early years open. We all have a clear understanding of how important early years education is for every child. And as I've always said, I will do everything I can do to keep every educational establishment open if that is possible and if it's the right thing to do. And when we were given the health advice that we could be in a position to keep early years open, it's so important, not just for those children themselves, but also for families. I felt that that was the right decision to do. I do not want to see any school closed for a moment longer than it has to be. That is why in June we all worked so hard and fought so hard to ensure that schools opened right across the country for primary years. That's why during June we did so much to ensure that years 10 and 12 were able to return to school at the earliest possible opportunity. That is why in September we saw the opening of schools right across the country and all children being able to return back to school. And I can absolutely assure the Honourable Lady, I will not let schools be open for a moment longer than they... I will not let schools be closed for a moment longer than they need to be. I will do everything I can to ensure every school is open so that children are able to benefit from the brilliant teaching that goes on in so many of our primary schools, secondary schools and our colleges. Because I know that is the best place for children. That's what I want for my children. I know that's what members want for their children. But most importantly, that is what we want for our nation's children. And that is why I will give everything in order to ensure schools are the first things to be opened in every instance. Because that is what is best for every one of our children.
We now go to the Chairman of the Select Committee, Robert Halfon.
Thank you, Madam Deputy Speaker. I strongly welcome the government's laptop scheme, but we know that there still will be possibly hundreds of thousands of people on the wrong side of the digital divide. Can my right honourable friend confirm that those students who just don't have internet connection or computers at home will be able to go to school alongside children of critical workers? Could he also confirm that any centre assessed grade system will not only maintain standards but provide a level playing field for disadvantaged children, have a fair appeals process? And will he make sure that there are independent assessors, perhaps retired teachers or Ofsted inspectors, to provide a check and balance for each assessed grade awarded? And finally, I welcome what he has said about wanting to open schools again, and I know he believes that strongly. Will he do everything possible to ensure that teachers and support staff are given priority for vaccinations alongside NHS workers so we can get our schools open again sooner rather than later?
Well, the reason that we are rolling out and expanding our devices package because we realise how important that is for all children, especially for those children from the most disadvantaged backgrounds. I can confirm that as in the previous situation where we saw schools had to be closed during the months of March, April and May, children who didn't have access to digital devices were able to access education in that school. Their background, community which they have grown up in and where their learning in. And I'd be very happy and look forward to working with my right honourable friend and his committee to very much take their advice as to any additional actions that we need to undertake to ensure fairness. And we'll certainly take on board his idea and his thinking about bringing in those volunteers and those people who want to support education and making sure that the teacher assessment is fair and robust and maintains standards, but most importantly, fairness for those children who are taking those qualifications.
Now we go to the SNP spokesman, Carol Monaghan.
Thank you, Madam Deputy Speaker. We shouldn't, of course, be surprised at this latest U-turn in schools. Any student teacher knows that planning is a key skill, but it's one that the Secretary of State has yet to master. His decisions are being made in a reactionary and last-minute manner. Schools in England have predictably gone from being open with threats of legal action if they closed to being snapped shut in an instant, giving parents absolutely no time to put in place arrangements. And a word to all members, we need to be careful about this narrative of children are falling behind. They're only falling behind on a scale, an external scale that we've defined for them. We cannot use the same metrics this year as we have used before. And of course, much as we all want schools to be open, young people are learning other skills too. That said, it's good to hear that the BBC is producing educational resources. Can he confirm whether there will be resources available for the Scottish curriculum at Nat 5 higher and advanced higher level? Teachers are fed up with politicians paying tribute to them 1 minute and the next minute sending them into unsafe environments. The risk posed to children in school is small. We have evidence for that. But as the Prime Minister said earlier, pupils can act as vectors. So, and let's be clear, if a member of staff in a school catches COVID, there's increased strain on the remaining staff. So it should not only be high-risk staff who are vaccinated. Before we talk about opening schools, we need a clear position on vaccinations for teachers and school staff. The First Minister has committed to looking at this. The Secretary of State has said he will do everything he can to ensure schools open. So will he ensure that teachers are a priority for vaccination so that schools can open with confidence? And finally, on students, there are many students who are now learning at home completely and are not returning to university following Christmas, but they're still having to pay for university accommodation. What support will the Secretary of State look at giving to these young people who are having to pay out in this manner?
Thank you, Madam Deputy Speaker. It's probably interesting listening to the Honourable Lady and her comments about students, and it's probably sort of indicative as to some of the challenges that the Scottish education system has seen with them falling down PISA rankings, because it is really important that we support children to be actually able to learn. It's really important that we do everything we can do to ensure that children are in a position where they're learning about maths and English and the sciences and the arts. It seems to be indicative of what she was saying, that the SNP doesn't seem to be that interested in actually making sure that children benefit from a knowledge-rich curriculum. I'd be happy to get in contact with the Director General of the British Broadcasting Corporation on the points that she raised, and I will write back to her with those details on that. And of course, it's always a privilege to work with colleagues across all nations of the United Kingdom, and it's really important that we share what works well and what works best. And of course, I would always be happy to work with her. We've extensively funded the Oak National Academy, which has an incredibly rich curriculum resource, and I noticed from the latest figures is used by a lot of students in Scotland as well as in England, and I'd be very happy to share some of the work that we're doing to help support students in Scotland as well as students in England as well.
Peter Aldous.
Thank you very much, Madam Deputy Speaker. I welcome the Secretary of State for his statement. The economic recovery will be skills-based, and the government have quite rightly placed much emphasis on the importance of BTECs. However, there is currently worry, confusion and uncertainty in colleges and schools. Many have cancelled this month's exams, but others have not. They should not have been placed in a position of having to make their own choice as to whether to go ahead with exams. The government should have shown clear leadership so that all students across the country were in the same situation. Will the Secretary of State now work with Ofqual, the exams boards and the Association of Colleges to put in place as quickly as possible new arrangements that will provide students and teachers with certainty, clarity and confidence?
Well, as the Honourable Gentleman will have heard in my statement, that's exactly what I'd said we would do. But also, just for clarity, there are many students and there are many colleges that know for their students' future prospects that they need to complete those assessments during this month if they are going to be able to access work and employment opportunities. So no, I'm not going to go down the route that the Honourable Member suggests of actually taking that opportunity to potentially be able to access work and those opportunities away from them, because I do not believe that would be right for those children.
Daisy Cooper.
Thank you, Madam Deputy Speaker. Teachers and school staff have put themselves at enormous risk during this pandemic in order to keep schools open. Now that the Prime Minister has accepted that schools are the epicentre of high community COVID transmission, it is essential that the government gives teachers and school staff the priority access to COVID vaccinations that they deserve. So will the Secretary of State look at adding them to Category 7, as this would make teachers and school staff a top priority for vaccinations after all those who are 65 years of age and over, all those who are clinically vulnerable and our NHS and social care staff?
Well, as every stage, we have put the safety of students, of pupils, of teachers, of the whole workforce, and including the whole community, at the heart of everything we've done. And all the evidence has gone to show that the work, the precautions, the measures that have been put in place has meant that schools have been able to operate safely and well. But we will constantly work with the whole sector to ensure every measure is undertaken to ensure that that continues. That is why we're ready to roll out a mass testing programme, delivering millions of tests right across the board. This will be happening in schools as they welcome the children of critical workers as well as vulnerable children into them. But when schools fully return, when they're able to welcome all children back, the testing regime is going to be at the centre of that return.
Dr. Luke Evans.
Thank you, Madam Deputy Speaker. And I understand why there is a cancellation of GCSEs and A-levels. And I'm pleased to hear him talking about in the substitute system, it will be robust and fair. But what can you do to confirm for the young people of Hinckley and Bosworth that students will be rewarded for how they perform, that they're not disadvantaged by the school they've gone to, and also the teachers who are performing these assessments have buy-in and ownership of what they are doing in the current situation?
My honourable friend raises a really important point, and the great advantage that we do have is we have the opportunity and the time to roll out extensive training, guidance and support for those teachers in terms of making that assessment to ensure that it is accurate and fair and reflective of the abilities of that child. That is what we're going to be doing. That is what we're going to be undertaking with schools over the coming months, and we endeavour to ensure that teachers and all those working in the education system are supported in his constituency as they are right across the country.
Rachel Hopkins.
Thank you, Madam Deputy Speaker. It was irresponsible of the government to announce
announce the cancellation of GCSE and A-level exams, and to say nothing about BTEC exams without any details of an alternative plan being agreed. Students and their families in Luton South have already suffered greatly over the last 9 months and are deeply anxious about this continued uncertainty that's being created. Many students have contacted me to say they are suffering negative impacts on their mental health as a result. So I would ask the Secretary of State what plans he has to provide additional mental health support for our children and young people.
Well, of course, one of the great advantages that we've had with schools being back all the way through the latter half of last year is actually teachers and those working in schools have been in the best possible place to assess and work with children and have the best understanding of some of their needs and some of the problems that they have, including mental health challenges, and we'll be working with the education sector to best support them in terms of actually supporting. We've already taken a number of actions to supporting schools and education settings with children who have been suffering mental health problems as a result of COVID and as a result of being out of school, and we'll continue to do that and step up those measures over the coming months.
Marco Longhi.
Thank you, Madam Deputy Speaker, and can I thank the Secretary of State not just for the statement he has made, but also for the huge effort he must be putting in trying to balance conflicting priorities. So as a father to an A-level student who was hoping to take her exams this year, I can relate to the anxiety so many young people and their parents must feel in Dudley North and across the country due to the uncertainty of the situation. Can my right honourable friend assure me that he will make every effort to remove this uncertainty by bringing clarity at the earliest opportunity so students can better focus on their studies and teaching staff on the best approach to support them?
As my own daughter, who is was due to be taking her own GCSE exams later on this year, I can absolutely assure my honourable friend that I very much hope the statement today has given a clear sense of certainty and direction of where we're going. We will also be following this up with further detailed consultation by Ofqual that will be launched next week. It will be a 2-week consultation period that Ofqual will be leading, and it's very important that we do get feedback from the sector in order to be able to ensure that the details of this policy are properly understood and work best, not just for schools and colleges, but most importantly for those who are receiving the grades.
Mike Amesbury.
Thank you, Madam Deputy Speaker. Given that the company, Computer Centre, awarded the £96 million contract with no deliver all the laptop kits to vulnerable children in the first lockdown, why is the Secretary of State sticking with Tory party donors from this company this time?
Well, I'd like to take the opportunity to pay tribute to Computer Centre, who've done an amazing job of distributing hundreds of thousands of devices right across the country. The Honourable Gentleman is right to say that we did a direct award on the first contract, as Computer Centre were one of the few businesses that were in a position to be able to assist us at that time, but since then tenders have gone out and Computer Centre have won those tenders through fair competition.
Kevin Hollenrigg.
Thank you, Madam Deputy Speaker. Some North Yorkshire schools are operating a full formal timetable with checks and balances, including roll calls and marking, but some schools are not. Does my right honourable friend agree that all schools should use this kind of best practice to make sure students work as hard and as effectively remotely as they do when they physically attend school?
Well, as a former North Yorkshire County Councillor and having been on the Education Committee of North Yorkshire County Council, I absolutely do agree with my honourable friend. It's absolutely vital that we keep as much formal education in place as possible. Schools have moved forward in absolute leaps and bounds in the offer that they are able to put there. But we do recognise there has been variability, and that is why we've taken the actions that we have, including the actions that we will take with Ofsted, to ensure that there is good, high-quality remote education delivered in all of our schools right across the country.
Paula Barker.
Thank you, Madam Deputy Speaker, and I'd like to place on record my thanks to the National Education Union and Unison for the work they've been doing to keep school staff and pupils safe. In my constituency of Liverpool Wavertree, I've been inundated with enquiries from worried parents and nursery staff about nurseries remaining open and the risk that poses, particularly when elderly grandparents are often used to pick up children as part of support bubbles. And I'm afraid the narrative from the Secretary of State that this group are least at risk is not enough and doesn't instil confidence. So will the Secretary of State fully explain to my constituents why nurseries and early years settings are not closing, with the exception of providing services to key worker children?
Well, early evidence from SAGE has showed that early years provision had a smaller relative impact on transmission rate than primary schools, which in turn had a smaller relative impact than secondary schools. So that is why the decision was taken. And the Honourable lady mentions the National Education Union, and I'd like to thank both National Education Union and Unison for recognising the fact that the action that they took and the advice that they gave their members on Sunday was incorrect, and that they have withdrawn that advice. It was the wrong advice, and I'm glad that they have reflected upon it and recognised it was the wrong advice.
Tim Lawson.
Thank you, Madam Deputy Speaker. Ministers will know how bitterly disappointed I was when schools were so abruptly closed because of the impact on mental health, the attainment gap and safeguarding. So to give certainty and to enable schools to plan ahead, will the Secretary of State make the February half-term the default target date for return, barring any new crisis? And for those schools remaining open for key workers and vulnerable children, can we make sure that this time they are not turning away children on EHC plans, in particular on the basis that schools couldn't safely look after them, as I'm already hearing complaints from parents that their children who are entitled to attend are being placed on waiting lists?
My honourable friend is absolutely right to point out that children on an EHC plan are entitled and should be allowed into school and receive that care and support that school provides those incredibly important children. So absolutely, categorically make that totally clear to all schools and to all colleges as well. I would like to see schools open tomorrow, as my right honourable friend would know. I never want to see schools in a position where they're not able to welcome children, but we have had to take this incredibly difficult decision. I want to see all schools opening on the 22nd of February, but we obviously do have to take into account the scientific and health advice. But certainly, from a department's point of view and from a schooling point of view, every one of us is working towards welcoming all children back on the 22nd of February, but we obviously continue to have to listen to the advice of both the scientific and public health community as to how we continue to beat this virus.
Sarah Olney.
Thank you, Madam Deputy Speaker. The Secretary of State has made a timely decision to scrap GCSEs, AS levels and A levels, and I very much hope that we can avoid the heartache that some of my constituents suffered last year when their algorithm-adjusted grades caused them to miss out on university places that they had worked so hard for. This year, since exams are not being sat or needing to be marked, there is no need to delay announcement of grades until August. An earlier announcement will help students and parents to plan their next steps, universities to manage a fair admissions process, and will also leave time for appeals and resits. So will the Secretary of State, in his discussions with Ofqual, consider bringing forward the date at which assessment grades are released?
I think the Honourable Lady raises an important point, and it's something that I've already raised in discussions with Ofqual. We obviously have to make that judgment call in line with the whole system, and we don't want the whole system of awarding to be dictated by the date where youngsters get their grades, but it will be one of those issues that are in active consideration because, as the Honourable Lady says, it gives students more time if there is a need for appeals, and also gives them more time to make the best choices for them and for their future.
Andrew Rossendale.
Madam Deputy Speaker, the Secretary of State should know of the incredible dedication and self-sacrifice shown by teachers and staff throughout Romford and Havering since the start of this pandemic. Their determination to reorganise the schools to keep everyone safe and continue to provide the highest standard of education must be commended. But with schools now closing as part of the lockdown, they will have to do everything they can to move classes for the majority of students online to minimise the impact on their education. However, as in-person teaching will still be going ahead for vulnerable children and the children of critical workers, would my right honourable friend please clarify whether only one parent or both need to be critical workers in order for their children to continue to attend school in person?
Well, I'd very much like to join my honourable friend in paying tribute to not just the teachers in Romford, but all those support staff who open up the schools, welcome the children as such an important part of the fabric of that school community. So very much like to join him in that. And in answer directly to his question, it is one parent who is, if they're a critical worker, it's deemed that they would have access to that school place for their child.
Lillian Greenwood.
Thank you, Madam Deputy Speaker. Many of my university student constituents have contacted me because they're desperately worried about the impact COVID restrictions are having on their learning, on their research, their educational success, their future careers, their finances, and their mental health and well-being. Does the Secretary of State believe it's fair for them to continue to be paying full fees and full rent when they aren't receiving the university experience they expected? And what will he do to support those students, especially those facing financial hardship?
The Honourable Lady will probably be aware that just before Christmas, the government announced additional support for students at universities in terms of an extra package to help those youngsters that are most vulnerable, and we'll continue to work with the sector to look at how best we can support students and the sector as a whole.
Jonathan Gullis.
Thank you, Madam Deputy Speaker. I can't hide my disappointment and sadness to see school gates closed to so many students from across Stoke-on-Trent North, Kidsgrove and Tork. Remote learning has many challenges, from unsuitable learning environments to no online connectivity and not having the necessary digital devices. So will my right honourable friend continue discussions with me and the Minister for School Standards in order to get textbooks distributed to pupils from disadvantaged backgrounds so they don't fall victim to the digital divide whilst learning remotely?
Well, I've asked officials to organise a meeting between my honourable friend, the Minister for School Standards, and myself for next week in order to be able to discuss this. We all recognise what an important role textbooks play in terms of helping and supporting learning, and actually some of the brilliant work and investment that has been made in terms of producing exceptionally high quality material in textbooks. And I look forward to meeting him next week to discuss ideas about how we can get this distributed, especially into some of the communities that are most disadvantaged across our country.
Paul Blomfield.
Thank you, Madam Deputy Speaker. And can I say that I welcome the Secretary of State's U-turn on GCSEs and A-levels, late though it was, adding to the pressure on schools and teachers. I'm sorry, though, that his approach on BTECs appears to be an afterthought and an abdication of responsibility. But can I ask him about primary assessments? Because does he accept that proceeding with SATs this year would place an unnecessary and pointless burden on schools? And will he take action to cancel this year's tests and to do so in good time?
I always enjoyed working with the honourable member in terms of our work that we did with Motor Neuron Diseases Association over a number of years, and I always learned that he often speaks a lot of good sense, just sadly in the wrong party. Madam Deputy Speaker, can absolutely confirm that that we won't be proceeding with SATs this year. We do recognise that this will be an additional burden on schools, and it's very important that we're very much focused on welcoming students back into the classroom at the very earliest opportunity.
Greg Smith.
Madam Deputy Speaker, I very much commend my right honourable friend for the work being done to roll out online learning, but for a significant proportion of my constituents, there's a small practical problem that up to 13% of households either have very slow or no access to broadband at all, and mobile data is also non-existent in many villages. So what practical support can my right honourable friend offer for those pupils living in such households, competing against other members of the household trying to work or learn with no or little broadband?
This is an incredibly challenging problem for many people living in rural communities, and I'd be very happy to meet with my honourable friend to discuss as to what further measures that we could take. I'm beginning to think that some of the additional resource of textbooks and other resources that can be maybe made available to families and communities which have these acute problems, and it isn't something that we're going to be able to work around in terms of a technical solution, that there may be other routes forward. But I will ask my department to organise swiftly a meeting between himself and myself to discuss this issue and any other educational issues in his constituency.
Dr. Lisa Cameron. If we have a problem there, we'll go back to Lisa Cameron and meanwhile go to Claudia Webb.
Thank you, Madam Deputy Speaker. The pandemic has highlighted the injustice of tuition fees. Students are incurring on average of 57,000 worth of debts to be isolated in university halls and be restricted to online learning. Yet even beyond this, education must be a universal right, not a costly privilege. The last decade of extortionate tuition fees have saddled young people with debt, deterred working class people from gaining a higher education, and reduced our universities to profit-seeking businesses. Will the government take this opportunity to support students by refunding rents, scrapping tuition fees and cancelling student debt for good?
Well, the statistics would actually bear out something rather different to what the Honourable Lady said. We've seen a massive expansion of the university sector, with more young people going to university than ever before. But also, if the Honourable Lady took the time to look at the statistics and the facts, as against maybe just not basing her question on the statistics or facts, she would actually discover there's actually there's more children from the most disadvantaged families going to university, often for the first time in that family, than ever before. That's something this party should feel incredibly proud of, and I would like to see even more youngsters from the most deprived backgrounds going to some of our best universities in the country.
We'll go back to Dr. Lisa Cameron.
Many thanks, Madam Deputy Speaker. Dr. Adrian James, President of the Royal College of Psychiatry, has now described the COVID-19 pandemic as the greatest threat to mental health since the Second World War. As chair of the Health All-Party Parliamentary Group, I've been receiving concerned emails from parents right across the United Kingdom regarding mental health. So given that children have experienced isolation, trauma, and for many bereavement, will the Secretary of State now take the opportunity to announce ring-fenced funding for a much-needed mental health and wellbeing strategy for children?
Well, I'd like to thank the Honourable Lady for raising such an incredibly important point, and it would be a great opportunity to meet up with herself and other members of the all-party parliamentary group to maybe actually discuss some of these wider issues that we don't just face in schools in England, but of course face schools across the whole of the United Kingdom. And there's been various different initiatives, some UK-wide for the higher education sector that universities have done so much on, but also initiatives in England, Scotland, Wales and Northern Ireland. And it'd be really good to have a four nations approach about how we support young people with the real challenges of mental health. And I look forward to having that discussion with her, because I know that she feels passionately about this issue, as so many members of this House do. And it's very much a cross-party issue. And I very much hope that we can find some cross-party solutions on how we can best support our young people.
Bob Stewart.
Thank you, Madam Deputy Speaker. Happy New Year to you. Could I ask my right honourable friend about early learning? The Honourable Lady for Liverpool Wavertree has already raised the point, but I would rather like my right honourable friend to explain why in Bromley early learning centres, semi-schools really, are still open. And they have a real problem because all of them are privatised and there's a certain loss of income too. So it is a problem. So could I ask my right honourable friend, not that I dispute what he's going to say, could I ask for an explanation of why these places are open when primary schools are not?
Well, at every stage, I'd like to assure my honourable friend that at every stage we'll go above and beyond to keep education settings open. The Prime Minister has, Madam Deputy Speaker, many times outlined the government's commitment and priority of education. So if we're able to keep a sector of the education system open, because we know such enormous benefits are accrued, not just to the children that are in, whether it's a nursery, early years setting, or whether it's in the classroom in a primary school or secondary school, are so incredibly great. But it's also incredibly important for parents as well, and to families who often rely on those nurseries and those early years settings as well as schools in terms of supporting them. So when the advice came through, and just to reiterate it, that the early evidence from SAGE showed that early years provision had a smaller relatively impact, much smaller relative impact on transmission rates in primary schools, which again had a much lower relative transmission impact than secondary schools. We felt that it was the right thing to do, because it isn't, yes, it's about supporting the children, but it's also about supporting the families as well.
Alison McGovern.
Thank you, Madam Deputy Speaker. We all want children back in school as soon as possible, so why don't we work together to try and make that happen? With that in mind, could the Secretary of State tell me when he last met teachers' unions and what practical steps he agreed with them that the department would take? For example, acquiring more space for schools so that children and teachers can spread out. What steps did he agree to make schools even safer so that we can get children back in school as quickly as possible?
I think the Honourable Lady is absolutely right. I think where there is a shared commitment to see schools open, it's really important to work together. And I regularly meet, lots of organisations, including trade unions, on a very regular basis. I'm afraid nowadays we don't get to meet physically, and of course it is all online. But we have regular meetings, and I only just in the last week have had the opportunity to speak with a number of union leaders.
Gagan Mohindra.
Thank you, Madam Deputy Speaker. Happy New Year to you and everyone else at the House. For those students due to have sat GCSEs, ASs and A-levels later this year, we've had to make the difficult decision to cancel the exams, which will undoubtedly cause a great deal of anxiety. Can my right honourable friend assure me and the House that his department will make every effort to provide them with the vital clarity they will need in the weeks ahead?
Well, I know that my honourable friend has been sort of a great champion in terms of defending his schools and actually doing everything he can do to ensure that parents in his constituency benefit from being able to have access to their schools. But he raises an important point about the clarity. I hope that what we have set out today brings a lot of clarity. For further detailed consultation that Ofqual will be rolling out the early part of next week will be the next stage in terms of consulting schools as to these next steps. And we recognise that when that is fully completed, it's really important that we're supporting schools, the teaching profession, and of course colleges and lecturers in terms of those next steps in the awarding of grades in summer for A-levels and GCSEs and other vocational and technical qualifications as well.
Rebecca Long-Bailey.
Thank you, Madam Deputy Speaker. Despite serious safety concerns, we're told that BTECs were still going ahead yesterday, only to be told late last night that it was simply up to schools and colleges to decide if it was safe or not. The Secretary ignored education unions and organisations when they repeatedly told him it wasn't safe to fully open schools, colleges and nurseries on Monday. And nurseries are still open in full today, despite widespread anger and disbelief from the sector, nor any robust scientific evidence from the Secretary today that nurseries will not act as a vector for transmission of the virus. Safety is the Secretary's responsibility. Up to 1 in 50 now have the virus and the number continues to climb. So will he actually listen now to education unions and organisations, cancel BTEC exams, urgently take the same safety approach on nurseries that he has with schools and provide upgraded risk assessment guidance and vaccine access to all settings currently open to vulnerable and key worker children?
Well, Madam Deputy Speaker, can I just say what a delight it is to have the Honourable Member for Stretford and Urmston as Shadow Secretary of State, because at least she seems to be enthusiastic about actually having children in schools, colleges and other settings, unlike the previous Shadow Secretary of State. At every stage, and I think the Honourable Lady understands this, is that we have put the safety and the security of children and the workforce at the very heart of what we do. As the Chief Medical Officers, not just of England, but Wales, Scotland and Northern Ireland have said that actually the best place for children is in school. But we have had to take unprecedented action as a result of the Chief Medical Officer for England advising the fact that this nation has we have to move to a COVID alert level 5, and when that decision was taken on Monday to move to COVID alert level 5. It was right that additional actions were taken as reluctantly as as reluctant as I was to see us being in that position. But at every stage, and I think it is a little unfair of the Honourable Lady to imply that the safety and security of staff and children aren't at the heart of all our actions, because it is at the heart of all our actions. But we do know that children benefit from being in school. We do know that children benefit from having the opportunity to sit in front of their teacher in the classroom. So that's why, on this side of the house, we've always been so enthusiastic for schools to have children in, and I hope eventually she'll become a convert to that idea herself, as her successor has.
Joy Morrissey.
Madam Deputy Speaker, last year the approach to GCSEs and A-levels meant that private candidates such as home-educated children were unable to obtain a grade. Can my right honourable friend confirm that this year they will be able to do so?
I know that my honourable friend will be speaking not just for many of her constituents in the question that she asked, but actually for many thousands of youngsters right across the country who will be really worried about this. I have asked Ofqual to take up this issue, to look at it directly, and to make sure that there are measures in place so that those students are going to be in a position where they're able to be in a place where they're able to get a grade. I've asked Ofqual to include it as part of their consultation, which they'll be doing next week, and we've already discussed as to how this can be done and believe that it will be possible to do so.
Alex Norris.
Thank you, Madam Deputy Speaker. The Secretary of State clearly prefers testing rather than vaccination as the means to making sure our teachers and learners will be safe when schools can reopen. Now, the Prime Minister wants that to happen in 6 or 7 weeks' time. To have an adequate testing regime in every school by that period will require working round the clock, every minute available between now and then. So the Secretary of State confirms to me that every school in my constituency has the access to the support they need to make sure that such a regime will be in place in time.
So we've already seen the mass distribution of testing kits and all the equipment that is required in schools and colleges where they're taking years 7 and above. We will be looking at how we can roll out testing beyond secondary schools into primary settings and those earlier years to support staff as well. But actually, I think the honourable gentleman may sort of, I'm as enthusiastic about vaccination as he is, but we're very much forward with our programme in terms of mass testing for children, with all secondary schools receiving the initial deliveries and all schools will be getting that level of support in secondary settings, and we're looking at expanding that in primary settings as well, and that would include all his schools in his constituency as well as all of our constituencies.
Order. I appreciate that the Secretary of State is giving thorough and detailed answers to a great many questions, but we've already taken up more than an hour, considerably more than an hour in the statement. I still have 13 more people to participate, and I would like to give everyone the chance to ask their question, but I must ask them to not make speeches or statements, just ask a question, and if it's a short question, then the Secretary of State will be able to give quite a short answer. Anne-Marie Morris.
Madam Deputy Speaker, Secretary of State, the future of the country is very much in your hands. Children are our future, and I'd like to pay tribute to my local schools who have risen to the challenge and continue to deliver an exemplary education. But closing schools is one thing. What is your plan to open them? What are your criteria? It can't be ending lockdown given the devastating effect on children's mental health. What is your vision and your plan for optimising children's life chances and giving a clear map of the future for children, parents, teachers, universities, employers, What, in your eyes, does good look like?
Order, order. So I did ask the Honourable Lady not to make a speech, but to ask a question. She's asked several questions, which I'm sure the Secretary of State will answer. But I must insist that while we have virtual proceedings in this chamber, that people who are participating virtually adhere to the same rules that we adhere to in this chamber. Nobody calls the Secretary of State you. You means the chair. The Secretary of State is the Right Honourable Gentleman. Secretary of State.
Thank you, Madam Deputy Speaker. Now, I'll endeavour to be very brief. My honourable friend is right to pay tribute to all those who work in schools and colleges and nurseries in Newton Abbot, and I'd like to add my thanks to the work that they do. We've been clear that the testing regime is a key element of opening schools back once more. We do rely on the pressure that currently the NHS is feeling to start to be lifted. That is one of the key reasons as to why we had to take the difficult and unpalatable decision to close schools.
Janet Davey.
Thank you, Madam Deputy Speaker. I've been contacted by a distraught young lady from my constituency. She works full-time. She's a private candidate studying for her A-levels. With exams now cancelled, students in standard schooling will have predicted grade assessments from their teachers, but self-taught students will have no such thing. Last year, thousands of private A-level candidates went without any grade when their exams were cancelled. Will the Secretary of State work with Exam Board to make provision for self-taught students to do what is necessary to make sure students like my constituents are not overlooked and to ensure that their money, time and studying really does pay off?
I certainly will do that. We've already had those discussions with Ofqual and will in turn with Exam Boards, and I'd like to refer the Honourable Lady to the comments I made to the Honourable Member for Beaconsfield.
Simon Fell.
Thank you, Madam Deputy Speaker. As someone who was campaigning to keep schools open until a few days ago, I recognise how difficult these decisions have been for my right honourable friend. But if I could press him on 2 points. First, I know my right honourable friend's made his views on vaccination in schools clear, but could I implore him to look again at vaccination for SEN schools, where the line between teaching and caring is very blurred indeed? And secondly, could my right honourable friend review catch-up funding for schools, especially for areas of deprivation, to make sure that it's targeted so that the attainment gap doesn't widen as a result of this lockdown?
Both my honourable friend and myself were both championing the importance of keeping all schools open at every stage, and I very much thank him for his support. I do spy in the distance the Health Secretary, who is obviously progressing slowly to the chamber, and I can absolutely guarantee that I'll be making those arguments as forcibly as possible about the important need, recognising those children who are in special schools. And that workforce is often a crossover between education and care. But we'll be making those arguments, but also recognising the broad clinical requirements that the Department for Health have to operate under. But I'll certainly echo those comments with the Health Secretary.
Order. I allowed the Honourable Gentleman for Barrow, in fairness, 2 questions because I couldn't get in quickly enough to stop the second one. From now on, 1 question, no speeches, no statements. Bill Esterson.
Poll suggests as many as 1.78 million children don't have access to a computer. What the Education Secretary has announced today suggests a 10% reduction in those numbers by the end of next week, which still leaves 1.6 million children unable to access a computer. Bridging the digital divide is essential. So when are that 1.6 million going to receive their laptops and the 900,000 children who don't have data access as well?
Well, I'd just like to refer the Honourable Gentleman to my statement earlier, which covered most of the points that he raised in his question.
Miriam Cates.
Thank you, Madam Deputy Speaker. I know my right honourable friend did everything he could to keep schools open and that he shares my concern for the welfare of the hundreds of thousands of young people now isolated at home. Can I ask my right honourable friend to look urgently at the reports of harms being caused to children by social isolation?
Absolutely. It's incredibly You know, the impact of social isolation has a real impact on young people. Children are the ones who just miss out so much with not just being in school to have the input of their teacher, but also their friends and that socialisation that comes with it. And always happy to meet with my honourable friend to discuss this and what more that we can be doing to support schools, support teachers and support the education community to support our children.
Patrick Grady.
Madam Deputy Speaker, where and when will families be able to find out exactly what free services the mobile operators are providing, and how will he make sure that that's as straightforward as possible to access? And is he making sure that the devolved governments are fully looped in on this, and that they'll get any Barnett consequentials of additional spending on laptop and tablet distribution?
Well, of course, we'll always work closely with the devolved governments, and it's obviously the benefits of the union are demonstrated about the fact that actually we're able to work together and also work at considerable scale in order to deliver benefits to all parents and children. Obviously, any additional spend on anything has Barnett consequentials, which means that again, Scotland benefits from being in the United Kingdom, and the financial support that the whole UK gains from being together.
Jerome Mayhew.
Madam Deputy Speaker, I know from my own children that a live lesson taught online is much more effective than learning resources being placed online. Whilst teachers always need to be able to use their discretion to take account of specific circumstances, can my right honourable friend assure me that the default expectation during this lockdown is for online live teaching?
Well, we've already set out really detailed guidance for all schools about setting the expectation levels for all schools and what they're providing pupils. We do recognise that there will be a blend in terms of a range of different teaching, but we have set the expectations there clearly, and where schools fall below it, there is recourse that parents can take either with the school directly or ultimately through Ofsted.
Mary Kelly Foy.
Speaker, as students have been advised not to return to university for the foreseeable future, most will be left paying for accommodation that they cannot use. It's clearly unfair that students renting private accommodation will be left thousands of pounds out of pocket, and the government's miserly £20 million contribution to the University Hardship Fund obviously isn't enough. Does the Education Secretary agree that the government has a responsibility to refund students their accommodation costs?
Well, as I've already sort of set out, the government before Christmas recognised the need to give additional support to students and through universities. That's why we put the additional financial arrangements in place to support them.
Lucy Allen.
Madam Deputy Speaker, I want to put on record my thanks to all the teachers and support workers in Telford. My single question, my right honourable friend, does he agree with me that just handing out laptops is no substitute for the support and guidance a child receives from a dedicated, committed teacher? Will he do everything in his power to enable teachers to return to school, including considering vaccinations?
Well, I would very much like to add my thanks to all the teachers in Telford, especially as one of my daughters is very privileged to be able to get benefit from those teachers in her constituency. I'd very much like to echo her point that actually supporting children in terms of learning isn't just about giving them a device, it's how that device is used, how that child is supported, and the work that we've undertaken over the last few months to support that in terms of Oak National Academy. Resources that are available are an important part of that. And in terms of vaccinations, in terms of testing, we'll always be pushing at the boundaries to maximise this for our education settings right across the country.
Mohammed Yassin.
Deputy Speaker, the Secretary of State has placed the decision about whether to maintain nursery schools on governing boards. Will he make public health a priority and guarantee full funding during this crisis to relieve boards like the Bedford Nursery Schools Federation of the feeling of being coerced into remaining open to protect their future viability?
Well, we recognise there's a lot of nursery schools who want to be in a position to be able to open their doors, and if I can refer the Honourable Gentleman to the answers I gave earlier in this session about the reasons as to why we took that decision.
Peter Bone.
The Secretary of State for updating the House and answering the question so fully. Could you tell me, if a university student has travelled back to their halls of residence and now is going to receive remote learning, should they stay at university or should they return home?
We would encourage that university students to stay as to where they are in order to be able to conduct their remote learning. Though obviously universities who aren't doing practical subjects shouldn't have returned back to university at this stage.
Vera Hobhouse.
Students in Bath and across the country feel massively let down. They are paying full tuition fees on top of rent for accommodation they are not allowed to live in. We've just heard the answer from the Secretary of State, and I am aware that this question has been asked several times this afternoon already, but we haven't had a proper answer yet. Will the Secretary of State now commit to the rapid implementation of a review of this academic year with the power to make recommendations for financial compensation?
I would refer the Honourable Lady to the answer I gave some moments ago.
Nusrat Ghani.
Madam Deputy Speaker, I share my right honourable friend's concern over schools being closed, especially for children in Wilden who do not have access to technology. Can my right honourable friend double confirm that those children without access to tech are now seen as vulnerable and they can immediately access physical education, attend school, and they won't have to jump through hoops to be able to get into school?
I can absolutely confirm that. That was issued out in our initial guidance on school closures back in March of last year, and we have repeated that self-same guidance sort of all the way through, where schools have been in an unfortunate position because we have had to recognise that, during, the latter stages of last year, there were schools that were closed, and even during that time, children who didn't have access to that type of education were able to access education settings.
Thank you. In order to allow the safe changeover of colleagues in the chamber, I will now suspend the House for 3 minutes. Order. Order. We now come to motion number 1 relating to sittings of the House. Minister to move.
I beg to move.
The question is as on the order paper. As many as that opinion, say aye.
Aye.
Of the contrary, no. Ayes have it. The ayes have it. We now come to motion number 2 on business of the House today. Leader of the House to move.
I beg to move.
The question is the business of the House today motion as on the order paper. Valerie Vaz.
Thank you, Madam Deputy Speaker. And can I start by thanking the leader for extending virtual participation in debates? It's made a huge difference to our colleagues in being able to take part. But could I just ask him on the business of the House if the government are likely to move forward any motion relating to virtual participation in committees and the many SIs that are coming through, and also if there's likely to be any changes to sitting Fridays. Our colleagues are very keen to take part in all aspects of the House.
Leader of the House.
Thank you, Madam Deputy Speaker. And may I preface this by thanking the House for getting everything ready to come back today. I seem to need to amend my business statement in future to say that there will be a recall of Parliament on a frequent basis, but I hope this will change as we move into the new year. The plans on backbench business on Fridays is that those should continue, and therefore members will be able to participate in those and will be able to do so remotely. Westminster Hall will continue, but will continue physically, as will committees. There is a small broadcasting team shared between both the House of Lords and the House of Commons, and when we looked into the cost of extending remote participation to Westminster Hall, it was going to be over £100,000, and there are limits to how much taxpayers' money can be spent on this, but it is important to ensure that proper scrutiny takes place. It's very popular with members and with the Backbench Business Committee. So private members' bills to continue, committees to continue as they are, and Westminster Hall to continue as it is.
Thank you for that informative piece of information. The question is the business of the House today motion as on the order paper. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to motion number 3 relating to public health. I call Secretary of State Matt Hancock to move the motion.
Thank you very much, Madam Deputy Speaker. I beg to move these regulations are approved. The new variant of the coronavirus, Madam Deputy Speaker, presents us with a renewed challenge here in Britain and around the world. And our strategy throughout has been to suppress the virus until a vaccine can make us safe. And while collectively our efforts were working on the old variant, when faced with a new variant that's between 50 to 70% more transmissible, there's been no choice but to respond. And I understand that these regulations that we debate today have serious consequences, and I regret the huge costs that they bring. But I know just as surely that these costs are by far outweighed by the costs that we would bear without action, and I give way to the Honourable Chair.
But don't viruses, especially when they've become as sort of widespread as this one, don't they always mutate? And hadn't the government planned for that?
Yes, of course. We've been not only watching for mutations, but indeed testing for mutations throughout. And it's partly because the UK has the biggest genomic testing capability of all countries around the world that we've been able to pick this one up. And there may be new mutations in other countries that don't have the scale of genomic testing. Just under 50% of all genomes that are sequenced of COVID-19 deposited with the World Health Organization are deposited by the UK because of this capability. Now that does lead to a challenge, which is it's the countries that have the genomic testing capability that spot the new variant and report it. There are countries where there may be variations that aren't known about and aren't discovered in this way that can't be reported. But that is the nature of the pandemic, and my strong view is that we should be transparent and clear with our international friends when we do find a new variant like this that is difficult to deal with. Madam Deputy Speaker, when I've come to this House before to ask the House's support for national restrictions, we've had to take it on trust that there would be an exit, because that's been before a vaccine has been approved. Today I come to the House seeking approval of these regulations, knowing from the huge pressure on the NHS right now that this action is necessary today, but also with the certain knowledge that we have a way out. Madam Deputy Speaker, before turning to the details of the regulation, I just want to set out that plan for how we get out of them, because that is critical. This country was the first in the world to deploy not one, but 2 vaccines. And more than 1.3 million people have been vaccinated already, including a quarter of the over 80s. And I'll give way to my honourable friend and then opposite.
I don't like it one bit, but I'll support the Health Secretary tonight. The reason I'll do it, and I suspect the reason why there's such high public support for these measures, is because of the position the NHS finds itself in and the stage 5 ruling that we hear. But as we've then, by the middle of February, vaccinated the top 4 groups, who are the ones likely to overwhelm the NHS, does logic not follow that at that point we'll be able to lift the restrictions on our constituents' lives?
Well, I'll come on precisely to my honourable friend's point, because that is a critical question that I know people are rightly asking, which is, if we're going to have these restrictions, how do we get out of them? And frankly, how do we get out of all of the restrictions that we've had to put in place? And I'll give way over there and then to my...
I thank the Secretary of State for giving way, and he mentions the vaccine as one of the crucial routes out of this and the work that's done. And again, I pay absolute tribute to all the incredible scientists and NHS staff who are preparing to deliver that as well. But one of the things that my constituents are asking me is, how can we be sure about the production of the vaccine will meet the ambitions that the Prime Minister and others have set out, and that we are building the types of facility to continue to ramp that production up to the highest possible levels that we can do. Could you explain what's going on? Because I was concerned to hear about the factory in Wales that's not operating at 7 days a week. Why is that? Is it because they're not getting enough supply into their system?
Yes.
Secretary of State answers the question. We can have interventions, of course, this is a debate, but they mustn't be long interventions. I give notice now that the time limit for backbench speeches will be 3 minutes from the beginning. And even with 3 minutes, not everyone on the order paper will be called because there isn't enough time. Secretary of State.
Thank you. I'll try to answer these interventions briefly, but they are important because people want to know what is the way out of these restrictions, and that is absolutely central to the case that I'm making. The fill and finish plant in Wrexham is doing a brilliant job, but can only fill and finish vials at the speed at which the vaccine material, which is a biological material, it's not a chemical compound, at the speed at which that material can be produced. So they're doing a brilliant job at the pace that they need to go, and we are manufacturing with, obviously it's AstraZeneca and it's Pfizer who are manufacturing the material itself, and they are also working as fast as they can, and I want to pay tribute to them and to their manufacturing teams who are doing a terrific job. I'm going to give way to my right honourable friend and then the honourable gentleman.
Grateful, Madam Secretary of State. Approving these regulations today would allow for lockdown for 3 months until the end of March. He will have heard my exchange with the Prime Minister earlier, when the Prime Minister said that he didn't think we would have to wait that long for an opportunity to choose whether to end the regulations or not. Will he go further now and give a commitment to a further vote at the end of January and at the end of February, so this House will have control over what is happening?
Well, what I'd say to my right honourable friend is that while these regulations do provide for new restrictions until the end of March, this is not because we expect the full national lockdown to continue until then, but to allow the steady, controlled and evidence-led move down through the tiers on a local basis. And those tiers changes do require a vote in Parliament. The restrictions will therefore be kept under continuous review. There is a statutory requirement to review every 2 weeks and a legal obligation to remove them if they're no longer deemed necessary to limit the transmission of the virus. And I'll give way to the honourable.
Thank the Secretary of State for letting me come in. First of all, can I thank the Secretary of State, and I understand the reasons for the regulations coming forward and fully support them. Secretary of State, can I ask, is there any intention of the Health Department, in conjunction with the Education Minister, to ensure that teachers are given priority vaccine because of the work that they do with nurseries and special children needs, and just to ensure that if they have it, then we can continue some reality?
Of course we're considering, once we have vaccinated those who are clinically vulnerable, of course we're considering who then should be the next priority for vaccination. And teachers, of course, have got a very strong case, as have those who work in nurseries, and many colleagues across the House have made that point, and we will consider that. From the middle of next month, yes, of course.
I'm most grateful to him. Just to pick up this point, where he cites the certain knowledge that there is a way out, but the whole point of the Right Honourable Gentleman for Worley's intervention is that there is uncertainty. So can I ask him what contingency plans there are if there is a mutation that proves resistant to either of these vaccines and we have to be in these measures for longer? And will he consider, in particular, we have drawn barely on the numerous people in the armed forces to create extra NHS capacity. We could do so much more of that if necessary. Is that part of the plan?
Yes, it's very much part of the plan. It's happening right now. Now, on the question of mutations and the link to the virus, to the vaccine, of course, as with flu mutations mean that we have to change the vaccine each year for flu. And we may have to update any vaccine in the future, but that is not our understanding of the situation now. And of course, that's being double-checked and tested, both with the scientists in Porton Down and as we roll out the vaccine in areas where there is a high degree of the new variant. With the pharmacological surveillance of those who have been vaccinated, we will be able to see for real the impact of this vaccine on the new variant. And the goal is, as my right honourable friend said, that by the middle of next month, we plan to have offered the first dose to everyone in the top 4 priority groups. And they currently account for 4 out of 5 COVID fatalities. And I'm not sure this is a point that has fully been addressed, which is that because of the strong correlation between age and fatality from COVID, sadly, it means that we will be able to vaccinate those groups that account for 4 out of every 5 fatalities within the top 4 cohorts. Now, it does then take 2 to 3 weeks from the first dose to reach immunity. But the vaccine, therefore, is the way out of this pandemic, and it's the way to a better year ahead. Yes, absolutely. And then I do want to make some progress on the detail of the regulation.
I'm grateful it was on that specific point that he raised, and he knows obviously that I understand that point because it's exactly the point that I raised with him last week in the House when we recorded last week, and I welcome the Prime Minister's commitment to it. But can I just take him back to the question from my honourable friend, the member for Winchester, because it's this point. He's very clear. Once we've vaccinated those 4 groups and they've got immunity and we've taken care, therefore, of 80% of the risk of death, what possible reason is there at that point for not rapidly relaxing the restrictions that are in place on the rest of our country?
We have to see the impact of that vaccination on the reduction in the number of deaths, which I very much hope that we will see at that point. And so that is why we will take an evidence-led move down through the tiers. When we've broken the link, I hope, between cases and hospitalisations and deaths, we will need to see those numbers we will need to see the protection in reality, in lived reality on the ground, but we will watch this like a hawk. And my aim is to keep these restrictions in place not a moment longer than they're necessary. I'll give way on that point.
Secretary of State, and thank him for everything he is doing. But the logic of him anticipating what's going to happen in 2 or 3 or 4 weeks' time, from the number of cases we're getting at the moment, is that we can do the same in reverse. That is to say, when we have sufficient number of people vaccinated up, we can anticipate in 2 or 3 or 4 weeks' time how many deaths have been avoided. That means, since it cuts both ways, he will be able to make a decision on when we should end these restrictions, as my right honourable friend has just suggested.
The logic of the case that my honourable friend makes is the right logic, and we want to see that happen in empirical evidence on the ground. And Madam Deputy Speaker, this hope for the weeks ahead doesn't take away, though, from the serious and immediate threat posed now. And I just want to turn to what is in the regulations and the actions that we need to take. The Office for National Statistics has reported that 1 in 50 of the population has the disease, some with symptoms, some without. The latest figures show that we have 30,074 COVID patients in UK hospitals, and that the NHS is under significant pressure. Admissions are now higher than at any point in the pandemic, and so on Monday, all 4 UK Chief Medical Officers recommended we move the country to COVID-19 Alert Level 5. In practice, this means they believe that without action, there is a material risk of healthcare services being overwhelmed. It's for this reason that we've placed England into a national lockdown, alongside action taken in each of the devolved nations. And every single citizen needs to take steps to control this new variant. And this personal responsibility is important. And to give the NHS a fighting chance to do its vital work of saving lives, it is on all of us to support them. These regulations set out that everyone must stay at home, save for a limited number of reasons permitted in law, including essential shopping, work if you cannot reasonably do so from home, education or childcare if eligible to attend, medical needs including getting a COVID test or getting vaccinated, exercise, escaping domestic abuse, and for support bubbles where people are eligible. These regulations are based on the existing Tier 4 regulations with some additional measures which reinforce the stay-at-home imperative. These include stopping the sale of alcohol through takeaway or click-and-collect services and closing sport and leisure facilities, although allowing playgrounds and allotments to remain open. Now, I know that these further restrictions are difficult, but they are unfortunately necessary because we have to absolutely minimise social interaction to try to get this virus back under control. And these measures came into force first thing this morning under the emergency procedure and will remain in force subject to this House approval today. Yes, of course.
I've just been talking to my right honourable friend from North Somerset, a doctor. He showed me the ridiculous form he's had to fill in to make this simple jab. You know, diversity, equality training. When he's inoculating an old lady, he's not going to ask her if she's come into contact with jihadists or whatever. So the Secretary of State has got to cut through all this bureaucratic rubbish.
Yeah. I'm a man after my right honourable friend's heart. And I can tell the House that we have removed a series of the unnecessary training modules that have been put in place, including fire safety, terrorism, and others. And I'll write him with the full panoply of the training that is not required, and we have been able to remove, and we made this change as of this morning, and I'm glad to say it's in force. Now, I'm a fan of busting bureaucracy, and in this case, I agree with him that it is not necessary to undertake anti-terrorism training in order to inject vaccines. Yeah.
I notice also a story about not delivering vaccines on Sunday, which, as I understand it, they think there will be sufficient vaccines for them to do 7-day inoculation. If somebody runs short, they will get topped up, which is a little different from what the Telegraph said today.
He's quite right. The supply of vaccines can take place on all 7 days of the week, but in a regular way, we do it on 6 days of the week. And then on the 7th day, people can either rest or deliver further vaccine if that's what's necessary. And as a result of this, there has been no point at which somebody in any area has been short of vaccine because of this delivery schedule. We have a challenge, which is we need to increase the amount of vaccine available. And the current rate limiting factor on the vaccine rollout is the supply of approved, tested, safe vaccine. And we are working with both AstraZeneca and Pfizer to increase that supply as fast as possible, and they're doing a brilliant job. But that is the current rate limiting step. Now, as that supply increases, Madam Deputy Speaker, we are going to need more people to vaccinate. We're going to need to get the pharmacists involved in vaccination. I very much hope to get my honourable friend, a former doctor, involved in vaccination, and others. We will need more people, but the current rate limiting factor is the supply of vaccine. That isn't to say that the companies aren't supplying on the schedule that is agreed. They are, and they are doing their bit. But we do need to increase that supply, and then the NHS will increase its delivery. And I hope to make absolutely crystal clear that point, because the PHE work to get the vaccine out, that is not a rate limiting step. The current discussions we're having with the pharmacists, that is not a rate limiting factor. What is the rate limiting factor is the amount, and the fill and finish isn't a rate limiting factor. What's a rate limiting factor is the amount of the actual juice available, the actual vaccine, which is not manufactured like a chemical. It is effectively it is a biological product. It's a bit like if you bake your own bread, Madam Deputy Speaker. I don't know if you do, but I sometimes do. And it is a bit like the creation of and growth of yeast. That's probably, it's probably the best way to think of it. It is a complicated and difficult task, and it is, and that is the rate limiting factor. And I pay tribute to those who are engaged in the manufacturing process of this critical product. Yes, of course.
Tiny one. He knows I'm obsessed with this. He mentioned the agreed schedule of delivery. Will he consider publishing that so that we can see what the agreed schedule is?
What I can assure my honourable friend is that agreed schedule of delivery will enable us to offer vaccinations to everybody in the top 4 priority groups by the middle of February, and that's why the Prime Minister could commit us to this delivery schedule. I just want to turn just for a moment to the support that has been outlined, because we're providing an additional 4.6 billion of support to businesses, including those in retail, hospitality and leisure, who've been forced to close their doors once again, on top of course, the £280 billion plan for jobs, which includes the extension of the furlough scheme until April. And I'll give way.
I'll be brief. I don't want to try Madam Deputy Speaker's patience. Just on that point that my honourable friend raised, the reason why he raised it is we had a fantastic call last week, early this week, with Nadine, with the Minister for Vaccine Delivery. And we asked this question a number of times about the agreed schedule. And we didn't get a clear answer. So it's been agreed with the companies. Why can't he just publish it so that we know when vaccine's going to arrive, and it will give people the confidence that we're going to deliver on the Prime Minister's commitment to the country?
Well, I'll happily take that point away. But what I can tell my right honourable friend is that supply does allow for the delivery of the schedule and the target that the Prime Minister has set, which my whole team is working to. Madam Deputy Speaker, yes, of course.
Thank the Minister for giving way, and he stressed that the problem is really in production of the vaccine. Presumably there's a limited number of sites on which it's done. Why haven't we expanded the number of sites?
We spent the summer working on that, and I know that the vaccine has sprung into prominence in the public debate over the past month or so, but we have, of course, we've been working on that through the whole of last year, and there's further expansion still to come. I'm glad to be able to assure him. Madam Deputy Speaker, I will close now just by reiterating that if we don't act now, we know that eventually the NHS would not be able to cope, and I know that no member of this House wants to see scenes that have been witnessed elsewhere in the world of hospitals overrun or doctors forced to make the choice of who to treat and who to turn away. And we know that while the winter weeks will be difficult, we now know what the way out looks like. And accelerating the deployment of COVID vaccines, making the most vulnerable groups safe, and everyone playing their part on the way to get us there. That is the route out of this pandemic. Now I'll take a final intervention from my honourable friend.
I thank the Secretary of State for everything he's done for this, and would he also join me in thanking the residents of Wolverhampton for the community testing that they've done, especially Bilal Mosque and Sedgley Street, Gurdwara, where they've all come together to defeat this virus?
Yes, I will. And Madam Deputy Speaker, I'm very glad that I took that final intervention, because the people of Wolverhampton have come together to deliver community testing in an incredibly impressive way. And I've heard about the work of the Gurdwara, bringing together faith leaders of all different faiths to make sure that we get testing out into the community. And we need to do the same with the vaccine programme, as well as testing. Both of these are absolutely critical. And in the meantime, Madam Deputy Speaker, we must stay at home, protect the NHS and save lives, and that eventually will carry us to a brighter future.
Thank you. The question is motion number 3 relating to public health as on the order paper. And just before I call the right honourable gentleman, I confirm that there will be a time limit of 3 minutes imposed immediately upon backbench speeches. Jonathan Ashworth.
Thank you, Madam Deputy Speaker. We will support these public health regulations tonight, but like the Secretary of State, I did not come into politics to restrict people's freedoms like this. And as somebody who represents the city of Leicester, a city that has effectively been in a form of restriction since last March, I well understand the devastating impact restrictions can have on our economy, on our way of life, on the mental health and well-being of our constituents. Indeed, many of our constituents will be devastated at the prospect of weeks and weeks, possibly more until the end of March, possibly, in isolation, feeling anxious, feeling lonely. Last year, in the months following the long lockdown, 19.6 million antidepressants were prescribed, a 4% increase on the same period in the year before. More than 6 million people in England, the highest on record. So, if we are to support lockdown, we need assurances from ministers that mental health services will be fully resourced, will stay open and will be able to respond to people's needs throughout this lockdown. I know that many people find solace through prayer, so I'm grateful that communal prayer can continue through the lockdown. And can I just, with the indulgence of the House, take this opportunity to thank Leicester City Council, Peter Salisbury and our councillors, especially those for Stonygate, Wycliffe and Spinney wards, who have all worked so hard with our many mosques, temples, gurdwaras, synagogues and churches across Leicester on ensuring COVID-secure worship. Yes, of course.
I think it's really important, Shadow Minister, to have prayer. Would the Shadow agree and call, as I have in the past and others have passed, for a day of prayer, a national day of prayer for this country?
I think that is a very good recommendation. And can I extend an invitation to the honourable gentleman to return to Leicester to watch our great football team when we are allowed and out of this lockdown, and perhaps I will take him around and show him some of the great interfaith work that we do in Leicester as well. This lockdown will also hugely impact the well-being of our children, so I plan to get our children back safely into school is a priority. There will be thousands of children out of school in overcrowded, cramped accommodation, unable to access learning properly from home. There will also be other children at risk of abuse and violence. Members might know I've spoken of my own experiences growing up in a home with a parent who had a problem with alcohol. Many children will be facing the prospect of being locked in their homes with a parent who abuses drink or drugs. So can I urge ministers to work with and fund those children's advocacy and support groups, such as the National Association for Children of Alcoholics, which I've worked with closely, who will be doing so much throughout this lockdown. But today, I agree with the Secretary of State. We do, unfortunately, have to restrict freedoms further in order to safeguard freedoms for the future and save lives. As the Secretary of State said, the tragic reality is the virus is out of control, and to be blunt about it, there is no freedom for our constituents if they are in the graveyard. There is little freedom also for those who suffer from the enduring debilitating effects of long COVID as well. Yesterday, almost 55,000 cases reported in England. 1 in 50, as the Secretary of State said, have the virus. Those in hospital numbers more than they did in April. Over 1,800 in intensive care. Yesterday, there were over 3,300 hospitalisations, a record, and admissions are going up in every region. This is a national emergency, and a national lockdown is necessary. Indeed, we should have locked down sooner. We are voting this lockdown through on 12th night, yet in the run-up to Christmas, the alarm bells should have been ringing. The Secretary of State came to the House on the 14th of December to report a new strain, now known as the B117 strain. He told the House then, initial analysis suggests that this variant is growing faster than the existing variants. The Prime Minister learned of the rapid spread of the new variant on the 18th of December. The Nerve Tag group met that day and concluded the new strain added at least 0.4 to the R. On 21st of December, the Chief Scientific Advisor, Patrick Vallance, said the new strain was everywhere and cases would rise after the inevitable mixing at Christmas. The lesson I think you have to learn about this virus is that it's important to get ahead of it in terms of action. SAGE met on December 22nd, the following day, and concluded, it is highly unlikely that measures with stringency and adherence in line with the measures in England in November would be sufficient to maintain R below 1 in the presence of the new variant. And here we are, 2 weeks later, with 500,000 infections since 22nd of December, 33,000 hospitalisations since 22nd of December. This is a national tragedy. And why is it this Prime Minister, with all the scientific expertise at his disposal, all the power to make a difference, always seems to be the last to grasp what is needed to happen? The Prime Minister hasn't been short of data, he has been short of judgment, and yet again we're all paying the price. But as the Secretary of State has said, there is light at the end of the tunnel. Vaccination is how we ultimately are released from these restrictions. And I want to pay tribute to all involved in helping distribute and administer 1.3 million vaccine doses so far. This is a great achievement, but we need to go further and faster. The Prime Minister has promised almost 14 million will be offered the vaccine by mid-Feb. That depends on around 2 million a week doses on average. Now, both he and the Prime Minister have reassured us in recent days that it's doable based on orders. But in the past, ministers have told us that they had agreements for 30 million AstraZeneca doses by September 2020 and 10 million of Pfizer doses by the end of 2020. So I think people just want to understand the figures and want clarity. Can ministers tell us how many of the ordered doses have been manufactured? How many of the ordered doses have been delivered to the NHS? And how many batches are awaiting clearance through the MRHA checking processes? 2 million a week would be fantastic, but it should be the limit of our ambitions. We should be aiming to scale up to 3, then 5 to 6 million jabs a week over the coming months. So, shouldn't be the limit. You're quite right. I misread. Thank you to the Secretary of State for pointing that out. I misread my script. But if we can vaccinate 29.6 million people, deaths and hospitalisations will be reduced by 99%. That is what we should be targeting now. Of course.
I thank him for giving way. Obviously, the opposition will support tonight. Could he tell the House, further to the exchanges that a number of members on this side had with the Secretary of State, at what point will he and the opposition and the Leader of the Opposition be calling for restrictions to be released on our constituents? And please don't say when it becomes obvious it's going to happen.
Well, the Honourable Gentleman asked a perfectly reasonable question. As we vaccinate more, mortality rates will improve more, we will be able to save people's lives. But of course, there'll be others who will remain unvaccinated and will be exposed to the virus and will possibly develop long debilitating symptoms of long COVID as a result of that exposure to the virus. So, of course, I do believe that we can begin to ease restrictions once we increase the proportions of those who are vaccinated. But we will not be able to go back to normal yet because the virus will still be circulating. And even though people may not end up in hospital and on ventilation, there are many people who have contracted this virus who remain incredibly ill as a result of the virus. Yes.
Please, the generally positive way in which he has approached this, which does him great credit. Can I perhaps help him out and make a suggestion? And that is every year we accept a certain amount of deaths, tragic, sad deaths from seasonal flu, up to 28,000 in recent years. Would it be reasonable to anticipate the number of deaths that are going to be caused by this virus and try to make a political judgment, for political judgment is what it is, on what we feel is acceptable? And that will give us our criteria for deciding when to lift this lockdown.
The honourable gentleman again makes a reasonable point, like the former public health minister. But this is not just a simple calculation about the number of deaths that are saved. Now he's got much more clinical experience, more clinical experience than I have, obviously. But there are people who suffer long-term debilitating conditions as a result of this virus. There are reports of people developing psychosis as a result of this virus. There are reports of people developing long-term breathing problems, problems with the rhythm of their heart as a result of this virus. It remains an extremely dangerous virus, regardless of whether you end up in hospital or not and on ventilation. But the honourable gentleman is quite right. In the end, this will be a judgment for politicians and a judgment for this House. It's not a judgment for the Chief Medical Officer and the Chief Scientific Advisor, although I would hope that our judgments in the end are guided by the Chief Medical Officer and the Chief Scientific Advisor. Let me make a little progress. I will, and then that will be my last one. If that's
grateful. I too commend him for the constructive approach he's adopting, and he clearly has a very good relationship with my right honourable friend. Can I just ask him to assent to this proposition, which is actually public confidence in this vaccination programme is critical if we want people to comply with these lockdown measures, and that we must do nothing that creates false expectations or unrealistic expectations about how this vaccination programme will go. We must be modest in what we promise, and hopefully we will overachieve. Can you assist my right honourable friend in that objective?
Well, of course, I always think as a rule in politics, it's always better to under-promise and over-deliver. And maybe the whip on the Treasury bench could send that advice to the Prime Minister, because he tends to have the opposite approach to some of these matters, I would say. Now, look, we should be targeting more, our big target should be to vaccinate more, particularly NHS staff, because many NHS staff on the front line, in the face of danger, are scared, they are exhausted. And many feel, as they have said to me, that they were sent out in the initial weeks of the first wave without the protection of PPE, and now they're exposed again without the protection of inoculation. So will the ministers move heaven and earth to get all frontline NHS staff vaccinated urgently? And can we have a clear date by which those NHS staff on the front line will receive the vaccine? And if manufacturers can increase supply, what more can be done to improve distribution? In addition to GPs, I know our community pharmacists have tremendous links with hard-to-reach communities. We need to be making full use of them. Vaccination, Madam Deputy Speaker, not only saves lives, not only is it the route out of restrictions, it is also urgent, because we are now in a race against time. The B117 strain is fast becoming dominant and has done in just a matter of weeks. The more virus there is circulating, the more there are opportunities for further mutations that could give this virus greater advantage, possibly a variant where vaccines no longer work, risking another devastating COVID wave in winter 2021. Vaccination, both at home and across the globe, is now fiercely urgent, and the race to vaccinate is therefore literally a race against evolution. We are also supporting this lockdown tonight, Madam Deputy Speaker, because we know we have to reduce transmission. That is why we're asking people to stay at home. But not everyone can work from home on their laptops. There are 10 million key workers in the United Kingdom, of which only 14% can work from home. Key workers, many low paid, often using public transport to travel to work, in jobs that, by necessity, involve greater social mixing and more exposed to risk. And often, because of their home circumstances, they end up exposing others to risk as well. We witnessed this in Leicester, where it's suspected a spike back in the summer was the result of a spillover of infections into the community from those sweatshops who didn't adhere to proper health and safety rules. We need to make sure our workplaces are COVID secure, otherwise we won't get on top of transmission. So what support is the government offering to install ventilation systems into workplaces? Will the government introduce a safety threshold for ventilation of indoor workplaces without outside air? And given the B11 strain is so much more transmissible, is the government considering reintroducing the 2-metre rule? And when fewer than 20% of those who should isolate do so fully, will the government finally accept that sick workers need proper sick pay and support? Otherwise, they will be forced to work spreading this illness. Madam Deputy Speaker, the British public have done so much over the last year and made great sacrifices. We are a great country, and our people can and will rise to the occasion. All everyone asks is for the government to do the right thing at the right time. Make all workplaces COVID secure. Vaccinate health workers as soon as possible. Introduce decent sick pay and support to isolate. Roll out a mass vaccination plan like we've never seen before. This is a race against time, a race against evolution, and we will support this lockdown tonight.
I will now introduce the 3-minute time limit, and I remind honourable and right honourable members that when a speaking limit is in effect for backbenchers, a countdown clock will be visible on the screens of honourable and right honourable members participating virtually and the screens in the chamber. For honourable and right honourable members participating physically in the chamber, the usual clock in the chamber will operate. We now go to Robert Halfon.
I want to begin by thanking the Health Secretary, his ministers and advisors for all they're doing, working day and night to try and keep the country safe. Whilst I understand the government's health measures, I really worry about school closures. And we need to know if a risk assessment has been done as to the loss of learning, impact on mental health, and safeguarding hazards to children not in school. Not so long ago, 1,500 members of the Royal College of Paediatrics wrote that school closures significantly affect children's well-being. We now know there has been a huge fourfold increase in eating disorders amongst young people, in part due to school closures and social isolation. Children's groups and charities have warned of a new frontier of vulnerabilities, children out of school exposed to online harms, exposed to county line gangs, exposed to tough situations at home like domestic abuse. And we know that school closures put enormous pressure on parents' livelihoods and well-being as they have to juggle their work whilst looking after their children or reduce their hours. So I'd urge the government to consider the following. First, to ensure that teachers and support staff are given priority for vaccinations alongside NHS workers, solely for the purpose of getting schools open sooner rather than later. Second, for more resources to be put into mental health, having practitioners in all schools to help with the fallout from closures and isolation so that pupils, parents, teachers and support staff can access mental health support whenever they need it. And third, the Department for Education Ofsted should partner with schools as candid friends to ensure quality remote education for all pupils. The Chief Inspector of the Schools, Amanda Spielman, has said that one day of national school closures equals around 40,000 child years in total. That is a grim statistic. As a country, a choice must be made. Do we value the coming generation of our young children or not? Are we going to risk their life chances to climb the educational ladder of opportunity by shutting down real schooling from their lives? We need a guarantee that the plans for school to reopen after the February half term is signed in blood and not just a guideline. While we absolutely have to be careful of this awful virus, we cannot risk an epidemic of educational poverty and mental health affecting our younger generations for years to come.
We now go to the SNP spokesperson, Dr. Philippa Whitford.
Thank you very much, Madam Deputy Speaker. A year ago, when the SARS-CoV-2 virus emerged, there was no handbook on COVID. All governments had to feel their way, but there's little excuse for repeatedly making the same mistakes a year on. Go early and go hard has been the consistent advice of public health experts. Michael Ryan of the World Health Organization said at the start of the pandemic, the virus will always get you if you don't move quickly. Yet just last week, the Health Secretary still refused to put England into Tier 4, despite surging case numbers and the devolved nations already being under tight restrictions since Christmas. After the late lockdown in March and rushed reopening in May, the government allowed rates of infection in England to run 7 times higher than Scotland or Northern Ireland over the summer. And at that time, chose not to agree a zero-tolerance COVID policy so as to eliminate community spread of the virus on a UK-wide basis. The gains of lockdown were gradually lost as Eat Out to Help Out drove up cases in August and September, thus beginning the second wave. The UK is one of the few countries that never closed its borders, and many new strains of COVID were imported by people travelling to Europe on summer holidays. Even now, in the middle of the second wave, the UK does not have strict testing and residential or monitored quarantine for arrivals. On the contrary, the government has sought to grant further exemptions to quarantine rules. In September, the Prime Minister ignored the tenfold rise in COVID cases and his own advisory group to listen yet again to the proponents of disease-driven rather than vaccine-based herd immunity, leading to a 6-week delay in instigating the autumn lockdown. Herd immunity can only be safely achieved through the use of a vaccine, and even then, only if the vaccine prevents transmission of the virus and thus also protects the unvaccinated. That is the hope, but we do not yet know if either of the vaccines used in the UK will achieve this. It is understandable governments are wary about the use of tight COVID restrictions and their impact on our economy and society, but it is a false dichotomy to set public health against the economy, lives against livelihoods. People simply choose not to endanger themselves or their families and need to have confidence that the risk of catching the virus is very low. Allowing increased levels of spread and therefore high rates of viral replication also contributes to more frequent mutations and increases the risk of generating yet more problematic new variants. With cases growing exponentially, it simply isn't possible to vaccinate our way out of this current surge, so I welcome the decision for this lockdown. But it is tough on everyone, and both individuals and businesses will need support to get through it. That's why it's bitterly disappointing to hear that the £375 million of support for businesses in Scotland, promised just yesterday by the Chancellor, has now been rescinded, leaving Scotland with no new funding to deal with the economic impact of this current shutdown. The government must also consider what strategy they will follow at the end of the lockdown. It should be maintained long enough to achieve suppression of community transmission and establish a more systematic approach to test, trace, and isolate. It's critical to provide both financial and practical support to those who need to isolate, as it is only isolation which actually breaks the chains of infection. Strict controls at external borders would avoid importing more COVID cases and new variants. Such a COVID-secure approach would allow the domestic UK economy to fully reopen, with the government then able to target financial support at the industries associated with international travel, such as aviation and aerospace, which have been so badly impacted by the pandemic. If we look at countries like New Zealand, Singapore, and Korea, who have tight travel restrictions and quarantines, they have eliminated community transmission and been able to fully open up their economies and societies, including schools, hospitality, and domestic tourism. We only have to look at their Christmas and New Year celebrations to see what could be on offer to us here if we get things right.
Sir Graham Brady.
Thank you, Madam Deputy Speaker. May I preface my remarks by saying that I accept that we are in a serious situation, worse in some areas than in others, but that hospital admissions are rising across the country, albeit that improved treatments are meaning that fewer people are progressing as a percentage from admission through to ICU, and fewer people as a proportion are dying as a result of it. And therefore, some of the pressure, I understand, is on general beds more than ICU. Restrictions in this context may be necessary, and we should certainly all take personal responsibility. And I share my right honourable friend's enthusiasm for an effective and rapid vaccination programme. But this doesn't absolve this House of its responsibility to protect the liberties of the British people or to hold government to account. Neither of those things would be consistent with approving regulations that would allow a full lockdown to be in place for the next 3 months to the 31st of March. Today, both the Prime Minister and the Secretary of State have given me reassuring words that they don't want that, but the regulation gives the power to the government to decide that, not to this House. And I urge my right honourable friend again to reconsider and to look at whether he might be able to promise to bring a further vote at the end of January and at the end of February, so that this House will decide whether these extreme controls remain in place for that long or not the government. I share my right honourable friend from Harlow's concerns about getting schools back as soon as can realistically be done. My right honourable friend knows that I have considerable concerns about the fundamental human rights which are being taken away under these measures. The right to see your children or grandchildren, these really are the most basic rights, and now to be taken away for up to a year for some people. These points are critically important, but I won't repeat them. What I would want to say finally to my right honourable friend is that people will tolerate restrictions where they can see a genuine rationale, when they can see there's some common sense behind them. And I return to some of the questions that I was asking back in the spring, in the first lockdown. Why does it make sense that I can buy flowers in a supermarket, but an open-air market can't sell them? Why is it illegal to go out for a walk on your own twice in the same day? And why, when it is legal for two members of the same household to take a walk across a golf course, is it illegal for them to play golf while they're doing it?
We now go to Vicky Foxcroft.
Thank you, Madam Deputy Speaker. Today, I would like to focus on one particular group who have felt forgotten throughout this pandemic: disabled people. In reading the updated regulations, I can see that no assessment of the impact of lockdown on disabled people has taken place. This must change. Disabled people must be central to our decision-making, not an afterthought. Communication has been poor. Shielding letters have been arriving far too late, leaving many unsure of what guidance they should be following. At Monday's press conference, shielding was reintroduced, yet the government website doesn't have any updated guidance for shielders. The guidance that is there is not in an accessible format. People urgently need this evidence to ensure they can continue to be paid. The government's press conferences, which are communicating extremely important public information, are still taking place without a British Sign Language interpreter. It's unbelievable that this has not been sorted. At the start of this crisis, disabled people raised with me their concerns around accessing food, medicines, PPE and social care. Many have faced increased costs, yet we still haven't seen any uplift to legacy benefits. Ministers originally said this would take up to 8 weeks to sort. 10 months later and no progress made. Will this increase ever materialise? The Women's and Equality Select Committee report, Unequal Impact, Coronavirus, Disability and Access to Services, calls for an independent inquiry into the causes of adverse outcomes for disabled people. ONS statistics show that 2/3 of those who have died from coronavirus in England and Wales have been disabled. We also need the Scottish Government to collate this data to enable us to fully understand the impact of the pandemic on disabled people. And sadly, the funding for disabled people's organisations has been cut. Being guided by disabled people's experience is essential. I want to thank everyone who's contacted me about today's debate. I'm only sorry time restraints can't mean that I can't raise everyone's points. I'll end by asking one simple question. As the government's disability unit looks to recruit 14 disability and access ambassadors, how many of these will be experts by experience? How many will be disabled people? I hope the answer is all of them, but I fear not. The government must ensure that disabled people's voices are at the heart of decision making, and this is more crucial than ever during a pandemic.
We now go to Dame Cheryl Gillan.
I'm pleased there is more that finds common cause across the political divide in this time of national emergency than divides us. These regulations are retrospective and not amendable, which sadly reflects the impotence of backbenchers, which should be rectified. And I would like to identify myself with the remarks made by my honourable friend, the member for Altrincham and Sale, earlier in this debate. The regulations last until the end of March, but there should be weekly reviews and a debate on the floor of the House at least every 2 weeks during this period when such draconian restrictions have been placed on our citizens. The vaccination effort in this country is remarkable, but we need to do more, particularly as so much fake news is being circulated. Many of my constituents are constantly picking up fake stories about everything from so-called cures and drugs that protect you from COVID to conspiracy theories and priority being given to privileged people. Can we please boost the government communications effort so firm rebuttals and accurate information are issued rapidly and widely to prevent more fear and anxiety? Can we also have frequently asked questions section on the government website to help combat this fake news? Can we add teaching staff to the priority list alongside young adults with learning disabilities and autism, as the PHE data has shown their vulnerability? And the PM missed the opportunity to respond to my question earlier today. Heathrow, throughout the last years, provide a value air bridge for repatriation flights and vital cargo, including medicines and PPE. It has only been given a proposed 7% reduction in its £118 million rates bills, whilst airports in Scotland and Northern Ireland and even supermarkets have a 100% waiver. We're lagging behind other international countries, so can we have some more support for the aviation sector and review it so its services are not threatened? We also need more assistance to the excluded. We need to examine how we can spread the help to this group who've received nothing for nearly a year. These regulations stop golf and outside activities. This is patently ridiculous, and we need some common sense, for goodness sake, as this sort of nonsense damages our credibility. Most of all, we need an exit scenario set out, and the goals identified publicly as the most frequent question is, when is this going to end? The PM has set a 15th February date as a milestone, and we need to know, for example, at what stage we hope to have sufficient people vaccinated to say, open our schools safely again, or at what point the levels of incidence and spread of the virus will allow retail and hospitality to reopen. Can I finish by saying locally how fantastic Buckinghamshire Council and Buckinghamshire Health Trust have been throughout this terrible period. People will never know the amazing work they put in to keep our county functioning and our residents safe. Let us not forget what further burdens these regulations are placing upon them and our tireless public sector workers. And if we have to face these restrictions on our liberty, let's at least do the frontline staff the courtesy of observing them.
We now go to Barbara Keeley.
Thank you, Madam Deputy Speaker. With case rates rising and hospitals under pressure, it is clear that these regulations are necessary, and I will be supporting them today. The situation in hospitals is particularly concerning. In London, we are seeing the cancellation of non-COVID care, including urgent cancer treatments. This was one of the most damaging consequences of the first wave, when many people had to wait months for urgent treatment and diagnostic tests. This cannot be allowed to happen again. So can the Secretary of State set out exactly what steps they are taking to guarantee that the most urgent cancer treatment can still go ahead over the next 6 weeks? This lockdown also comes at a time when health and care staff have been working flat out for almost a year. They have gone above and beyond this year, working with inadequate PPE last spring to stepping up over Christmas to ensure that patients continue to receive treatment. This week, a constituent who works in the NHS wrote to me and she said this: I am tired as an NHS employee. I am tired of working beyond my contracted hours because there aren't enough staff in work. I am tired of covering for colleagues who are shielding or pregnant and cannot have direct patient contact. I am tired of not having enough equipment to do my job because it is stuck in the supply chain. I am tired of having to tell bereaved women that their whole families cannot visit due to social distancing. I am very tired. At the start of this crisis, we came together as a nation to thank our health and care staff, but I feel this sense of unity and support for them has been lost. Whether it is doctors being bombarded with abuse from COVID deniers on social media or outside hospitals, or NHS staff not being prioritised for vaccines, We are no longer showing staff the respect and appreciation they deserve for the amazing job they are doing in this pandemic, and we need to change this. Staff are now being asked to work flat out caring for COVID patients or on delivering vaccines. The government must take a lead on showing appreciation for staff, starting with vaccinations for everyone on the front line. When we debated the Tier 4 regulations a week ago, I said restrictions only work if people can and do follow them. Throughout this crisis, one of the major barriers to self-isolation has been that people cannot afford to do the right thing. The £500 self-isolation payment is only available to those with no other financial resources. So people with savings are being denied this payment. In Salford, 4 out of 5 people who applied for the payment were turned down. We are asking people to spend their savings intended for house deposits or even treatments like IVF to support themselves and their families while they self-isolate. And this is not right. Nobody should be worse off because they're doing the right thing in a pandemic. The government should extend statutory sick pay at the level of lost wages to everyone asked to self-isolate. Anything less risks people continuing to break self-isolation through financial necessity. Now, these regulations are necessary, but they may not be sufficient. I hope the Secretary of State can ensure that everyone is supported to do the right thing and beat this virus.
Very much indeed, and I certainly will be supporting these regulations tonight with a heavy heart, but nevertheless, they are clearly required at this particular juncture. I doubt there's anybody in this country that loathes and detests the restrictions on liberties and livelihoods that these regulations reiterate than the Prime Minister. I am confident that he would not be recommending this to this House unless they were absolutely necessary in his judgment. However, I think it's important that this House has provided more granularity on numbers, and I think this House needs to have a better idea of what constitutes an exit strategy and the trigger points that would allow for that strategy. Jabs offered are not the same as jabs put in arms, and it's that that's crucially important. We need to have published, I would suggest on a daily basis, since ministers must have this information, what's being contracted for, the factory gate delivery against that contract, jabs in arms, jabs that are awaiting deployment because of the 3-week downtime caused by batch and sterility testing. We need to know how many jabs have actually been applied in the past 24 hours by priority group. I will give way to my honourable friend.
Could I add one to that, if I may? Jabs given per area. Because while I know in Hampshire we're in a good place, and I expect to hear so tonight on our briefing call, we can scale up when the supply is there. I know from talking to colleagues across the House that is not the same everywhere. We need to know where the weaknesses are, or rather the vaccine minister does, so that he can then address that.
That's a fair point made by my honourable friend. Data that has to be available clearly because it's gathered locally. That would be very useful, particularly for constituency members of Parliament. The thing that worries me most, Madam Deputy Speaker, is the exit strategy. The Secretary of State perfectly reasonably said we do have a sort of an exit strategy in that we now have a vaccine, which we clearly didn't have at the beginning of last year. But we need to decide, and this is a political decision ultimately, what constitutes the criteria for coming out of this lockdown. Now, it's been generally said that it happens, it's been suggested that it happens when we have vaccinated everybody in Group 4 in the JCVI's list of priorities, and that's perfectly reasonable. That is to say, when everybody over the age of 70 has been jabbed, as opposed to everybody over the age of 70 having been offered a jab. The two, as I've said, are quite different. But I think we need to challenge that. And we need to push back on that, because notwithstanding the remarks made by the honourable gentleman who speaks for the opposition, the honourable member for Leicester South, long COVID, awful though it is for those who are afflicted by it, does not constitute a reason for continued lockdown and the penalty that this country is paying societally, medically, economically for what we are about to vote on this evening. That does not stack up. What stacks up is the awful, grisly calculus of lives saved. And we have a benchmark, Madam Deputy Speaker, and that is the number of lives that tragically we are compelled to accept every year through seasonal flu deaths. That gives a reasonable benchmark of what politically and societally we might be capable of accepting. And because we can project how many deaths will happen, and ministers are very keen to do that in recommending to this House correctly that we vote for these this evening, they must have an idea, given the number of people that have been vaccinated in key groups, how many deaths there will be in the ensuing month or 2 months or whatever you like to choose. And I would just push back very finally on one issue, and that is the people who are in Group 4. And I think it is reasonable, perhaps, for those who can be expected to remain safe through shielding, perhaps to be considered as part of Group 5, because that will enable people over the age of 65 to be vaccinated, many of them, and that will enable us potentially to be able to come out of this awful lockdown just a little bit sooner and meet the challenging targets that have been set by the Prime Minister.
What a great speech.
We now go to Clive Lewis. Trevelyan. Mr. Lewis has apparently withdrawn. Anne-Marie Trevelyan.
Madam Deputy Speaker, thanks to the superhuman efforts of our NHS teams and to the forward thinking of the Prime Minister back in March 2020 to throw all our UK resources to supporting industry and the global virology scientific networks in search of vaccines to becalm the threat of COVID-19, there is light at the end of this lockdown tunnel. I think that total commitment across government has proven worthwhile, and I'd like to pass on my thanks from all those across North Northumberland, and enormous thanks to the 24/7 dedication both to finding a vaccine alongside delivering that vaccine, rolling off those production lines now into glass vials in their millions, into trucks and to our hospitals and GP surgeries, and in the weeks ahead, I hope, to sports centres and pharmacies too. My constituents, whilst frustrated at having to remain isolated from family and friends once again, are in a better place about supporting the PM's difficult decision this week, because their vulnerable family members are indeed being vaccinated. But we are very anxious about the challenges of homeschooling once again for all but those SEND and key workers' children. There will be many a difficult moment in all those households as students struggle to make the progress they would be able to do in the classroom. So we must ensure, please, that the restricted schooling part of the lockdown is as short as possible, and that all pupils from primary to tertiary are back in their classrooms as soon as the R8 decline becomes clear. Because we know that schools are safe places thanks to the efforts of all our head teachers and their teams over many, many months. So that damage to our next generation must be as limited as possible. I am particularly concerned that the cancellation of GCSE and A-levels in their usual form will leave many long-term gaps in that learning created by the loss of a definite deadline to work to. As a mother of two whose both children worked only to an immovable deadline, this would have been a disaster in my own household. I can only be grateful they are now both grown up. But I do know that compliance to these regulations in Northumberland will be high because we appreciate the risks of our NHS being unable to deliver on the needs of all our patients if our excellent Northumbria NHS was overwhelmed. So, Madam Deputy Speaker, I'd just like to end on an optimistic note, which is that last week I had the privilege of dropping into the Well Close surgery in Berwick to see for myself our primary care network roll out of those first doses of Pfizer vaccine. I can only say it was like going into a Christmas party. The sound of bubbling, excitable voices, my wonderful over-80s queuing patiently, being given a timer because they had to sit for 15 minutes to wait to make sure they didn't have a bad reaction, and then the ping as they were allowed to leave and go home again, as if they'd been fully cooked in their baking oven. It was simply the most extraordinary and encouraging afternoon that I've spent in many, many months. So thank you to Hilary Brown, running the service, Dr. Ben Burville in Amble, and the whole team in the Alnwick Cricket Club, making sure that so many of my over-80s are now protected.
Yeah. We now go to Stella Creasy.
Thank you, Madam Deputy Speaker. Government of the people, by the people means little if it can't persuade. Yet surely lacking here is the consistency vital to achieve that. Repeatedly, this government has simply offered chaos in its place. No wonder the public are fed up. Millions still haven't had any financial support. Hundreds of thousands have lost their jobs in hospitality or retail with little alternative in sight. Clarity Products in my borough employs residents who are disabled. Despite money being claimed from the taxman for them to be furloughed by their boss, Nicholas Marks, many still haven't been paid. People who can't get a job, a new one because they were furloughed before the regulations were less restrictive. The people who won't go and test because they can't afford to self-isolate. In my own community, 75% of the claims for payments for isolation are being refused. The parents of children over the age of 1 but under 5 who can't form a support bubble. as if a 14-month-old is no trouble at all compared to an 11-month-old. The nursery staff terrified because nobody can actually explain why primaries are being closed to reduce the numbers of community interactions, but they are not. This legislation removes the school run as a legitimate reason to leave the house. Ministers tell us this is to reduce virus transmission, but they can't explain this to a family that has one child in preschool and one child in primary. Or the kids in special schools whose needs just seem to be a simple afterthought at best. Those who still don't have access to the internet, and the teachers now having to tell them they still don't have the laptops. I pay tribute to the head teachers in Walthamstow who told us today that their first task has been to buy sandwiches for the kids who are hungry and vulnerable, but whose families don't qualify for free school meals. Or those people in care homes, ignored in this regulation, so it's not clear whether visits are still possible. Or the shielded, told again to lock down, but nobody can explain why they are not a priority within the priority groups for vaccination. Or the homeless, now being left out again on our streets this winter. Indeed, the only time this government has been consistent is to avoid scrutiny, whether shutting this place down or ignoring questions. Ministers have finally admitted today that they won't tell us what performance standards they're holding Serco to for the test and trace scheme, but apparently they do know that they haven't broken them. What a kick in the teeth to all those people in the NHS working flat out to save lives, see these private companies make millions from the NHS, but fail to deliver, whilst they struggle for oxygen supplies, turn ambulances away, and don't know when they will get the vaccine themselves. We will vote for these regulations. We want them to work. But if we want to persuade the public to support them, ministers owe it to them to own up to what has gone wrong. To say, sorry, it's so confusing. Sorry, it's so chaotic. Sorry, you can't hug your grandparents right now. Every family making sacrifices deserves that apology and a government to do better.
Now go to Damien Hines.
Thank you, Madam Deputy Speaker. And it would be an understatement to say that people have restriction fatigue. And I, like others, hate having to have the sorts of curtailments on people's freedoms that a lockdown means. And it's right, indeed, it's essential that these regulations be time limited. And I welcome the stipulations on regular reviews. But I will be supporting because the contrast, the choice before us is not between having curtailments or not. It's about the very difficult things that as a country, as a society, we do now, as against even harder things that we have to do in the future. And the data, Madam Deputy Speaker, are startling. In Hampshire as elsewhere, looking at the dramatic growth in the case rate since the start of December. And without truly stringent measures, there is a real risk of overwhelming the NHS. And that word, overwhelming or overtopping, these have become commonplace phrases, but we do need to stop, pause and reflect on their true meaning and implications far beyond COVID. The difference, of course, now, as the Secretary of State said, is vaccination. We can see ultimately a way through. And it's been impressive to see the speed with which the Hampshire vaccination programme has got off the ground. Clearly now, all hands have to be to the programme. I was pleased to hear what the Secretary of State said about the removal of red tape barriers to volunteering. And clearly there needs to be close attention to every stage of production, distribution and administering the vaccine. As well as the business support during lockdown, we're also clearly going to need a sector-by-sector plan for how we come out of this, for sectors like pubs, like hotels, like so-called non-essential retail, very essential to our high streets and to the events business. And we're going to need a national effort and mission on the return to school, preparing ahead of that for when it comes, repairing the impact that this period will have had again on children's lives and trying to get them back on track. It'll need different approaches for different age groups, different individual children. Some will have fallen back in some subjects, but not others. Some, of course, will have had truly terrible experiences in this time, and that will also put a strain on children's services departments, which we need to recognise. More generally, we're going to need even more attention than ever before around children and young people's mental health, and actually also getting back to physical exercise in some cases. There will need to be specific interventions in schools. The tragedy, of course, is that some of those had already started, and there is this £1 billion fund in place. That needs obviously to be kept under review. I very much welcome what the Prime Minister said earlier about one-to-one tuition. But we also need to think about what needs to be done to overcome the constraints on that. There's already hard in some places finding supply teachers, let alone one-to-one tutors. And there'll be a more important role than ever before for volunteer readers, for mentoring programs and strengthening links with business. I hope my right honourable friend can assure me this is being considered now across government.
We now go to Richard Bergen.
Madam Deputy Speaker, just over a month ago, this House voted on the tier system. I voted against. It was clearly inadequate to get the virus under control. I warned a lockdown would be needed in the new year if the government took its foot off the brake, but the government ploughed on, recklessly ignoring its own scientists, adding to our shameful death toll. I also voted against a tier system because of the lack of economic support. This lockdown is now necessary because government failures let the virus run out of control. But lockdown alone won't be enough to drive the virus down and to keep it down. A wider public health package must be in place alongside the vaccine. That must be driven by the principles of a zero COVID suppression strategy that has seen the virus virtually eliminated in many East Asian and Pacific countries, and which, if followed here, would have saved thousands of lives and allowed us to reopen the economy. The lockdown must also go hand in hand with an emergency financial package for our communities. This out-of-touch government can tell people to stay at home, but too many simply can't afford to do so. Poverty and destitution should not be the price our communities pay for government failures to tackle the virus. Just as the banks were once bailed out, we need a people's bailout for our communities if we are to defeat this virus. That means all non-essential workers who can't work from home being furloughed on full pay. All parents who can't work because they're dealing with childcare should be guaranteed furlough on full pay. Sick pay should be introduced at real living wage levels so people can afford to isolate. It means a minimum income guarantee, including for all self-employed people. And it means rent relief as well as an evictions ban so no one loses their home. Every child should be guaranteed a laptop and internet access to learn at home. And with universities moved online, tuition fees should be scrapped and accommodation costs reimbursed. Madam Deputy Speaker, this government's actions, inactions, delays and negligence have unnecessarily condemned tens of thousands of people in our communities to early graves. I hope justice is one day done, and its lack of financial support for people is causing wider social harm. It's shameful that hasn't been addressed today.
We now go to Ian Liddell-Granger.
Madam Deputy Speaker, thank you very much indeed, and I'm very grateful to be able to take part in this debate. There is no doubt this lockdown was needed and required, and quite rightly has now been enacted. But I would say I cover the vast rural area of the Exmoor and obviously the Levels in Somerset. One of the things I would ask the government to look at and consider is the rollout of the vaccine. A lot of my area is, as in many, of course, rural constituencies, is a long way from next door. And it is very, very difficult for people to get to vaccine centres. And at the moment, unless we have more places doing vaccines, it is very hard to be able to see what we can do to quicken it up in special areas like mine. There is no doubt that we need to do more. And I will praise, if I may, the 4 district councils in Somerset, and they're not all of my persuasion, who've done a remarkable job in getting the information out across the districts and the county to make sure that we are kept appraised of what is available. And not only that, they have made sure that where hospitals are being used and where they can use healthcare, it is being put forward very, very nicely indeed. I can't say that about the County Council, and people have heard me in this chamber, Madam Deputy Speaker, talk about the Somerset County Council, and quite simply, they are to be left wanting at the very highest level, and I'm very ashamed to say they're ours, but they are the government persuasion, but they are not doing the job. But there is one area that I do want to just concentrate on, and that is, of course, the Hinkley Point C nuclear power station. We must keep it going. This not only is fulfilling our commitment, but because of the way that Hinkley works and because of the continuous pour of cement, Hinkley is crucial. It is a national and international infrastructure project. It is of enormous importance locally and nationally to make sure that we keep those workers safe, but also keep them working. And that is crucial. And that means a lot of the people who live in the area who are of an age where they do tend to have children are finding it very hard to get childcare, but also to make sure that they can actually continue their work, and they are crucially needed on site. So therefore, my conclusion that schools, we need to think about this very carefully. I am very grateful for what the government has done and the way the BBC, for once, has actually stepped up to the mark. But we do need to look at what we do with these children whose parents are working. I have enormous distribution warehouses in my constituency that need people there all the time to keep the system going and keep the supply chain alive and well. And I would urge the government, please make sure the people who need to be vaccinated to keep the economy going are being vaccinated, and keep the vaccines local, and that is crucial. And if we can achieve those, as not only as a government, but as parliamentarians, then I believe, Madam Deputy Speaker, that we've done our job. Thank you.
Now go to Clive Efford.
Thank you, Madam Deputy Speaker. I will support these measures, but I regret the need to implement them. The public are weary of the government's U-turns, dither and delay at crucial moments throughout this pandemic, when what we've needed was decisive leadership. Nothing highlights the government's incompetence more than the approach to education and schools in particular. At the end of the last term, the government threatened legal action to keep schools open in Greenwich, whilst at the same time planning to keep all schools closed in January. And all the time, the government was aware that a new variant was ripping through Kent and the southeast. And today, the government recognised that the new variant was rapidly causing schools to be a vector in our communities. It's been obvious from the start of this pandemic that education was going to be severely disrupted due to school bubbles having to regularly isolate, and that online learning was going to be a regular part of children's education. And the Secretary of State is yet again way behind the curve. He failed to get devices out to children during the first lockdown, and according to Ofqual, 1.8 million children in this country faced the lockdown without access to digital devices. A report in July warned the government of a second spike this winter. It also warned that there was a possibility of a new variant, yet there has been too little urgency from the government to get devices out to those who need them. Too many children are going to suffer due to the inability of the government to read the facts before them. Now our schools are closed and confidence in the government is shot through. Teachers have seen how the virus has ripped through their schools. Parents are worried for their families. To create the confidence in the safety of schools, staff will need to be vaccinated as soon as possible. Teachers do not need scientists or experts to tell them the risks to which they are exposed when they are in school. Figures published today in the TES show that infection rates among staff in Greenwich schools was almost 3 times the rate of the local community. Teachers see these figures. They need to be confident that they are safe when they return to the classrooms. They have seen firsthand the numbers of colleagues and the pupils forced to isolate and those who have tested positive. The government must not wait to be forced into yet another U-turn. Teachers need to be tested alongside other essential workers, and the government should accept that now.
We now go
Thank
to
you.
Andrea Leadsom. Andrea Leadsom, are you unmuted?
Thank you, Madam Deputy Speaker. I want to make a few short points about the impact of COVID on babies and on young people. But first, can I thank my right honourable friend for his excellent support for the early years review that I'm chairing, which will soon announce its recommendations. My review has heard from many families what a tough time they've had in lockdown. Many struggle at the best of times with a new baby. Add to that being in lockdown with other children who also need attention, and even the simplest of tasks can feel like a massive challenge. So firstly, I sincerely urge my right honourable friend to send an instruction to all our superb perinatal workers, from health visitors to mental health and breastfeeding advisors, to keep providing the support and advice that new parents need, not just for reasons of safeguarding, but also for the many who are really struggling to cope right now. Second, I'd like to heartily commend my honourable friend for Chelmsford and others in government for their determination to keep early years settings open at this time. It's not just to help parents work from home, but crucially it's so that infants and young children do not lose out on their future development through this lockdown. And then finally, I'm really concerned, as so many colleagues are, about any loss of schooling for our young people. So whilst, like many, I applaud the BBC for introducing an element of curriculum-based teaching, I would urge my right honourable friends, the Secretaries of State for Health, for Culture, Media and Sport and for Education to join forces and press the BBC to fulfil its role as our public service broadcaster and take on the job of committing to teaching the whole curriculum. It's great that the BEAB will deliver reading, writing and maths to primary school children, but at secondary school the challenge is different. Students are studying a variety of subjects at different points, so the BBC should build a pick and mix package of lessons for students to choose what they need. And then teachers who've done such a superb job under such difficult circumstances could use those resources as a core to build from. Exercise, nutrition and even support for mental health could form a part of each day's televised curriculum, giving a bit of a boost to young people. Madam Deputy Speaker, our national broadcaster benefits from £157 a year from each licence. This is a chance to provide public service broadcasting at its finest, and it could remove at a stroke the twin challenges of a lack of reliable broadband and a lack of laptop access. Nothing can replace a strong family, good schooling and sound teaching, but our babies and our children and young people deserve the very best that we can provide. Thank you.
We now go to Julie Elliott.
Thank you, Madam Deputy Speaker, for giving me the opportunity to take part in this most important debate on the public health crisis facing this country. I believe it is right to go into lockdown. It is right to stay at home as much as possible to protect ourselves and others, and I will be supporting these measures today. However, these actions should have come much sooner. This is sadly a result of a long line of government failures, from the lockdown coming too late in March last year, through the fiasco of test and trace, to the chopping and changing of tiers and relaxations in the lead up to this latest lockdown. I have many concerns around this lockdown, not least the economic ones, and particularly for those people who are not supported at all by government programmes or by the Chancellor's support packages. But today I want to concentrate on just one, and that is the situation in our schools and the impact on public health. At the 11th hour, schools were instructed to close. In my role as chair of the all-party group on digital skills, I have raised the issue of the lack of data and devices for school-aged children throughout this pandemic for the last 10 months, working with my honourable friend often from Mitcham and Morden. 10 months on and this is still not sorted. Even with the announcement made today by the Secretary of State for Education, around 1 million school-aged children will lack the adequate data and devices to effectively learn. This is a disgrace. Children in that position have now been classified as vulnerable, compounding the situation in our schools. Our schools today have been given no guidance on which children are to be in school, which children are not to be in school. Have they got to impose limits? Have they got to include spacing? There is no guidance. I've spoken to many head teachers in my area today. Alternative education hardly gets a mention. They have a frequently changing school population and devices don't follow pupils. The prioritisation, vulnerable children, children with 2 key worker parents, 1 key worker with another parent working full-time, or a key worker with another parent not in work. Social care and hospitals will come to a standstill if this is not sorted. Teachers cannot be in 2 places at once. They cannot teach what is potentially more than half of a school population in lessons and teach online. All of these issues need addressing in order for this lockdown to be effective and our frontline healthcare and social care system to cope. and all of our children and young people to receive an equitable and fair level of education.
We now go to Alberto Costa.
Thank you, Madam Deputy Speaker. None of us wish to pass such restrictions on all our freedoms. We're a parliamentary democracy which cherishes freedom. But here we are about to pass draconian restrictions on our personal liberties. Our job must be to encourage, cajole, and demand from government that it does everything in its powers for the vaccines to be manufactured, distributed, and offered to our fellow citizens as soon as possible. Our ministers are working at breakneck speed, and I would like to pay tribute to the Secretary of State, his fellow ministers, and senior civil servants in central government managing the vaccination programme, and all those other public stakeholders, the NHS, doctors, nurses, organisations, and every individual who is helping to distribute as quickly as possible these vaccines. The more vaccination centres we have, properly staffed and resourced with vaccines, of course, the quicker we can vaccinate our constituents, and thus the quicker we can consider lifting these draconian regulations. Now, turning to South Leicestershire, yesterday I met with the CEO of the local clinical commissioning group, Andy Williams, and his fellow colleagues from the LPT, along with Lutterworth GPs. I thank Andy Williams for having met me at such short notice. I've been reassured by Andy Williams and his team that they are working to ensure that my constituents are offered the opportunity of receiving a vaccine in Lutterworth or Blaby or across South Leicestershire. I know that the House will want to pay tribute to NHS stakeholder groups like Andy Williams and the CCG for all the work that they're doing in opening vaccination centres wherever possible in each of our constituencies across our country. But I did impress on Andy Williams that the decision that we're about to take today as legislators of the sovereign British Parliament in restricting freedoms and in effect closing down large parts of our economy, our education centres, can only be lifted when he and his NHS colleagues succeed in their logistical organisation of opening and operating vaccination centres. So it is right, Madam Deputy Speaker, that we scrutinise the work of the CCGs across our country and all related NHS and other stakeholders involved in this mammoth task. I will be supporting the government today, but only under the clear understanding that government is doing all it can to obtain vaccines and distribute them quickly to all our constituents.
Sammy Wilson.
Thank you, Madam Deputy Speaker. Millions of citizens will be watching helplessly as they see the government plod towards another damaging lockdown while it responds to the Pied Piper advisors in Sage and their mournful dirge of fear and terror, because that's where we're going with these restrictions today. And unlike the poor children in the town of Hamlet, at least we know what the destination is, because we've been there before. We have seen the economic damage which lockdowns do. We have seen the damage which it does to people's mental health. We have seen the damage which it does to education. We know what it's doing to our country's finances. And yet, despite what the government tells us, we are doing this lockdown again to achieve the aims which we were told would be achieved by the first lockdown. We had suppressed the virus. We had put our foot on its neck, was the term the Prime Minister used. And yet, once, twice, and now for the third time, we are doing exactly the same things. And whilst I understand that the government has tried to support industry and support people who have been affected, and that's to be welcomed. And indeed, I know, coming from Northern Ireland, as a unionist, the measures which were taken by the Assembly in Northern Ireland could not have been taken. The support measures could not have been taken had we not been part of the union. And had we not had the resources which the union makes available to devolved administrations, and those who cry after a break-up of the union ought to remember that there is only by being a part of a bigger unit can we ensure that we at least have the support measures. But I would say to the Minister today that we've got this lockdown. I'm fairly sure the date of the 31st of March is there because it's intended to use that period. First of well, yes.
Thank you for giving way, my honourable friend. Does he share the concerns that I have and many others have in relation to the mental health of children? It's been strained like never before. And does he feel that it's time for the school online counselling services in every school for young people to ensure that they have the help that they need as a matter of urgency?
And that's one of the points I was going to come on to. If we are in for this long lockdown, then the government, first of all, cannot continue to abandon those self-employed who have been affected by previous lockdowns and still find themselves penniless and without any support. Secondly, they cannot allow children's education to be disrupted for that length of time. As a former teacher, I know how long periods, even summer holidays, can disrupt children's education. And it's the poorest people who are affected by this, because very often they don't have the resources. The children don't have the space. The parents don't have the ability to help their children through the time off school. And so it's important schools get back. And I know that despite the impression given by some trade unions, most teachers do want to get teaching their children in school. And indeed, some of them have been on to me this weekend saying, look, we want to get back to school, but we do fear, because there's an atmosphere of fear for our own safety. And some priority must be given, I believe, to ensuring that teachers are treated as frontline workers and are vaccinated quickly so that they can continue to have face-to-face education with children. Northern Ireland, of course, depends very much on aviation because of the sea barrier between here and Northern Ireland and the rest of the United Kingdom. And there needs to be a package of support for the aviation industry. There's no strategy there, and there needs to be a package of support made available there. But, Madam Deputy Speaker, the one thing I would say is that these restrictions, if they're going to be in place to the 31st of May, have to be examined regularly by this Parliament, and there needs to be a commitment by the Minister to bring them back on a regular basis so they can be voted on.
Thank you, Madam Deputy Speaker. Can I begin by acknowledging the difficulty of the task faced by health ministers and the Prime Minister in this crisis? We have a proportion of the public that wants to see a full lockdown, irrespective of the consequences to the economy, and we have another proportion of the population that wants to see no lockdown whatsoever, irrespective of the consequences to public health. But even those who reluctantly accept the need for further restrictions must be mindful of the balance between the authority of government and the responsibility of citizens. And I agree with my right honourable friend, the member for Altrincham and Sale, that we need to have sufficient parliamentary oversight during the period for which these restrictions will be in place. And I hope to hear from the Minister a commitment from the government for more debate and regular votes during this period so that Parliament can express on behalf of the public its view. I'd like to say a few words, if I may, about the vaccine programme. Firstly, to congratulate the government on having a world-leading programme on immunisation, with two very difficult elements that have to be kept in balance: supply of the vaccine and an adequate number of vaccinators. And of course, these two elements of the logistics have to go hand in hand and at the same speed. Not an easy task for ministers. We will have to have a surge capacity in vaccinators to be able to deal with demographic and regional differences across the country to avoid rate-limiting steps in the process. I made the point to the Prime Minister this morning about how difficult it has been for former GPs like myself to be able to get back into the vaccinating process and the number of courses we've been asked to complete. I was delighted to hear the Secretary of State announce this afternoon that there will be some changes to that. I think it's the fastest action I've ever known from a government. In 28 years, you raise it with the Prime Minister in the morning, you get an answer from the Secretary of State in the afternoon. And I think there is an easy fix, incidentally, to this by getting those who want to come into the programme to fulfil two of the better modules, the COVID knowledge, the core knowledge for COVID vaccinators and the minimum requirement of staff returning to the NHS. But we will also require more scrutiny of the vaccine process itself if we're to be confident in endorsing the public health policy that we have. We need to look better at the modelling and the data that is out there about the effectiveness of a single dose in creating sufficient population immunity for that to take place rather than the 2 doses. And we need to look at an assessment of the Pfizer vaccine in producing continued immune response in the time between the 3-week first dose that was originally envisaged and the extended 12-week period. It's essential that we know that this is based on proper scientific data. The key to the success of the strategy will be our ability to understand this data and enable us to unlock the lockdown and get back to normal. This has been a very difficult time for everyone, Madam Deputy Speaker. We must at least learn the lessons for the future, because this pandemic will not be a once-in-a-generation event.
We now go to Margaret Greenwood.
Deputy Speaker, the recent sharp rise in COVID-19 cases across the UK make it imperative that we have a national lockdown. 1 in 50 people in England have the virus. In Wirral, there were 606 cases per 100,000 in the week to the 1st of January, well above the average area in England, which has 481. And sadly, there have been nearly 600 coronavirus-related deaths registered in Wirral since the start of the pandemic. My thoughts are with their families and friends at this very sad time. So we all have to do everything that we can to halt the spread of the virus, to save lives and protect the NHS. As people right across the country play their parts by staying at home, the government must do its job and deliver the vaccine. As part of this, it must make it easier for retired NHS staff to help with the vaccination programme. One retired clinician has written to me to say that he has tried to register as a vaccinator, but found the NHS professionals' website unusable. The government must take immediate action to address this and make it easier for those with valuable medical expertise to volunteer at this time of national crisis. He also asked whether vaccinators will receive priority for the vaccine as frontline NHS staff. This is something that the government must do to protect them and to encourage other people to come forward. With these national restrictions in force, the government must step up and provide real support to the business and workers who will be affected up and down the country. Will the Minister press on the Chancellor the importance of extending statutory sick pay to all workers, including the self-employed, and to raise the level of it? In December, Sir Michael Marmot reported that England entered the pandemic with its public services in a depleted state and its tax and benefits system re-geared to disadvantage of lower income groups. He said the levels of social, environmental and economic inequality in society are damaging health and well-being. So will the Minister take action on the social inequalities driving health inequalities and join me and others across this House in calling on the Chancellor to stop the cut of £20 a week from universal credit? Last month, the Secretary of State for Health stood at the dispatch box and assured me that his government is increasing the public health grant next year. But a junior minister subsequently then told me that local authority spending to the public health grant will be merely maintained. So will the Secretary of State clear up the confusion in his department, commit clearly to increasing the public health grant and set out how much that increase will be? Madam Deputy Speaker, to conclude, we all have a part to play in tackling the virus. The government must ensure that it delivers on the vaccine, provides businesses and workers with the support they need, invests in public health departments and protects the NHS as a public service. Thank you.
Simon Fell.
Thank you, Madam Deputy Speaker. I will try and be brief. There's 2 areas I want to focus on: getting out of the current position in which we find ourselves and how we live with this virus for a long time to come. I think people generally accept that we are where we are because of the new strain of the virus, and the Prime Minister has had a really difficult choice in front of him: lock down again or risk the capacity of the NHS. But people want to get out of these restrictions as soon as possible. The cost of this virus is writ on the nation's finances, but also people's livelihoods, their mental health and their children's futures. We've now got a clear path out of lockdown with a vaccine, but we need to see what the roadmap to recovery looks like and start delivering on it. This is the moment for a small boats moment. And I very much hope that the government will actively engage and mobilise community pharmacies, growing the base of locations where vaccinations can take place, enabling vaccine delivery 24/7. With every person vaccinated, we get closer to the end of that tunnel that we keep talking about. But freedom's not just about the ability to leave your house, it's about life chances and opportunities. For areas like the North, which has been in effective lockdown for months, we need a clear roadmap for economic recovery too. The pandemic can't lead to further deprivation and more closed opportunities for communities like mine in Barrow and Furness. We need to roll out stimulus packages so we're able to build back from this. And we also need to take people with us. I applaud the government's efforts in transparency over the data they're sharing, but we need to go further, sharing daily vaccination levels by area, being clear about at what point on that journey we start easing restrictions and what the journey back down the tier system looks like. Finally, it would appear that we're going to be living with this virus for some time. Through an incredible endeavour, we've got a vaccine that works against the strains currently in circulation in the UK. There's already disquiet about the South African strain, so we need a clear plan for how we live with this virus and its children. There's an opportunity to strengthen the bioscience and biomanufacturing industries in the UK. The Vaccines Task Force has made huge strides in this area already, but we should be looking to expand the tools in our belt, not just vaccines, but also monoclonal antibodies to help those who've got suppressed immune responses and for whom a vaccine may not be the answer. We can't afford any more delays. Every pound spent on prevention will save many more in the future, save lives and get life back to normal sooner rather than later.
Very good.
We now go to Sarah Owen.
Thank you, Madam Deputy Speaker. Even before Christmas, anxiety was building and building as scientists warned what was ahead. The public could see what was coming. It seemed the only person who did not want to face up to the scale of the current COVID-19 situation was the Prime Minister. On one of the MP briefings of the Secretary of State, the Public Health England lead clearly stated that the change point for London came at the end of November, yet no action was taken by ministers until it was far too late, again. At every point of this crisis, the government has been reactive, not proactive, waiting until we are at crisis point to do anything. Over 76,000 people dead, families pushed to the edge, hard-working healthcare workers and hospitals at breaking point. This isn't the situation in other countries, yet it is here, and that is not all down to the new variant. The failure of this government to plan more than a few days ahead means people, organisations and businesses are given days, sometimes hours notice of changes to rules. People can't and shouldn't have to live like that. This anxiety is perhaps most acutely seen with young people. Today I spoke with the head of our fantastic Luton Sixth Form. There are 752 BTEC students, many taking exams this month. Again, they are left out of guidance, left waiting for confirmation of their futures. It is time this government stopped treating BTEC students as an afterthought and give them the certainty they deserve. And if we are to be ready to get back into classrooms in Luton North and across the country at the end of February, like we all want to see, we must see nursery staff, teachers, school support staff and school cleaners included as part of a vaccination strategy. And when it comes to a vaccination strategy, will one be published anytime soon? Because ramping up isn't a coherent strategy. We should know by now how long it will take to manufacture the necessary vaccines. What measures will be put in place to make sure that they are disseminated and delivered? Why not publish a schedule of delivery? Will people who can't be vaccinated be protected with ongoing shielding measures? What is the estimated critical mass needed to be vaccinated before we can start to relax restrictions? What measures will need to be introduced or continue while vaccinations are rolled out, or if they fail to combat any new variants? These are just the very basics of any vaccination programme. Yet we have heard very few answers from this government. To provide hope and a route out of the restrictions before us, we need to see an exit strategy. The public need to be informed every step of the way, not only when it is too late.
Mark Harper.
Thank you very much, Madam Deputy Speaker. First of all, can I thank you and the House staff for ensuring that we were able to be recalled today for the second time in a week to debate these important matters. That's important that this House is at the centre of this debate. I want to say, first of all, I recognise that the new variant and the significant growth in cases and the resulting pressure on the NHS does mean we're in a different position than that we faced in November. And for that reason, I won't be opposing these regulations, as I did when the government brought them forward in November. But I do agree with what my friend the Honourable Member for Altrincham Sales said. I do think that regulations that run all the way to the end of March is too far a distance in the future. And it seems to me the obvious checkpoint for government to come back to this House to seek the authority to proceed is the middle of February, when the Prime Minister set a very clear goal to have vaccinated those four first groups that the JCVI have set out, and when the government's going to have to make a decision about whether schools return after the February half-term. It seems to me that would be the point, that the government should bring that information to the House, set out its proposals, hopefully at that point to relax restrictions and to get children back to school, and to seek the House's authority to do so. And I would suggest that if ministers could go away and reflect on that and come back to us next week when the House returns after this recess, I think that would be welcomed by colleagues. Of course.
To the point of the schools, I just wonder what my right honourable friend's view would be about the vaccination of teachers, because if keeping schools open is such a priority for the government as it should be, then surely, however difficult it is to move that group up the vaccination list, it has to be something that we would consider. And to do that, to open them after half term, it has to be something that we do pretty much pronto.
I understand the point that my honourable friend's making, and it's been made by others. I have to say for myself, and obviously I'm not a clinical expert, I think the JCVI have got it right. I think the priority, no matter how important schools are, it has to be focused on reducing the number of people who are going to die and the pressure on the health service. And I think those are the right choices to make, because many teachers, those that are much younger, those that don't have underlying health conditions, the risk for those staff members is very low. And if they're in the high-risk groups with, for example, a serious underlying health condition, then they will already be going to be vaccinated early according to what's been set out. And I think that's the right approach. As soon as you move away from that, every group of frontline workers potentially exposed to the virus will make an argument that they should be higher up the list. And I think that would not be a sensible way of the government proceeding. So I think it should stick to the process that's set out by the JCVI. Two final points, Madam Deputy Speaker. On the vaccination schedule, I do think maximum transparency, as the Prime Minister said, is welcome, and I would urge the government in its daily vaccination numbers, and by daily I assume we mean 7 days a week, not just 5, we need to publish as much information as possible by region, by cohort, so that we can see how this is going and which regions of the country are going well, and potentially to have some positive competition where people are trying to do better. And my own region in Gloucestershire is making good progress, and I'd be pleased to see that information in the public domain. And I think the agreed delivery schedule from suppliers ought to be published. I think that'll give people confidence, and then I think we can all focus, as perhaps putting it in terms the Prime Minister would use, focus on getting vaccination done, which should be the nation's #1 goal in the next few weeks. The final point I'd make, because I know it's been talked about outside this House, vaccinating those priority groups doesn't just reduce the risk of death by a huge amount, by I think about 80%. It also reduces by almost 60% the hospitalisations, which of course therefore reduces the pressure on the National Health Service. Both of those factors mean that once we've vaccinated those the first 4 groups, I think we can be bold about looking forward to relaxing restrictions, and I hope the government can come forward at the earliest possible opportunity. Yep.
We now go to Mike Hill.
Thank you, Madam Deputy Speaker. I'd just like to say I'm immensely proud of the people of Hartlepool for the way they've faced up to this crisis and the spirit and determination that they've shown in overcoming the barriers of this pandemic. And I would like to especially thank all of the volunteers here in Hartlepool for the work they've done. They've done so much. They've kept our communities together. And I'd just like to take the opportunity to record my gratitude for the work that they've done. But in terms of the lockdown itself, there's many unresolved issues, particularly on the issue of work. There's distinct lack of clarity in regards to rules about who should or should not be working, who should be staying at home. And the recent example we've seen of schools. Why did the Education Secretary and the Health Secretary persist on Monday with their line that schools should go back in, only for the Prime Minister on the Tuesday to say that schools should be shut? The health and safety implications, the work implications are enormous, and the lack of clarity is not helping my constituents over matters like that. I'd like to say also that in terms of health provision, I'd like to see more commitment from the government to input into health commitments in my constituency, particularly around mental health, and to ramp up the vaccine provision. It's essential, it's important for the well-being of my constituents. But like everybody else in the country, the people of Hartlepool just want to see the light at the end of that tunnel that's always been mentioned, and want to see the rollout of the vaccine ratcheted up so that the nightmare can end for them and order can be re-established sooner rather than later. They understand the need for this lockdown, Madam Deputy Speaker, and the majority support it. But what they also want to see, what they want to see is clear leadership and direction from the government. No more dithering and no more delaying. And given the current R rates in Hartlepool, it would be irresponsible not to support the current position adopted by this government or to disobey the rules. But I say to the Minister, please, please don't test our patience. The people of Hartlepool have survived 2 lockdowns. They will survive a 3rd lockdown. They've got the stamina and the community spirit to do it. But Minister, please don't let them down. Get those vaccines out there and get our people and businesses supported here in Hartlepool and the North East. Thank you.
We now go to Simon Clark.
Thank you, Madam Deputy Speaker. I'm in total agreement with the government that the emergence of the new, more transmissible strain of the virus has once again changed the logic of where we stand and how we should now act. This week, we have effectively ended the difficult balancing act of trying to split the difference between containing the virus and keeping as much of our economy and society open as we can. A combination of our now having 2 safe and effective vaccines and the emergence of the new variant of COVID means that our focus is now overwhelmingly on containment. And I think that is the right choice, indeed probably the only choice that any government could take at this moment in time. For ministers to acknowledge this is not to show weakness, nor was it wrong to try to do everything in our power to try to retain some semblance of normality, and most especially in our schools. For let us not for a moment pretend that there are not very serious trade-offs in re-entering lockdown. The pain felt by the lonely, struggling business owners, children unable to attend class, and parents trying to raise them at home while working is all real and deep and miserable. Nonetheless, the data is impossible to argue with. 1 in 50 people in our country is ill with this virus, and the numbers are rising. So I welcome the Prime Minister's announcement warmly that we'll vaccinate all those in tiers 1 to 4 of the JVCI strategy by the middle of next month. It's great news that 1.3 million people have now been vaccinated, more than in the rest of Europe combined. But we have no time to waste in accelerating this. Every week that we're in this situation costs thousands of lives and billions of pounds. I have the highest regard for the Vaccines Minister, and I wish him every success in mobilising every deployable resource to combat this monster. Any business that can fight weak links in the supply chain should be enlisted to help. Any building that can sensibly be turned into a vaccination hub should be requisitioned. And when it comes to administering the vaccine, this should include the full use of the armed forces, dentists, community pharmacists, vets, and retired medical professionals. We must not be encumbered by needless bureaucracy, and we must not be constrained by normal working hours. I welcome the new daily vaccine statistics we'll receive from Monday. To help monitor progress, it would also be helpful to know our projected weekly trajectory for getting priority groups vaccinated. Madam Deputy Speaker, I also want to focus very quickly on one other issue, which is maintaining the highest quality education offer this winter. Our schools must not hesitate in accepting the children of key workers, and if a school has an unusually high proportion of key worker children, options should be looked at with neighbouring schools to provide support. We also need to focus on ensuring rigorous attendance by children in remote learning and ensure that no child misses out because of lack of internet or appropriate devices in their home. And I warmly welcome the announcement from the Education Secretary today to that point. This is a national crisis, Madam Deputy Speaker. I'm absolutely confident we'll overcome it together.
We now go to Munira Wilson.
Thank you, Madam Deputy Speaker. So here we are again, another month, another late lockdown, and all the harm that lockdown brings with it. Lost learning, lost livelihoods, and loneliness. Yet this drastic and painful action has tragically become, once again, our only option, given the alarming rate at which the virus is tearing through our country and the immense pressure on the NHS. A clear exit strategy from lockdown is critical, to which vaccines are central. So my Liberal Democrat colleagues and I reiterate once again our request to ministers to publish a clear plan as to how they will meet their initial target of vaccinating the most vulnerable, but also all adults beyond that. This plan needs to involve not just the NHS, but the military, the private sector, the voluntary sector, local government, and community pharmacies, whether they're big chains or independents. We need a 24/7 vaccination programme brought to every high street in the country so that those who are in hard to reach groups or those who find the hubs hard to reach can access these life-saving jabs. If the Prime Minister's serious when he says every needle in every arm makes a difference, why is it a physiotherapist in my constituency who's completed all the paperwork and training is yet to be called upon? We cannot afford to lose a single day. But alongside vaccination, we have to continue finding, testing, tracing, isolating every case, and importantly, supporting every individual with the virus and their contacts. Although we will be better protected from serious illness through vaccination, we must stop transmission, not least given the emergence of ever more variants. This is why it's utterly astonishing that none of the announcements in recent days have even mentioned test, trace, isolate. Have ministers given up on this vital and basic public health tool? People need to be paid to stay at home for 10 days if they've been told to self-isolate. That's full pay, not sick pay, not £500 after lots of red tape. And it's far cheaper than endless lockdowns. It must come with practical support too. Finally, compliance and trust is built through transparent communication. What are we all working towards? In particular, what do the numbers need to look like before ministers will reopen schools? We can't underestimate the impact on children's learning, their well-being, and the pressures and stresses that parents who feel like they've been constantly forgotten about are under. That's why a robust exit strategy is key, and it's much more than just vaccination. We can't keep blaming mutants and variants. We can't keep blaming the public. We can't afford any more deadly delays and incompetence. Responsibility lies squarely with the government at the government's door to deliver an efficient vaccination plan, improve test, trace and isolate, and communicate openly with the public.
We now go to Maria Miller.
Thank you, Madam Deputy Speaker. All governments have to make difficult decisions, but no other in peacetime has had to restrict our freedoms so profoundly. And our role as MPs is to scrutinise that. And I'd like to thank the Secretary of State, my right honourable friend, and his team for the briefings provided to all members with medical experts to provide professional interpretation of the data. But every person that we represent wants to know that action that's being taken today is absolutely necessary and that there's a clear way out so that people can get their lives back as soon as possible. The clear way out that my right honourable friend has identified is the vaccine rollout, that the UK has led the way in getting 2 vaccines approved and has had more people vaccinated already than all the countries in Europe pulled together, is a significant achievement. So again, I'd like to point out that paragraph 3.2 in these regulations needs some clarification because it changes the end date of the regulations to the 31st of March of this year, beyond the date when experts estimate that all those in the most vulnerable groups will have been vaccinated. Now, I understand the need for caution, but will that caution give room to delay? I know that isn't the Secretary of State's intent. So can he come to the House regularly to update us on the rollout of the vaccine programme so that we can scrutinise, raise issues with him that we encounter, and indeed perhaps identify more unnecessary red tape that needs to be removed? Now, when it comes to the sequencing of the vaccination, I think the government needs to look again at the priority given to vaccinating teachers in our communities. We know the damage done to our children's education through disruption. We know the pressure put on family life with schools being closed down. So in order to protect the ability of schools to reopen and continue to be open in the coming months and children's futures from more disruption, I believe that we need to think about putting teachers into that priority group. And finally, Madam Deputy Speaker, I'd like to take this opportunity to wholeheartedly thank the whole of our North Hampshire NHS team, our local trust and also Hampshire County Council and our amazing local borough council for the incredible work that they have done to help keep my community safe in the recent months. And it's with a heavy heart I support these measures, Madam Deputy Speaker, but we can be in no doubt at all that they are essential today.
We now go to Yvette Cooper.
Thank you, Madam Deputy Speaker. Cases in the Wakefield district have gone up by over a third in a week. They're still lower at the moment than in November when Pinderfields Hospital was pushed into crisis, but they're rising fast and none of us want to go through that crisis again. And that's why measures are clearly needed, but this is a really difficult time for everyone. And I want to thank the staff of Mid Yorkshire Trust, the NHS, healthcare staff, key workers working non-stop to get us through this difficult time, who we owe so much. The community hubs we set up in Normanton, Pontefract, Castleford, Nottingley, supported by Wakefield Council, are working hard again with volunteers and neighbours helping each other. But we urgently need more support for businesses and families from government, especially those excluded from economic support from the start. And we need the rapid action to roll out the vaccine, and we need the programme to work, which is why I want to raise concerns about the potential threat to the vaccine programme from the new South Africa variant. Senior scientists have said this may be less susceptible to the vaccines because of the additional mutations. I know government is worried about it, but I do not understand why they are not taking urgent action to prevent the South Africa variant being brought into and spreading across the UK. Rightly, the government has stopped direct flights from South Africa, but the first wave shows that is not enough. Genomic evidence quoted in our Home Affairs Select Committee report in August showed 34% of imported COVID cases came into the UK from Spain, 29% from France, less than 1% came directly from China. So when the Prime Minister says that we've taken strong action by stopping direct flights, he's kidding himself. The South Africa variant is already identified in France, Austria, Norway, Japan, Australia. And currently our border checks are weak and not taken seriously. Travellers aren't tested before arrival or on arrival. Untested, they get public transport from the airport, pop into the shops to get milk before going home, and the checks on self-isolation arrangements are minimal. The Financial Times says the government's plans to introduce pre-travel testing have been delayed because the Transport Department wants UK residents to be exempt. Well, if true, that is ridiculous and dangerous because COVID doesn't discriminate and we cannot afford delay. Other countries have strict rules, including quarantine hotels, regular tests, airport testing, repeated testing, quarantine taxis with screens. Look at New Zealand, Australia, Germany, Italy, South Korea. The UK has to get serious about this too. And that means we failed to do that the first time round. And as a result, we face our third difficult lockdown now. We cannot afford further waves of this virus. We have to make sure we do not make those mistakes again.
Adam Holloway.
Thank you, Madam Deputy Speaker. Can I again congratulate the government on its amazing foresight in getting so far ahead of the game in terms of the vaccination programme. A few minutes ago, I spoke to a prominent Gravesend GP, Dr. Ruben Minhas. For the last couple of weeks, he and his team have been busy contacting local over 80s, booking them in and getting them into the surgery to get the inoculations done. But in order to do this, he's had to get all his staff on the phones, all the receptionists, husbands, wives, partners, to get, and this is having a real effect on the day-to-day work of the surgery. So perhaps the whip could pass on to the Minister. Perhaps we should be giving GPs a bit more help with bookings, especially since this is going to ramp up as more vaccine becomes available and we go to different groups. Throughout all of this, many people have been really quite heroic, especially all the people who go to work day after day knowing that they've got an underlying health condition that makes them particularly vulnerable to the virus. I can think of one head teacher in my constituency who's shown what can only be described as extraordinary bravery, going into school every day, risking his life. And we all know of people in our constituencies, tens of thousands of them perhaps around the country, who knowingly put their lives at risk every single day in the public sector, in the private sector, in schools and supermarkets, in hospitals and food packaging plants. And I'm glad such people will soon be inoculated. But I don't think it's right that there should be any particular acceleration for those working in particular settings like schools who are not in vulnerable groups. I think this would delay what the Prime Minister describes as the fire break, where we deal with the people who are most likely to die. That way, the deaths go off the cliff. I also think we need a can-do attitude from now. In rolling out this massive programme of vaccinations, I think it's critical that everyone in the public service shows the can-do attitude that we've witnessed from all the staff in Darren Valley Hospital who've been looking after my constituents over all these months. All of us in public service should be following their example to do everything they can do to get these first 4 groups vaccinated. And look, this is not the time for bureaucracy or finding reasons why something or other can't be done or it's just too difficult. I was horrified when I heard of one hospital who received 3,000 doses of vaccine on the Wednesday before Christmas and didn't start using it till nearly 5 days later. Everyone in this country, especially those of us paid from the public purse, must be treating this vaccination programme with the greatest urgency. This really is a national emergency, and there should be no room for anyone who's not now on a war footing to get these early groups vaccinated.
We now go to Jeff Smith.
Thank you, Madam Deputy Speaker. I'm going to vote for this legislation. It is sadly necessary, as today's awful COVID figures demonstrate. I want to speak briefly about how we help people get through the difficult period ahead as we vote to lock down the country today. If we're going to affect so many lives and livelihoods, if we're going to ask our citizens to help the nation by doing the right thing and making sacrifices, then we as a nation have to do the right thing by them. We need to provide the support people need to enable us all to work together to get through this. In the short time available, I'm going to mention 3 specific areas where we need to do more. Firstly, for businesses, especially small businesses and the hospitality sector. Business rates relief and additional grants are welcome, but for many businesses, their premises costs are the biggest burden. They still have to pay rent, and for many, it's unrealistic to think they can keep building up debt without some additional support. So can I urge the government to consider a scheme of shared rental burden, where the renter and the landlord, also the government and the banks or mortgage lender, all take part of the responsibility. The country bailed out the banks during the financial crisis, and they should step up and be part of the solution now. There are models elsewhere, for example in Australia, we can look at as a basis for this. Secondly, as I asked the Prime Minister today, so many people still aren't being helped by the self-employment support scheme. We've now had 9 months to come up with a plan to support these workers. People who've worked hard, paid their taxes, and now aren't getting a fair deal. There are potential solutions out there, and I'd urge ministers once again to look at the proposals from the Federation of Small Businesses, amongst others, to find creative ways to help people who are really struggling. Many of my constituents are self-employed, and many Mancunians work in our world-leading creative industries. Our festival industry alone is worth 1.7 billion to the UK economy and supports 85,000 jobs. Festival organisers are struggling to get insurance, and they're asking for a government-backed insurance scheme to enable festivals to be planned with confidence. Because if we don't help out, many will be cancelled in the ongoing uncertainty, and we'll miss out not on just an important cultural part of our summer, but the economic benefit that helps communities and supply chains across the nation. So please, I hope the government that will look positively on that. And finally, our councils have been at the forefront of this crisis, supporting people and coordinating services. The government said they'd give our councils everything they need to do that, but the overall impact of COVID-19 in Greater Manchester is £802 million this year alone, and government funding for the pressures is £404 million leaving a gap of £398 million. And as a result, Manchester City Council is facing cuts in the region of 50 million this year. That's not sustainable. So I ask the government to fulfil their promises, give our local authorities the support they need to help us all get through this. Thank you.
Thank you very much, Madam Deputy Speaker. It's a pleasure to speak in this debate. I have not always been able to follow the government line through the division lobby when it has come to further restrictions, because I have felt that in parts they have not been proportionate when looking at the wider public health concerns and the operational state of the hospital and the concern as to our loss of liberties and making things worse. That situation for me changed, Madam Deputy Speaker, when the vote came for Tier 4 measures to be put into my county and other parts of the country, because I could see two things. Firstly, the vaccine in sight, so we don't have this perpetual lockdown situation. The end is in sight. And secondly, the hospital operational capacity is incredibly tight and on the edge. And I've just heard from my chief executive who tells me that she's got 50% of her beds with COVID patients and all the ICU units are full. So things have changed, but I believe that we are in the final chapter if we can deliver the vaccine programme, and that's why I will be voting with the government this evening. I never thought I would see the day when I would be voting through a division lobby to see pupils denied their right to attend school, but I do feel it's absolutely vital. I just want to make one point about the cohort of those being vaccinated. It makes no sense at all to give a vaccination to a 40-year-old teacher rather than that teacher's 80-year-old mother. If you do so, you may be in the situation where, firstly, that 40-year-old teacher, whilst being vaccinated, can still transmit to the 80-year-old mother. But with the vaccine in short supply, it's the 80-year-old mother that is in danger of losing their life, and that is what keeps us in lockdown. So we will never reopen the schools if you end up vaccinating the teachers and not that cohort. I really wish honourable members on both sides of the bench would really see that argument as the best way to get the schools open again. The other message I want to make is for young people. Rightly, people have talked about the concerns of young people on their mental health and the challenges, and I feel that too. But I really want to make sure that young people are not seen as victims. We don't make them become victims. This can actually be their defining moment where they give something back to the generations that went before them. It will be the sacrifices that they make that will actually save lives. And we must make sure that we put something back. So for those older generations who are having the sacrifices made by the younger, ask yourself, what can you do to counsel and pass on wisdom to help young people catch up in school? What can you do to offer an apprenticeship to a school leaver? And what can you do to really make sure that those young people have the confidence to feel that they have achieved great things by making a sacrifice, as those did during the Blitz years? And to all those young people, I say, you will come through this stronger. We will make sure you are rewarded, but please don't be defeated by this pandemic in the way that we will not let older people be killed by this pandemic.
We now go to Stephanie Peacock.
Thank you very much, Madam Deputy Speaker. This new lockdown is a position that none of us wanted to be in, and I begin by paying tribute to all of our key workers. Whilst there is a light at the end of the tunnel with the vaccine, this government's inability to react quickly and with clear leadership has meant that people have lost their lives and livelihoods. The former Conservative Chancellor, George Osborne, was right when he wrote yesterday, "In hoping for the best, we have failed to prepare for the worst." The government must not waste the time given to them in this third lockdown. The vaccine programme must be delivered with the speed and efficiency that people have been promised, alongside an effective test and trace system. The economic impact of this crisis has been catastrophic. In Barnsley East, over 3,500 people are now recorded as being on universal credit. Unemployment has risen, and the local food bank has seen demand increase by 300%. This is unacceptable and avoidable. The level of statutory sick pay in this country is completely inadequate. The UK currently falls behind the standard set by some of our European neighbours. If you're a higher earner and your wage is cut due to sickness, you're more likely to be able to absorb the financial blow. Statutory sick pay is currently set at a flat rate of £95.85 a week. If you earn minimum wage or are on a lower income, how are you meant to cope with such a reduction? You can't choose to pay less of your rent, mortgage, or bills. The UK is one of the very few European countries that still pay sick pay in this way. Now, I acknowledge the government introduced a one-off payment for people isolating on low incomes, but there is a lot of evidence to show that it isn't working and too many people are still falling through the gaps. Take, for example, the man in Barnsley, who when asked if he would isolate if he was contacted by Test and Trace, he said no, probably not. And when asked why, he explained, if I don't work, my family don't eat. People want to do the right thing, but simply cannot afford to. Proper statutory sick pay would make it much easier for people to take a test and isolate. And it is absolutely crucial in stopping the spread of this deadly virus.
Walker.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, I can't support this legislation tonight. I can't support criminalising a parent for seeing a child in the park over the coming months. It's not within my DNA to do that. But, Mr. Speaker, of course I will follow the law and respect the law. You have the argument in the House of Commons, you divide, you're on the winning side or the losing side, and I will be on the losing side. There is no doubt of that. But I do not wear the fact that I will support the law with great virtue, because it's so easy for me to comply with the law, isn't it? It's so easy for most people in this House to comply with the law. We're comfortably off, we live in nice houses, we have gardens, we have outdoor spaces, we have access to family. The same applies to those journalists who fill our TV screens every night with their wisdom and wit about how people should comply with these regulations and how they sneer at those that can't. But Mr. Speaker, Mr. Deputy Speaker, the next 3 months are going to be really, really hard for a lot of people who don't have my advantages, my advantage of a monthly salary, a monthly pension payment. These are people who are going to be worrying about their jobs, about their future, about their mental health, about their family relationships, because they will miss people terribly, or they will be in very small environments where apparently they can only leave to exercise once a day, and then sadly some of these people are going to break, and it's going to be too much for them. And that is when we in this place, the journalists up there with all their privileges, instead of sneering and dismissing them, instead of calling them COVIDiots, should show some compassion and understanding, because we should wear our advantages and privileges with great humility. I don't want to hear from another constituent who's having a good lockdown. I'm really pleased that you are, but my voice is for those who aren't, for those of my friends and neighbours and constituents who are struggling day in and day out, whose mental health is not in a healthy state, but has deteriorated, who are wondering how over the next few months in the middle of winter they are going to cope with this. So in my remaining remarks, can I just ask colleagues, can I just ask people out there who are so fortunate to show some compassion and understanding for those who are not so fortunate?
Video link. Bell.
Sorry, thank you. It's been nearly a year since we've begun both being aware and dealing with this pandemic, and no one could have predicted it. We accept that. But the government, after this whole year, keep getting this wrong. In the 6th largest economy in the world, we have no excuse for the worst per capita death tolls, one of the worst per capita death tolls, and no excuse for one of the worst economic outcomes. We do need a national lockdown, but the only reason why we're having to lock down yet again is because every single lockdown has started too late and been lifted too early. So of course we haven't been able to get control of the virus, and of course the lockdowns have had the minimum effect because of how they've started. We haven't gone far enough. We know what needs to be done, and before we can get back to normal, we need to focus on bringing the infection rate down. And unfortunately, so far, it doesn't seem that the government have committed to doing this. We need a strong elimination strategy that drives cases down. We're at 1 in 50 in this country and 1 in 30 in London, where the House of Commons are infected with the coronavirus. And that makes me beg the question, how many people on the estate at the moment could possibly have the virus? It's been far too long looking at how successful people have been in other countries and not thinking to ourselves that we should also adopt a zero COVID strategy. And that strategy needs to be complete if we are to see the R rate go down. So yes, we need this lockdown, but the government cannot keep asking people to give up their freedoms and their livelihoods and not stand by them. Because yet again, the support measures do not, and they have never fully met the needs of this country. Again, after a whole year, the government have failed to provide for the 3 million excluded from all government schemes. We need an effective track and trace system. We simply don't have it. We need more funding for charities and local authorities who've been dealing with the brunt of the virus. We need rent relief for tenants, a ban on evictions. We need an increase on statutory sick pay, and we need laptop and a broadband for every single child that needs it. Whilst the vaccine is very, very welcome news, the success of the lockdown cannot be measured by the vaccination programme alone, especially because of how long it's going to take to get it to the entire population. So again, we need to focus on bringing the R rate down, and we need to look at these measures properly before we begin to release restrictions, because we cannot, after an entire year, keep making these mistakes again and again. It is costing lives, it is costing livelihoods, and so far it's been a complete and utter shambles for which this government has no reasonable excuse. Thank you.
Thank you. Video link. Sir David Evenett.
Thank you, Mr. Deputy Speaker. I strongly support the government's policies and these new public health regulations brought in to help defeat this dreadful coronavirus. Regrettable, but absolutely necessary and requiring compliance by us all. I commend the Secretary of State for all his work, hard work and determination during the past 10 months, and also for his briefings on the issues. The Prime Minister, I know, regrets the need for these lockdown measures, but he had no choice because of the seriousness of the situation. I'd like to begin by paying tribute to Bexley Council for all their tremendous work, and for all the local NHS staff across South East London who worked for so long and so hard during this national crisis. Also the community workers who've done such great service across my borough to help the most vulnerable. I'm of course extremely concerned about the rising infection rates in London, and particularly in my borough of Bexley. The new strain of the virus has had real and detrimental consequences for my Bexley Heath and Crayford constituency, not just the spread of the virus, but also the curbing of liberties, the closure of clubs, businesses and shops, and of course, those who tragically have lost their lives to the virus. To prevent the spread of the virus and further deaths, these measures are essential. I'd like to also highlight the growing concern of mental health issues in my area, particularly those living in overcrowded homes and small houses, living alone, the elderly and the disabled. The closing of schools, of course, is regrettable, and there will be education consequences. However, this crisis needs strong action, and restrictions are necessary to safeguard the vulnerable, and with the vaccination, help beat the coronavirus. My third point is really the matter of vaccinations and the opportunity for retired GPs, nurses and pharmacists to assist in the delivery of this massive project of mass vaccination. I've been given examples of people offering their services, but either have been given a plethora of forms to be filled in or have not received any response to their offer of help. This has been disappointing, but today I do commend my Right Honourable Friend Secretary of State's actions to cut the bureaucracy and increase the vaccine rollout. I also welcome his comments about Sunday vaccinations. These comments need to be widely publicised to increase public confidence. These facts need to be known, and my constituents are obviously looking for regular updates on the progress of vaccination and hopefully when the lockdown will end, an exit strategy. But in conclusion, I share my Right Honourable Friend's determination to have a vaccination, roll out and support these new public health measures. My constituents will also support them, and it's necessary to save lives and defeat COVID-19. We need to get the vaccination done.
Link. Janet Davey.
Thank you, Mr. Speaker. I'm grateful to be able to speak in today's debate, and I would like to start by extending my deepest sympathy to my staff member, Rosina, who today lost her mother to coronavirus. Words cannot describe the devastation this virus has caused to so many. Mr. Deputy Speaker, there are so many concerns I have with the impact of the government's handling of this pandemic, and there are too many pressing issues in Lewisham East to mention, but today I would like to raise the crisis facing our ambulance services. I've been speaking with a constituent of mine, Mr. Clive Toombs, who is a technician in the London Ambulance Service. Mr. Toombs told me of the sheer stress level he and his colleagues are experiencing. As a secretary for his branch for GMB Union, Mr. Toombs speaks not just for himself, but for thousands of members serving the capital. Staff sicknesses in the ambulance service is at an all-time high. Mr. Toomb estimates around 6,000 staff across the service are off sick, the majority with COVID-19. He has lost colleagues to the virus and other colleagues are hospitalised. Many others will understandably be suffering from declining mental health after seeing the very worst of the impact of this virus and that which it is having on our people. PSD is also becoming commonplace. Phone operators are having to play God in choosing who amongst the hundreds of callers will get an ambulance. Mr. Toombs also speaks of the relentless shifts that those in the ambulance profession are working. Those on the front line are working 12, 13 hours and sometimes 14-hour-long shifts, and all too often they don't get a rest or a break before starting their next demanding shift. Mr. Speaker, we cannot expect our ambulance service to work all hours of the day and night, providing high-quality care, think quickly and making smart decisions and putting themselves in danger without having enough time to rest. I'll be grateful to hear from the Secretary of State for help on this issue. Many of us have been distressed by images over the Christmas period of ambulances piling up outside hospitals, particularly in London. Every one of those ambulances has someone who is in urgent need of medical care, and some of them, their lives depend on it. A&E departments are not able to keep up with the level of demand, and so ambulances with patients in them have to wait for hours upon hours, up to 11 hours, Mr. Toombs says. They wait on trolleys that provide them little comfort, only meant for short use. Staff sit with them in vehicles, but struggle to provide safe ventilation in the cold weather. There is no access to a toilet or a wash basin in an ambulance. None of us would like to imagine our parents or partners or elderly neighbours or loved ones suffering in an ambulance trolley waiting to be admitted. But what's more, Mr. Deputy Speaker...
Order. Sorry, Janet. Sorry, Janet. Time's up. I apologise. Siobhan Bailey.
Thank you, Mr. Deputy Speaker. There are 100 things that I could rise to stand up for Stroud about today, but given the shortness of time, I will focus on education, exercise and entrepreneurs. And firstly, I want to say that I will be supporting the government tonight. I am clear from speaking to the Gloucestershire NHS and health teams that our hospitals and key workers are under extraordinary pressure. Life would not be normal and local businesses would not flourish if ambulances were queuing around the Gloucestershire Royal, or if worse still, images of body bags were filling the news like we saw in other countries. I accept that drastic action is needed right now, and it is for all of us to work together to get out of this lockdown with the can-do attitude and compassion shown by my friends on either side of me from Gravesham and Broxburn. But Mr. Deputy Speaker, I thought that we had reached an understanding that education needed to continue. In the first lockdown, 55% of teachers in the most deprived areas suggested students were learning for less than 1 hour a day. Eating disorders are now on the rise and mental health issues are rife. We have to be honest, there is simply no replacement for face-to-face teaching. No amount of money or whizzy technology or free devices will bridge the education gap that the COVID pandemic has created. Children need time in school and they need their families who are not fraught from juggling homeworking and homeschooling and worse. Stroud teachers are also phenomenal and have already jumped through extensive logistical hoops to get our schools COVID safe. I ask that the government helps to reopen schools without delay and does not let children get caught in political games. On exercise, I want to see gyms, park runs, fishing, clubs like golf, tennis, archery and swimming open ASAP. Living with excess weight puts people at greater risk of a serious illness or death from COVID-19. Government guidance says look after your physical well-being. Your physical health has a big impact on how you are feeling emotionally and mentally. So why, Mr. Deputy Speaker, cut off businesses that effectively help us fight COVID and protect our mental health? Do not get me wrong, the rise of walking, running, cycling and online classes is positive, but please don't underestimate the benefits of gyms and sports clubs. The professionals who work in these places know their health and mental health onions, and we need them to survive, to produce the healthy society that we know is necessary to cope with COVID now and prosper in the future. And please, on entrepreneurs, will the government look urgently at the camera campaign surrounding the sale of takeaway alcohol as per my Prince Albert pub in my patch? They brilliantly pointed out that it's not fair to stop this activity when supermarkets and off licences can sell regardless. I'd be relentless on the plight of the wedding and events industry. We need a roadmap and pilot studies in Stroud and our fantastic limited companies who reside in Stroud. It was wrong to not give them support when the virus was going to be gone in a few months, and it's wrong now.
Video link. Ian Byrne.
Thank you, Mr. Deputy Speaker. Infection levels in Liverpool are now higher than in the second peak in October. This is why local leaders call for an urgent national lockdown to try and control the spread of the virus and to prevent pressure on our hospitals, which I fully support, along with a rapid increase in vaccinations. I've just been on a call with head teachers from SEND schools in my constituency, and I want to ask the Secretary of State at the outset, and I cannot stress this enough, that teachers and teaching staff are offered vaccinations as a matter of urgency. They are still out working on the front line, and they need these now. The government must also address inequality at the same time as implementing the third lockdown. And I will now turn to some of the many other issues that my constituents in Liverpool West Derby wrote to me about, which must be urgently tackled. Firstly, access to food. There are 10 million people in the UK living in food insecurity, many of which are queuing up at food banks. We've seen pictures on Christmas Day in Newcastle. The government must step in to support, and it must cancel its planned £20 a week cut to universal credit and bring in the right to food. Next, financial support. Mr. Deputy Speaker, one of my constituents, Martina, who was self-employed, has now gone 13 months without any pay. Where is the Chancellor today, and where is his financial plan to support people in Liverpool? On top of this, there have been many punishing job losses from rogue employees. Harrowing examples include the pernicious use of firing me hire by BA and British Gas, and the treatment of a loyal workforce by Rolls-Royce at Barnoldswick. The government must step in and fight for them and outlaw this pernicious practice which drives people into destitution. I must also mention support for renters and the homeless. Many renters are faced with huge arrears and have been forgotten by the government. They must now support renters and at the very least extend the eviction ban beyond the 11th of January. And unbelievably today, we heard the Everybody In scheme, which rightly has won praise, will not now be continued in the depths of winter and a virus out of control. Even before the pandemic, our communities were facing a crisis of low pay, insecure work, food and fuel insecurity, unaffordable rents and cuts to welfare and services. So many people are already at a tipping point, and the pandemic has pushed more into unimaginable levels of hardship. Inequality and poverty are not inevitable. They are as a result of political choices made by this government and can be solved by a government with the will and the moral fortitude.
Sir Robert Sims.
Thank you very much. This is a difficult crisis for the government, and no doubt the Prime Minister and the Secretary of State for Health must have constitutions of an ox to deal with the very difficult decisions that they have to do every day. But I'm afraid I can't support this legislation today, and the principal reason is at the end of last year I thought we'd got to the point where Parliament would be consulted on a regular basis. And we have regulations today which set out the 31st of March.
which is a full 3 months. And although we've had warm words about, of course, we're going to review when we come back to discuss with Parliament, as of right, we do not have any ability to influence this once it's passed. It's essentially a blank cheque of 3 months to Public Health England to do what they wish. And that's why I worry about the legislation today. If the legislation said a month and a review, or a month and a review, I might even be tempted to vote for it, Mr. Deputy Speaker. But the 3 month nature of the regulations seem to me too long and I don't think are proportionate to where we are. Parliament's sitting. It's not, the reality is we are here, so we need to be involved in these decisions. I notice regulations have been passed so that if you sit by a river with a fishing rod, you are breaking the law under the current lockdown regulations. People will follow sensible regulations if they feel it saves lives. But the bureaucratic nature of this essential lockdown is, I think, such that people will get frustrated and they may well actually break the regulations because they can't understand why they are there. So we need these reviewed, we need Parliament involved, we need the government to listen. I was somewhat concerned earlier when the Secretary of State was talking about when this would be lifted. We need a programme. We need the criteria for lifting. Is it hospitals? Is it infection rates? Is it deaths? Is it all the vulnerable people actually inoculated? But we heard earlier, once they're inoculated, the government would think about it. And I have businesses in my constituency. I have people work. I have people trying to pay a mortgage. People have worked for generations sometimes, and certainly for decades, building up businesses. And they are being closed down, and they may not survive. Taking away the freedom of people to trade is a very substantial thing to do. And there are some people who will not survive the regulations and the way in which we're locking them down. And that's one reason why I'll call a vote tonight. I think if we are going to take away people's liberties and freedom, let's do it with our eyes open with a vote of this chamber. Because I feel very queasy about destroying people's livings in my constituency when people work so hard. The people who make these decisions are superannuated, pension, public sector, safe. They can retire. In my constituency, there are people who don't have these advantages.
Video link. Daniel Zeichner.
Sadly, the new restrictions are as inevitable as they are necessary. The government says that it's a new variant that's to blame for the problems, but frankly, it's been obvious for months that the NHS was going to come under huge stress during the winter. And I think it's time for less flowery language from the Prime Minister. Too much bluster, too much over-optimism. Frankly, we're all tired of it, just as we're tired of the lockdown itself. And the chaotic way in which the latest measures have been introduced have caused particular and understandable fury because it was all so unnecessary. Leaders in educational establishments in Cambridge have been left in an impossible position. On Monday, trying desperately to set up testing measures demanded by government, trying to reassure pupils and parents that they'd be open the following day, only to get texts and emails late in the evening completely contradicting the previous advice. And now they're suddenly expected to be able to switch to delivering teaching remotely. BTEC exams in FE colleges having to be cancelled at the last. And in schools, well, the front page of today's Cambridge Independent newspaper tells us a story. A disgrace, say teachers. The head teachers at St Matthew's in Cambridge, Tony Davis, describes a day of chaos, and as he observes, so much heartache could have been saved if the decision had been made in a timely manner. And Niamh Sweeney from the National Education Union rightly observes that because of the chaos, the government has jeopardised public health. In education, the problems go further still. While local education authorities like Cambridgeshire have stepped up, they're hampered by the patchwork of competing governance arrangements now in place. They can advise, but for multi-academy trusts, the decisions in some cases are made far from Cambridgeshire, out of sight, beyond local scrutiny or influence. And the diminished powers of local authorities, particularly second-tier districts, are brought into stark focus when councils like Cambridge City find they do not have the powers they need to deal with public health hazards. The temporary closure of Cambridge Market is a case in point, where lack of the precise powers needed have led to an overall closure that no one wanted. So I will support legislation today, but I also highlight another area of government failure. We've heard a lot about testing, a lot about vaccination, but precious little about isolate. Behavioural scientists advise that people do what they're asked when they're motivated, have the opportunity and the capability. Sadly, the government has failed to motivate. It hasn't celebrated those who do and hasn't ensured there's the opportunity through providing accommodation or the right financial support. That's why it hasn't worked. I drew the Secretary of State's attention this weeks ago when I learned that just 14 people in Cambridge had taken up the offer of financial help to isolate. The Secretary of State kind of shrugged, and it's that kind of failure from government that means the situation we're in today was not inevitable. It could have been different, but this is a government unwilling to acknowledge mistakes or learn from experience. We're all at risk because of it.
Video link. Pauline Latham.
Thank you, Mr. Deputy Speaker. Well, the COVID has outwitted us again. It's come back with vengeance and it's hitting many, many people. It's affecting the hospitals to such a degree that the tired nurses and the tired doctors who've been working relentlessly are struggling. So we have to do something about it. But is a lockdown the answer? We've locked down before and the figures have gone up. The answer is vaccinations, as we've been told by many people. Vaccinations are the cavalry, but this cavalry needs to come fast and it needs to come with great ambition. We need people to be out there vaccinating, and I'm delighted to say that one of the volunteers who couldn't get through the form has now been accepted because she's not had to go through the form. She's been accepted because she's a recently retired nurse and she wants to help, as there are many people who want to help with this vaccination programme. We can ramp up those vaccinations once we've got the vaccine in place. And I accept with the new vaccine, it'll take a while, but it needs to ramp up. We need big ambition, not 2 million a week. We need at least 4 million a week. But what worries me is the Secretary of State and his opposite number on the Labour front bench both seem to think that even though we'll be vaccinated, we might not be able to go out. I did ask a question yesterday about an 82-year-old couple who haven't seen their brother for for 9 months at least, and they want to go and see him. They're about to be vaccinated on Saturday. They want to wait the requisite 3 weeks and then go and visit the brother, who's also in his 80s and will also have had the vaccine and will have waited the requisite time. But I'm told that they can't do that. Now, if we are told we have to lock down and the cavalry in the terms of the vaccine is coming, we have to have some hope that we're going to be able to go out and we are going to be able to resume some sort of normality, that schools can go back, that businesses can operate normally. Otherwise, we're just going to be in lockdown for months and months and months more. Now, that might be what some people want, but it isn't what I want, and it's not what my constituents want. They want some freedoms, and we have to have those. So let's get the vaccinations out. Let's use every community pharmacy we have. Let's use every single St John's ambulance person there is. Let's use everybody who is qualified to be able to do that vaccine. And let's get those vaccines out fast. And let's get people moving so that we can make the most vulnerable safe, so that they will not block up the hospitals, and then we can relieve the health service for what it needs to do, which is routine work.
Video link. Clive Betts.
Thank you. Thank you, Mr. Deputy Speaker. I'm going to support the proposals tonight because of the pressure on our NHS, and the briefings I've had from the Hospital Trust in Sheffield is to protect the health service workers, but also those patients who need cancer and other treatments, which they won't get unless we deal with this matter urgently. The Clinical Commissioning Group and GP Practice in Sheffield are enthusiastic, ready and willing to get this vaccine delivered. They tell me that within a couple of weeks, they can be up to 30 to 40,000 vaccinations a week in Sheffield, so that by Easter, a majority of the population will be vaccinated. The two caveats are, first of all, they need the vaccine delivered. And already we've had problems. I'm told that some of the primary care networks this week were told that the vaccine will be delivered on Friday. It arrived yesterday. So the practice have to scramble around to get people to come in at very short notice to deal with the vaccinations within 3 days. Other practices were told that they would have the vaccine this week, and then were told it wouldn't arrive till next week, having had the appointments made for this week for people to come in. That's not acceptable. It needs to be sorted out. The second one is the bureaucracy. I was pleased that the Secretary of State earlier said he was going to strip out the training requirements for people giving the vaccine. Absolutely right. They shouldn't have been there in the first place. I'm told that it will take about 8 minutes to do one of the COVID vaccines compared with 2 minutes for a flu vaccine. Why is the difference? It shouldn't be there. There are actually guidelines in the rules that have been sent out to explain how GP practices should cut up the waste packaging once the vaccine's been delivered. It's this sort of bureaucracy and nonsense that we need to sort out. I've also been told this week that when I asked for information about which GP practices would be giving the vaccine for the first time this week, I couldn't have that information unless someone higher up in the NHS approved it. Sorry, I'm entitled to the information. More importantly, the public of Sheffield are entitled to that information. We need to stop that bureaucracy as well. Finally, can we stop passing regulations that can't be enforced? The wearing of face masks, very important. But if people simply say, as I met a group of young people, saw them in Meadowhall Shopping Centre the other day, walking along saying, oh, we'll just tell them we've got asthma if anyone asks us. We need the police to have the powers to make people wear a face mask and be required to produce evidence of an exemption if they have one. Finally, recently, Derbyshire and Nottinghamshire were in Tier 4, Sheffield was in Tier 3. People were driving over the border to Meadowhall and Drake House to do their shopping. The police had no powers under the rules to enforce the requirement that people shouldn't travel over the border for those purposes. We need to sort that sort of situation out as well.
Sir Robert Neal.
Thank you, Mr. Deputy Speaker. We should only vote to pass legislation which severely restricts the freedom of our fellow citizens and the legitimate activities of lawful business if there is the most compelling necessity, and if those measures are proportionate, and if there is proper parliamentary scrutiny and oversight. On balance, and having seen my own constituency and the data relating to it, the exponential growth in infections caused by the new variant of the virus, on balance, I am persuaded that there is a compelling necessity for these regulations. As to proportionality, again, on balance, I think, even regrettably including the closure of schools, there is evidence to support the bulk of these measures. But there are, inevitably, I think, because they were produced in haste, some elements which frankly fly against evidence and reason and need to be reviewed and reviewed swiftly. The obvious example is the prohibition upon two people in the open air playing golf or tennis. There is no rational basis or evidence for this. It's a mistake to include them, and it's very clear that it's not necessary in Scotland. They haven't done that in Scotland. I don't think it's safe north of the border and unsafe south. That also creates a problem for many local authority leisure centres who are struggling for income. That ought to be revisited. Similarly, the disproportionate effect upon the ban upon alcohol off sales on micro pubs and small independent public houses, as opposed to the off-licence chains, ought to be revisited. That brings me to the point about parliamentary scrutiny. I'll live with those flaws in the regulations for the broader good if there is timely scrutiny and review. Leaving it 30th March without any review would be unreasonable. I welcome the fact the Prime Minister said earlier today that there would be the intention to bring matters back to the House as the vaccination programme proceeds. He also said that there was a legal obligation to remove redundant restrictions in the regulations as the vaccination programme proceeds. I hope the Minister will indicate what the mechanism is for that, because an obligation has to have a means of being enforced. In that instance, that means coming back to this House. If we can have that, then on balance, I could give these regulations my support, which has not been the case in previous instances. But we cannot use the gravity of the situation as a reason to overrule the normal requirements of proper parliamentary scrutiny. That is necessary in the interests of democracy and of the rule of law. I hope that the Minister will be able to give me those assurances as she winds up the debate.
Video link. Paul Blomfield.
Thank you, Mr. Deputy Speaker. And let me start by saying that I will support these measures today, simply regretting that the government is acting too late again. Clearly, these measures are necessary. So is the support for those whose lives are being affected by them. Ministers will know that too many have fallen through the gaps in the support schemes provided by the Chancellor, particularly in small businesses and among the self-employed, and especially in my constituency in the hospitality and creative sectors. I haven't got the time today to discuss all the ill-considered rules and deadlines, but I would ask ministers to agree to meet representatives of the excluded, along with those honourable members who have taken up their cause. So often in a crisis, it's those who have least who've been hardest hit by COVID. The government could begin to address this unfairness by making a commitment today that the temporary £20 a week increase to universal credit and working tax credit will be made permanent from April. Also to commit to extending it to the legacy benefits, ESA, income support, JSA. Mr. Deputy Speaker, this is a moment to pay tribute to the key workers who have kept the country going and who will do so in the weeks and months ahead. Let's remember them as we move forward too by tackling the low pay and fragile employment faced by too many of those in the private sector. And let's give those in the public sector the pay increase that they deserve, not the pay freeze that they don't. So much now depends on the vaccine. Let's remember that the first vaccine to enter British arms, which we should celebrate, was developed by Turkish origin scientists in Germany with an American company and manufactured in Belgium. An international response to an international crisis. I hope that will be reflected in our response more widely as a country. And I hope that ministers will confirm that as we roll out the vaccine in the UK, they will work with our partners around the world to ensure it also reaches those who desperately need it in low-income countries. Mr. Deputy Speaker, in agreeing to these measures today, let's also resolve to tackle the injustices that have been highlighted by this crisis.
Thank you, Paul. Video link. Caroline Noakes.
Thank you, Mr. Deputy Speaker, and I welcome the opportunity to contribute this afternoon. We've heard a great deal of consensus across the House. We know there is a terrible toll on people, on our constituents, and every member who votes in favour of these regulations tonight does so with a heavy heart, balancing the impacts carefully and with recognition that they must be, for a minimum period of time, reviewed frequently, carefully monitored. We've heard from many speakers about the impact on children. My friend, the Honourable Member for Harlow, highlighted the terrible lockdown that the loss of social interaction is having on young people and their mental health. I was pleased to hear from my right honourable friend, the Prime Minister, earlier today that getting schools back is an absolute priority. It must be. And teachers, parents, school children themselves have reached out to me asking that I highlight their worries, as have the early years sector, who feel that they have not been taken with the government and have been neglected over the course of the last few days in announcements. I called back on the 12th of November for teachers to be prioritised for vaccination. Now, I recognise there are competing calls from all key workers, but I would like to make particular reference for those working in special schools where there is a very great need and where it is hardest for children to understand the importance of social distancing. Equally, there must be vaccination for care workers working in domiciliary care, employed by charities or working independently. And this afternoon, Age Concern Hampshire have highlighted to me their worries that these workers are going to go unvaccinated. The death toll for those with learning difficulties has been horrific. And the Honourable Member for Lewisham has highlighted the work my committee has done on this, publishing a report on the impact of COVID on those with disabilities. The commitment to rolling out information in a manner that can be easily understood, whether it's easy read, large print, braille, British Sign Language, has been quite inadequate. As a result, people who need the most help have had an information gap, and that is not good enough. Gov.uk still does not have a BSL translation when there are apps that could do that quickly, easily, and relatively cheaply. But it is not just those with learning difficulties who have not been given enough information. Members of Parliament this afternoon have asked for additional details about the agreed schedule of vaccine delivery, about the approach to the equation between numbers vaccinated and a consequential lifting of restrictions. People have shown their willingness to comply with massive restrictions, but they want to understand the exit strategy. Early years providers want to know that they are as valued as primary schools. Golfers want a clear explanation why a walk with your partner with no clubs is fine, but with your clubs is not. People are not fools. The science is difficult and graphs can be bewildering, but ministers need to give us transparency and honesty. That is the key.
Link. Karen Smith. Mute. Karen, you're on.
Thank you, Mr. Deputy Speaker. Retail, hospitality, care, building and trades are the biggest employers in Bristol South. There have been many job losses, but many people are working in those industries and they are keeping our city going. They have done everything the government has asked of them, and we now need to make sure they are safe and get this vaccine delivered and open our economy. Now, I've worked for many years with local GPs and the NHS in this city, and I know them well, and I've worked very closely with the team at Ashton Gate Stadium who are on standby to deliver this vaccine. We have a good standard of general practice in South Bristol, good collaboration. They've already started, and Ashton Gate have been ready for weeks, but they are all being kept in the dark somewhat about what the expectation upon them is and what is happening nationally with the rollout. So we have some basic questions that we'd like the Minister to answer, and they're basic project planning why questions. We know why we're doing this, but providers locally need to know what vaccine is coming. They need to know who, for example, is going to the GP. How far down the JCVI list do we want GPs to do? How do we want to call them? Now, I think it's sensible to do the over 75s, care homes, and maybe the clinically vulnerable. But GPs, if they are going beyond that list, need to know, because basically they need to get back to their day job. We need to know where people are going to be vaccinated. Are the rest of us going to our GP, or are we going to Ashton Gate? We need to know when we're going. Now, I understand the reluctance of ministers to commit to dates, and this is a complex manufacturing, distribution and delivery process. But I agree with the member for Forest of Dean and Sheffield South East about transparency. And crucially, those delivering the service need to know. And absolutely, we as MPs on behalf of our constituency need to know when this is happening. Now, I've done a back of a fact packet estimation. South Bristol has got about 16,000 over 65s. GP practices can do roughly 500 to 600 of these a day. So in roughly 30 days, if we know when this is being delivered, we could vaccinate all those over 65s on South Bristol, but it does depend on knowing when we're going to get the vaccine delivered and what the expectations are upon the deliverers. I will support these draconian measures tonight, but I do not want, again, the government to impose upon us here in Bristol the disaster of the national one-size-fits-all, crony-backed whack-a-mole nonsense that we've had from the government. Our local CCG is doing a good job. We've got good collaboration on the ground in South Bristol with GPs and with the people at Ashton Gate Stadium. They know what to do. They need support and they need clarity to get on with it and make our city safe to resume our normal working lives.
Sir Desmond Swain.
Mr. Deputy Speaker, this is a situation of state capture. The government is completely in thrall to a lobby, driving a policy that has manifestly failed. It's failed, or we wouldn't be here yet again. A complete failure. And yet we go through increasing iterations of this policy with ever tighter controls and restrictions in the hope that it might finally work. And then, when there is a possibility, as a consequence of the arrival of the vaccines, the crazed lobby has already begun to signal that the social control won't be over, that some restrictions will remain. Indeed, the chiefs have pointed out that they might have to be reimposed all over again next winter. So, for those colleagues who are contemplating voting for these measures this evening, buoyed up by opinion pollsters telling them that actually the voters are in favour of them. And indeed, the voters crave for even tighter restraints on their liberty. I would point out that when the devastating economic consequences of this policy come home to roost, double-dip recession, years of slow growth because firms can't take up new opportunities because they're saddled with debt, those same voters who are so enthusiastic will abandon them, and they'll be back to point a finger of blame. And on that occasion, at least, they'll be right.
Definitely not on mute, Sir Desmond. Video link, Ian Paisley.
Thank you, Mr. Deputy Speaker. I have consistently voted against these restrictions because I will not be dragged behind the banner waivers that take us into this cul-de-sac that we have been marched into. The Health Secretary at the beginning of tonight's debate said that, and I quote him, he has certain knowledge that we have a way out. Oh, if that were so, I would follow him gladly. But I don't actually believe the Secretary of State does have certainty that can be relied upon in terms of this virus. I mean, will this virus mutate into something worse? Who knows? Will the current vaccines work on mutated strains? Who knows? Can it be transmitted by asymptomatic carriers? Who knows? How effective are the current vaccines going to be? Who knows? What are we left with? Well, we're certainly not left with certainty about the way out of the lockdown. I've now lost count, Mr. Deputy Speaker, of the number of lockdowns that I've been asked to support by this government. The problem for the government is this: when this lockdown drags on through February and into March, and it still hasn't worked, what's the government going to do for its encore? What's next? I fear this is a massive mixed message. On the one hand, we have the wonderful news being declared that we've got a vaccine. Indeed, we've got 2 vaccines. And then, instead of committing to rolling that vaccine out in a very, very strict and fast way, we actually have a declaration that we need to go into lockdown. Now, that is hardly a vote of confidence in a vaccine. If on the one hand, we're saying we have a vaccine, on the other hand, we're saying we need to have a lockdown. We need to offer this vaccine urgently and quickly to key workers, whether they be in the health service or the education sector. We need to give it to the vulnerable and the elderly who are the target for this disease. And I think we should be using, Mr. Speaker, the army to roll out this vaccine in a very consistent way. Finally, I'm really appalled at the way in which our health service has been managed throughout all of this. It receives vast resources, and yet my heart goes out tonight to the 1,300 or so people in Northern Ireland who will not be diagnosed this year with cancer because they are too frightened to go to the hospital. Of all the other misdiagnoses in terms of coronary heart disease, in terms of stroke disease, because of the total absorption that the management and the health service has taken up with regards to COVID. I agree with my colleague for Strangford. We should have a national day in prayer for this, and I welcome the fact that the front bench of the Labour Party has supported that tonight. Let's put this rather embarrassing episode behind us of unending lockdowns, and let's get on with ensuring that the health of the nation comes first.
Video link, John Redwood.
I am very worried about the loss of liberty. I am very worried about the economic damage. I'm very concerned about all those small businesses that have been shut down and their livelihoods undermined. So I do want the government to come forward with a more urgent, convincing exit strategy from these measures. And I do think we are owed more debates and more votes long before the end of March. We need to keep this under constant review and to keep the pressure up to take off those measures that are not strictly necessary or can be superseded by something better. I do hope the rollout of the vaccine will go well and will be speeded up. And I would like more information from the government on why they're not currently using pharmacies, why it has taken so long to welcome back recently retired people into the health service who would like to help out, and whether there is going to be a plan to train suitable volunteers so that we can greatly extend the numbers of people administering the vaccines. I also think it'd be helpful to know more about the supplies. But I also think we need to get smarter at living with the virus, because clearly, unfortunately, we're going to have to live with it for some months to come, however successful vaccinations. So can the ministers please be more information on medical progress with treatments? That we had a great breakthrough in Britain with a steroid helping to reduce the death rate. There are many more in trial. Can we know more about it? Are there things that people can take by way of supplements to buttress their immune system to make it less likely they get it, or are those fictions of others? Can we get better at isolating patients and suitably protecting staff in those isolation units or isolation hospitals? And why don't we use the Nightingales as COVID-19 secure and specialist units to take some of the cross-infection dangers away from some of the other district general hospitals that in that situation would not have to have the intensity of COVID-19 treatment? Can we know more about the capacity of the health service? Because there seems to be differing views on how many beds could be made available should the COVID-19 wave continue to deteriorate as it has been. And can we hear more on improving infection control? What use are we making of intensive UV under suitably controlled conditions? What have we done to try and improve cleaning of air recycling or air extraction promptly so that we reduce the exposure of people in hospitals and in other locations that we might like to use to dirty air which could spread the disease? So above all, Mr. Deputy Speaker, I think we need much more knowledge and information about the undoubted energy, I'm sure, that is going in to alternative treatments and better infection control. I'd like to thank all those in Wokingham and the area that have done so much to help us during this difficult period.
Mr. Deputy Speaker, I must respectfully disagree with a number of the previous speakers. These lockdown measures are necessary. They were necessary when they were introduced in Wales by our Welsh Government on the 20th of December, and they are necessary because of the sheer crisis that our health service currently faces. And if we needed any more information to underline that, Mr. Deputy Speaker, we only have to look at the statistics this afternoon. Over 1,000 deaths, 1,000 tragedies for families up and down this country and individuals who are no longer with us, on top of an average of 700 that we are seeing every day, people losing their lives to this terrible virus. Nobody wants lockdowns, nobody wants restrictions, but they are absolutely necessary, Mr. Deputy Speaker. And if we need any other evidence, my constituency neighbour, the member for Cardiff Central, in hospital at the moment. And this weekend I spoke and I had some heartbreaking conversations with those working in our health service, including in Cardiff. I spoke to somebody who was working in the intensive care unit at the Heath Hospital, and the stories they told me were utterly heartbreaking. And I want to say, Mr. Deputy Speaker, that my thoughts, my solidarity, my support are very much with all of those in our NHS, in Cardiff and Vale Health Board and across this country at the moment, who are on the front line and dealing with the reality of this rather than some of the fantasies that we've heard today from some corners of this House. But I want to talk on two issues, Mr. Deputy Speaker, briefly. We have to offer people hope on a way out of this situation, and that is why the vaccines are so crucial. And I asked the Secretary of State for Health earlier on to give us some guarantees on scaling up the production of the vaccines as well as the distribution. In 1915, Mr. Deputy Speaker, we faced what was called the shell crisis in World War I. I know about it because my great-grandmother was recruited. She was one of 12,000 women recruited from the cotton mills of the Northwest to work in emergency factories, mixing nitroglycerin, getting that into munitions for the Western Front. A dangerous, complex, difficult manufacturing task, but one that this country turned itself to 105 years ago. And it's that kind of effort, that kind of investment in expanding facilities and adapting facilities and producing facilities, both for the production of the vaccine, its bottling and its distribution, that we need to engage in at the moment. And we need greater assurances from the government on this in the weeks ahead, not least that we know that they are doing everything that they can at a UK level to get that vaccine produced, but to give hope to our people suffering under these lockdowns and suffering with the effects of this virus. And secondly, Mr Deputy Speaker, we must not make the mistakes that we made in previous lockdowns, and one of those has been absolutely rightly raised today by the Chair of the Home Affairs Committee, by my honourable friend the Shadow Home Secretary and others, which is about our borders. We let in people who spread COVID-19 and different strains of it around this country in January, in February, in March, in April, in May last year. We now need to have the measures in place at our borders because there are going to be more variants, there are going to be more cases coming from around the world. We need to have the best systems in place. We were told we were taking back control of our borders. We've got to have health protections at our borders, and we need those measures now.
Hear, hear.
Absolutely.
Yeah.
Absolutely. Thank you.
Mr. Deputy Speaker, Mr. Deputy Speaker, supporting businesses as they endeavour to cope with COVID and its multiple challenges has rightly been amongst the government's primary priorities. A comprehensive package of support, including the job retention scheme, loans, rate holidays, cash grants, and a temporary cut in VAT for the hospitality and tourism sectors, has provided a means of survival, but no more than that. And this lifeline for livelihoods must not be cut now. Particularly vulnerable are firms that depend on advertising revenue. 99% of firms in our nation are SMEs, hubs century-old, family-run hotels, cafes, and restaurant manufacturers, independent local shops. They are at the heart of our economy, and they provide the lifeblood that flows through our communities. We must ensure that COVID does not further widen existing disparities, advantaging the big at the expense of the small, advancing the national at the expense of the local, the urban to the detriment of the rural. In that respect, I repeat what I said to the Prime Minister earlier. We do need the vaccine in rural communities. It needs to be delivered locally, accessibly for those people that live a long way from large towns and cities. And for SMEs, particularly those in remote areas who face a daily struggle, they really do need continuing support. Contrast for a moment independently family-run shops, passed down through generations, struggling to cope, with a Tesco's executive rejoicing that profits continue to soar, the Amazon director celebrating a 37% increase in their earnings, compared with the owner of a much-loved bookshop, dutifully distilling and distributing the wisdom of ages, who are struggling with the strain of debt. Schumacher argued that small is beautiful, and small is indeed beautiful because people are the things that matter most. So the government must chart a new orientation, which the needs of small independent family businesses come above the interests of faceless corporations. A new challenge brings new chances for cathartic change. At present, the government is preoccupied with responding to COVID and defined by that to some degree. But we can chart a new normal, one which is fairer, which is freer, and which is fraternal. A different kind of social order where social capital matters as much as economic prosperity, where the well-being of communities is the heart of all that government does. So as our redoubtable Prime Minister rightly reiterated that only through determination, perseverance and togetherness will the clouds of this storm clear, we must build a new nation, one nation based on fraternity.
West Street.
Thank you, Mr. Deputy Speaker. It's a pleasure to follow the right honourable gentleman. This morning, I and other local MPs met with our local NHS leaders, and it is very clear from the experience of the pressures on the NHS in my community and right up and down the country that these measures are needed for one reason and one reason alone, and that's to prevent those NHS services from being overwhelmed with catastrophic consequences for people's lives, people's families and people's communities. No one takes the imposition of these kinds of measures lightly. We do so in the national interest, and that is why we are voting with the government this evening. But there are three lessons that the government need to have learned from the last 9 months. The first is the importance of acting quickly and decisively. Being too slow to act, as the government was in the first lockdown, the second lockdown, and now the third lockdown, has had serious consequences for people's lives, people's livelihoods, and people's learning. And had the government acted more quickly, we would not have seen the excess death rates in this country, the rising levels of infection, and the disproportionate amount of lost learning amongst children and young people, not to mention the enormous economic consequences that have followed, because quick and decisive action means a more manageable set of restrictions that allow businesses to carry on trading. So we are all paying a heavy price in lives, livelihoods, and in learning. The second lesson that the government needed to have learned from this period is that public health and the economic health of our country go hand in hand. It is simply unacceptable that we haven't seen the Chancellor in this House since well before Christmas. There is a new set of national restrictions in place which are wreaking havoc with people's livelihoods. In fact, businesses before Christmas literally closed overnight at a time when they were looking forward to big Christmas trading. Where is the Chancellor? Where is the support for businesses? And where is the support for the millions of people who've been excluded since March? Thirdly, the impact on children and young people has been devastated. Schools should absolutely be the last to close and the first to reopen. But where is the national plan for laptops, for internet connections, for support for children and young people to get online? The government have had months to prepare. We urged them to act and they failed to do so. Where is the plan for exams? Warm words from the Education Secretary today, but precious little for teachers, children and young people to prepare for. So as we look to the future, and a brighter future and a post-vaccinated future for our country, let's make sure that we have a position where families can get together, where businesses can bounce back, and where we provide opportunities for young people rather than allow an entire generation to be consigned to a lost generation of widening educational inequality.
Andrew Rosendale.
Mr. Deputy Speaker, in 2017, the World Health Organization's Pandemic Influenza Risk Management Guidance emphasised that any emergency measures be necessary, reasonable and proportional. I fear the measures we are being asked to vote for today are none of these. I was elected to represent my constituents in Romford, and I pay tribute to them for their resilience throughout this pandemic. But I cannot justify such a fundamental assault on their liberties and livelihoods. Removing people's most fundamental rights and freedoms and confining them to their homes is a political decision. And those of us who are elected must judge not just the impact of the virus, but also on our constituents' livelihoods, businesses, jobs, education, homes, and indeed their physical and mental health. We are constantly told by the governing scientific and media class that we must shut down our country and that people must surrender their most basic rights and freedoms in order to save lives. Yet those countries that have followed strict lockdown strategies have not all been successful in achieving this aim. There is no member of this House that does not want to save lives. And from the bottom of my heart, I thank the NHS personnel at Queen's Hospital in Romford who have done a magnificent job in saving lives and in caring for the sick. But there has to be a balance and proportionality to these decisions, considering the long-term consequences on the lives of the people we represent. I fear the impact of these shutdowns on those who run small businesses, on the 50,000 Britons with undiagnosed cancer, as estimated by Macmillan Cancer Support, on the elderly who have been cut off from their loved ones in the last years of their lives, and on children from the poorest backgrounds who will fall behind as a result of schools closing, and the victims of increased domestic violence and suicide. The scientific advisers will never need to account for the effects of lockdown on our constituents, but we will. The shutdown we are voting on today and the effects of these measures, whilst well intended, may I fear do more damage to the lives of the British people in the long term than the pandemic itself. I believe a complete rethink of this policy must now take place. Our country cannot go on like this.
Video link. Bill Esterson.
Thank you, Mr. Deputy Speaker. Well, I want us to learn from what's happened since March rather than saying no, because if this lockdown is to be effective, we have to look at the gaps that weren't plugged so far. And I want to talk particularly about the up to 3 million self-employed people, freelancers, people who run their own businesses, people who changed jobs at the wrong time, who've had little or no financial support. It's been a burning injustice since March that they've gone without, and it continues to be. And it's something that the Chancellor should be coming to the House of Commons to describe how he is going to support these people who've been left behind. It's not fair for them, and it's an injustice, but it's damaging economically too, because they all have a contribution to make as the economy eventually recovers. And the stronger, the healthier their finances are now, the better placed they and many other businesses will be to play their part when the time comes. But there are also health consequences, because one of the characteristics of this crisis has been people haven't been able to afford to self-isolate. That's individual low-paid workers, and it's the 3 million excluded people as well. Because they haven't had support, whether it's sick pay for people who are employed, or a lack of access to furlough, or to the self-employed scheme, or often even to universal credit, people haven't been able to afford to self-isolate when they've been contacted. And that's one of the reasons, it's a big part of the reason why less than 20% of people who are supposed to self-isolate have done so far. It's something that must be fixed, because to get the health aspects and the benefits of a lockdown right, the financial side must be fixed at the same time. And that's why it's right that the expectations of the large retailers in returning £2 billion in unneeded business rate relief are that money is used to support those who've gone without so far. The Chancellor should come and tell the House and those excluded people that money will be used to support them through the coming weeks and, if necessary, months. He should be providing greater business support for those areas where business has had to go without for longer because lockdown came earlier and deeper. And he must put these things right soon, because if we don't, the ongoing crisis will be worse in the long run. The cost will be greater, and those people who've gone without will continue to suffer.
Video link. Alex Shelbrook.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, I want to start by praising the Prime Minister for the way he's taken the decisions. I'd rather have a Prime Minister who leaves no stone unturned before restricting our liberties and making it the very last thing he wants to do to close schools, because ultimately these have a real effect on people's lives, and decisions we make today are with a heavy burden. I'd also like to thank the BBC for what they're going to do to help with education. That is a real public service broadcaster. I welcome the £4.6 billion being made available, and I spoke to a landlord of a pub this week, and this will be a vital injection. In fact, he's told me it's a vital injection of what can be used. But I would urge my right honourable friend, the Chancellor, to have a look at a slight extension to the rates holiday, because the hospitality sector is going to be one of the vital tools in our recovery. People are desperate to go out. And of course, every time somebody does go out, the government gets revenue because every drink sold has a duty on it. So it is one of the golden gooses of the economy. So please don't cut its head off. See if we can do more to help that industry. I do have concerns about teacher assessment for examinations. A top grade can be given to a child for what it has been taught, but there will be a lot of stuff that they haven't been taught. And I fear that they will suffer the consequences of that later on by having that lack in their knowledge. I personally would like to see exams move to Christmas this year. This is a radical solution, but this is an unprecedented situation. Curriculum delivery, I believe, is absolutely vital, and examination is vital. Exams are not just an academic test. They're a pressure experience, a part of our human development, and that prepares us for later life. I am concerned about nurseries, and I think they will need more financial support, because many parents won't send their child to nursery if they're at home. Why would they spend the money on that? And that means nurseries could well go bankrupt, and I urge my honourable friends at the Treasury to look at that very quickly. I just want to finish on the reporting. A lot of people have asked for the number of injections that are given to be shown each day. I'm not sure that in itself is helpful. I think what would be helpful is a tracking graph of 3 weeks later, so they're then immune, and having on that graph a series of levels where it would show that when this many people have been immunised and the demographic they represent, that these are the restrictions that could be undone. And therefore, the public will be able to see how we're progressing towards the targets of being able to come out of these restrictions. And I think that gives a clearer roadmap, and that gives a clearer way of getting the proper buy-in that we need to get out of this situation as quickly as we can. It gives people hope and shows a real timeline in what it means to people. Finally, in terms of businesses who have put money aside for tax returns and can't access that, I would urge a sort of furlough scheme for that, so they could access that money and not have to pay tax on it.
John Speller. Thank you, Mr. Deputy Speaker. And in my experience, Mr. Deputy Speaker, the Tories have never won elections because the public thought they cared, but because they believed them to be competent. Well, Black Wednesday did for John Major, and I suspect that the COVID crisis might deal with the Johnson regime. Now, nobody believes that government get it right first time, and certainly not all the time, although that does not excuse the criminal negligence of not dealing with pandemic planning, which seems to have gone by the board. But it's the speed of reaction and the lessons learnt that's important. And the question is, why do they keep making the same mistakes time and again? Who's in charge? Who's minding the shop? Who's dealing with the detail? Ministers seem surprised at predictable events. The Prime Minister seems astonished to find out that viruses mutate. The timescale when they do, but they very certainly do mutate. And every year we have a different variant of influenza. Now, we'd already had an experience of a lack of capacity with PPE. At the time the crisis started, 1% of PPE used in the British Health Service came from this country. Stock handling was also appalling. When the crisis hit, British firms tried to make contact with the health department. They just ran into a brick wall. They were getting no response and no help. And yet the government then poured money into grossly overpaid management consultants, middlemen and pals. Huge cost to the public purse and a real crisis in the health service. Now, with the vaccine programme, we've had this magnificent effort from the scientists with their international partners. But once again, we seem to be short of capacity. Now, the Prime Minister's response was almost acting like a Soviet planning minister, setting a target of 13.5 million people to be vaccinated by Valentine's Day, but with no clear indication of how that's going to be achieved. Secretary of State, very helpfully today, told us that it wasn't filling the glass vials that were the problem. So is it manufacturing capacity? And if so, why haven't we dealt with that in the last 12 months? Is it MHRA testing? But they've got a great record in validating the vaccines, of moving things along. Where is the problem in the system? And when we get the flow, especially of the Oxford AstraZeneca drug, because that'll be much easier to handle because of it doesn't require such a degree of refrigeration, then why aren't we talking to pharmacists, to retired doctors, nurses, and why aren't we bringing those in and getting them lined up now? Why force folk, especially older folk, to travel so far? What the public are asking is, do this lot really know what they're doing?
Video link. Kim Johnson.
Thank you, Mr. Deputy Speaker. There's been more than 2 million confirmed COVID cases in the UK, and 71,000 people have tragically died, and a staggering 1 in 5 are now diagnosed with COVID, another record high for this country. Liverpool has been significantly impacted by the pandemic, and the total number of confirmed cases in Liverpool for the last 7 days is over 3,500. an increase in over 2,300 on the previous week. This new variant poses more threat going forward, and we clearly need to take action to halt the increase, to save lives and protect the NHS. But this was not inevitable. Time and again, we have seen this government refuse to take the necessary steps to save lives and protect livelihoods. We have the second highest death rate in Europe, surpassed only by Italy. On top of that, we're currently suffering the deepest recession of any G7 country. This government has failed to rise to the challenge of this pandemic since last year, and future generations will look back on the government as having done too little, too late. Mr. Deputy Speaker, I repeat that this was not inevitable. This is what happens when those in charge disregard calls by frontline workers, teachers, scientists, unions and experts who call for schools to be closed and a national lockdown to slow the spread of this pandemic. Doctors at the Royal Liverpool Hospital in my constituency describe the situation as hanging by a thread, with major staff shortages and staff suffering exhaustion. The additional winter pressures and delayed medical demand still overdue from the first COVID wave, all adding to this pressure. Now, with hospitals at risk of being overwhelmed by this new variant, already facing this huge spike in infections with less staff than in the first wave, can the Minister outline what funding is going to be made available to bring in extra support and extra staff into the NHS over the next coming weeks? With the vaccines being rolled out as we speak, and the welcome news that AstraZeneca vaccine has been approved to begin being distributed next week, when will the government produce a national plan for vaccinations, and will they outline what steps will be taken to ensure that agency and outsourced workers in frontline jobs such as hospital porters and cleaners, teaching support staff, will be given equal access to vaccines alongside everyone else in their workplace, especially given that it is these staff that are more likely to be at greater risk of contracting the virus. Mr. Deputy Speaker, I would like to conclude by paying tribute to our valiant NHS, all workers who have continued to work to keep my city safe, the council, public health, the community and the voluntary sector, and the army of amazing volunteers. Thank you.
Thank you. The wind-ups will begin at 6:44. Video link, Ruth Edwards.
Before Christmas, Mr. Deputy Speaker, I visited Goton Primary School in Rushcliffe to see what the children had been doing in Parliament Week. Like us today, they had discussed rules and presented their ideas. I heard passionate arguments against school uniforms. I learnt about the rules in beach class, designed, like these regulations today, to stop the spread of coronavirus. Were excellent campaigns for a nature reserve, a bug hotel, and a multimedia campaign for more litter bins involving leaflets, posters, speeches, and a video. I'm thinking of trying to make some new recruits there for my next election campaign. The strong sense I left with was how happy and engaged the children were at school with their friends and their teachers. The head teacher, Jeanette Allen, and her teaching team have done an amazing job to give children back the normality that lockdown last spring had taken from them. And I know that they and schools across Rushcliffe will be working hard to provide remote learning and support to children and their families. I also know that it cannot possibly be the same. So it is with a very heavy heart that I support these regulations today. I don't believe we have any other choice given the skyrocketing rates of infection we are seeing from the new COVID variant and the pressure our hospitals are under. I congratulate the Vaccination Task Force on the amazing work they've done to develop one of the largest and most diverse vaccine portfolios in the world. Thanks to them and the incredible Oxford AstraZeneca team, the vaccine is already being rolled out at pace. I would urge the Secretary of State and the Prime Minister to continue to explore every option available, enlisting both civilian and military help for getting the vaccine out quickly, and to continue to get rid of any bureaucracy, like these ridiculous training modules on anti-terrorism for volunteer vaccinators. I'm very proud of the communities in Rushcliffe who have given their all to battling this virus, but it is taking its toll. People are tired and weary. They need clarity on the conditions that must be met for the restrictions to be eased, and on how they will be eased as we emerge from lockdown. They also need to see a clear plan of how schools will be opened up again. I would urge my right honourable friends across government to make these available sooner rather than later, to give people the morale boost they need to get through this final lockdown.
Video link. Liz Twist.
Thank you. Thank you, Mr. Deputy Speaker. And as we've just heard from the Honourable Member from Rushcliffe, lockdown does indeed take its toll on all of us, but lockdown affects some people more than others. It shifts a huge amount of risk to key workers in social care, the food and retail sector, and of course, the NHS, and to those living in deprived areas, overcrowded housing, or poverty. If we do not provide additional support to key workers and disadvantaged communities, then transmission will continue and we do not make the most effective use of this lockdown. We must make it easier for people to do the right thing and stay at home. So we need to raise statutory sick pay to a level that covers the cost of living and makes it possible for people to stay at home and keep themselves, their families and others safe. There are many thousands of staff working for private contractors in the NHS, cleaners, porters, caterers, who currently are only entitled to receive SSP in case of illness. The government must commit to supporting these vital NHS workers in case to stay at home, protect the NHS and continue to save lives. And those working in social care take care of some of the most vulnerable in our society. They too must be able to isolate when they are ill in order to prevent spread of the virus and must be properly funded to do so. Too many people, Mr. Deputy Speaker, are excluded from the current self-isolation payment. Too many low-paid people are not eligible because they are not low-paid enough, but the loss of one income in a family, even for 10 days of self-isolation, can really undermine a family's economic stability and may lead some just to keep quiet about feeling unwell. Now, vaccines are the way out of this terrible situation, but we have to make sure that unlike the virus, which has had a disproportionate effect on the poorest and our most vulnerable, our vaccine strategy is fair and equitable. Vaccine programmes, when delivered through a call system, do not have an equal uptake across socio-economic groups, often leaving behind the most vulnerable and disadvantaged communities. So it's crucial that the strategy takes this into account and monitors uptake and engages with those groups. We know that COVID-19 doesn't hit us all in the same way. We know the devastating impact of poverty on children, and the recent COVID-19 Marmot review found that the pandemic has already widened and continues to widen existing inequalities. So the government must now continue the universal credit and working tax credit uplift of £20 per week, commit to ending the benefit cap, extend the free school meal entitlement to those whose families receive universal credit or have no recourse to public funds. Mr. Deputy Speaker, this lockdown is necessary, but it's hard. Thank you.
Video link. Tim Farron.
Well, thank you, Mr. Deputy Speaker. The restrictions that are being proposed to us this evening are right. There is no greater freedom than the right to life, and we are willing to suspend many freedoms in order to protect those, especially those who are vulnerable, and also to protect those people working night and day in the NHS and in our care settings, protecting us. They deserve us and require us, and we owe it to them that we abide by these regulations and these rules, not least because we can now see the light at the end of the tunnel. And I'll come to that in a moment. But given that we can see the light at the end of the tunnel and the vaccination programme is now beginning, it's all the more important that the government recognises the importance of supporting the entire economy and everybody within it throughout these coming months. We now know that it is not a period of time that is going to be ill-defined and could be indefinite. We know that this will be over at some point in the next coming months. That is a source of great joy. It should focus the Chancellor, especially when it comes to the support that he needs to give it to those who are missing out. There are many of those people who have been self-employed for less than 2 years, people who are directors of very small limited companies, taxi drivers and the like, people who have been on maternity leave, who have been excluded to one degree or another from support. It is an outrage that those people have been left to get into deeper and deeper and deeper debt because the government has yet to come up with a mechanism for supporting them. They must do so, and they must do so now. They are the very people we need to build our economy back once we're out of this situation. To let them flounder in poverty now is outrageous and unacceptable. I'd also like the government to be paying attention to the need and the plight of our outdoor education centres, who are in serious danger of closure. So many of them, we may have lost more than a third of the workforce already in the last few months. There needs to be a Scotland-style direct grant support payment for those centres so we can keep them going, so they can contribute for the years to come. I'm also deeply concerned that the government should come up with a specific and properly funded strategy for dealing with the backlog in cancer. We estimate that maybe 60,000 years of life will be lost to cancer due to the coronavirus pandemic over the last few months, and it could, of course, still get worse. And finally, the vaccine, at the light at the end of the tunnel, wonderful, and tributes to be paid to everyone involved in making that come to be and to administering those vaccines now, almost as we speak. But the government is making that tunnel a little bit longer than it needs to. It's very clear that supply of vaccine to places in South Cumbria is not as fulsome as it might be. There's clearly places like Sedbergh and Windermere that have not got vaccination centres set up as yet, and those sites need to be approved. I'd also want to say, as our teachers are teaching the children of key workers, that they also ought to be vaccinated as a priority.
Video link. Tim Lawton.
Thank you, Mr. Deputy Speaker, and thank you for saving me up to last. And it's difficult to say something new when you're number 67 on the list. But let me say at the outset that I recognise the seriousness of the situation, particularly with the new strain of the virus. I recognise the huge pressures on hospitals, and I pay tribute to them. But I'm just not convinced that another hurriedly announced national lockdown is the right solution, which is why I'm really loath to vote for these regulations tonight, and especially when we've had just 3 hours to debate the biggest infringement of civil liberties of our constituents that I've ever had to vote on as an MP, not least when Parliament could have been sitting all of this week and we'd have considered these regulations before they came into force, and particularly when we've seen that the sunset expiry date of these regulations has now been surreptitiously moved to the end of March rather than the end of January, as we were earlier led to believe. And when there's no impact assessment with these regulations, added to which there are measures contained in the new regulations which were brought into law in the first lockdown, but later removed or relaxed. And I said all along that government has a difficult job to balance advice and the risk from the medical experts, from the economic impact and the confidence of the public to abide by them. And after 10 months, that confidence has been sorely tested, and there's a high level of lockdown fatigue. So it's even more important that what we are asking our constituents to follow is logical, consistent and fair. And banning golf, tennis, angling and other outside pursuits was not considered to be logical and was relaxed in earlier regulations. Being banned from buying beer from off license from outside closed pubs rather than crowding into supermarkets and off licenses was also inconsistent and relaxed in early regulations. So it's frustrating and I think regressive to see these and many other unnecessary and illogical restrictions creeping back in again. And I ask the Secretary of State to be sensible and sensitive to the lobbying to remove them before it undermines confidence further. But looking ahead, my main point concerns the vaccine. It must be the single biggest imperative of the government now. We need a national effort, a little ship's effort to deliver on, buoyed up by the sea of vaccine the government wisely brought up early. So when ministers and clinicians proudly claim we'll be vaccinating 12 hours a day, 7 days a week, my reaction is, what about the other 12 hours, the other 50% of our time? We should be vaccinating 24 hours a day, 7 days a week, until everyone who qualifies is jabbed. Many volunteers have come forward to work shifts in the middle of the night. And many little old ladies in Worthing would readily bring tea and biscuits at 4 o'clock in the morning, and others to help run the technology. And if offered a jab at 4 a.m. in the morning, rather than 4 weeks hence, people will turn up. So we should be getting more juice, as the Secretary of State put it earlier, including approving the Moderna vaccine already given the go-ahead in the US, for example. Create drive-through jab centres, develop online booking slots, allowing walk-in services for spare appointments, allowing diabetics to self-jab when they get their insulin. Only when we're vaccinating full-time can the government claim to be doing absolutely everything at pace to get us out of this pandemic revolving back door, lockdown door.
Sorry, Tim. Video link. Rachel Hopkins.
Thank you, Mr. Deputy Speaker. And I want to first thank our dedicated and brilliant scientists who've given us the hope of a way out of this extremely difficult period. At the start of the first lockdown, the Prime Minister stated that the virus would be under control within 12 weeks. Yet 9-10 months on, we're rerunning the devastation caused at the inception of the crisis. The virus is spreading exponentially, many people are in hospital, and thousands of lives are at risk. This lockdown is necessary to restrict the virus spreading and to protect our NHS. And yet again, the public, my constituents in Luton South, at very short notice, are doing their bit to tackle the spread of COVID-19. But lockdown is a blunt tool. Being able to move out of it is contingent on the success of the vaccination programme across the country. So the government must ensure it carries out its side of the deal effectively by acting quickly to make sure the vaccination programme is a success. Meeting the target of vaccinating the top 4 priority groups by mid-February will require the vaccination of 2 million people a week and 14 million vaccinations in total. And while we all want the vaccine to be rolled out as quickly as possible, I'm concerned at the capacity of the UK's vaccine manufacturing to meet this target, given that the sustained lack of investment in vaccine manufacturing has left the UK acutely underprepared. The Chief Medical Officer has stated the vaccine shortage is a reality that cannot be wished away, and the government recognises this, as they've already dropped the 30 million vaccine dose target that was set in May. At the beginning of 2020, the UK did not have the capacity to produce vaccines to meet the demands of a pandemic. And so we're seeing the UK shockingly relying on repurposed infrastructure to make the Oxford vaccine. Sir John Bell stated, the government has been completely disinterested in building onshore manufacturing capacity for any of the life science products. We've also had the situation where one of the companies manufacturing the AstraZeneca vaccine in bulk is transporting vaccine doses to Germany so they can be put in vials. A decade of government austerity has hampered our ability to tackle this pandemic. And after the government's failings with PPE procurement and the outsourced test and trace system, and their failure to provide sufficient economic support, particularly to those who've been excluded, the government must now not fail in the rollout of the vaccine programme. So I hope the Minister will explain to the House how the government intends to address the frailty of the vaccine manufacturing supply chain and to rapidly increase the number of doses available. And finally, I'm also concerned that the government hasn't published a detailed strategy for the vaccination of all key workers. And as we go into another lockdown, we will once again see the real value of key workers who will keep our country going. There has not been sufficient assurances that teachers, posties, firefighters, police officers, all the other frontline key workers will be prioritised in the vaccination process. And in the Minister's closing remarks, he outlined whether
sorry,
there will
Rachel,
be a
we're going to try and
strategy for
squeeze in
vaccinating
somebody
key
else.
workers.
Video link. Richard Graham.
Mr. Speaker, thank you very much for squeezing me in. I can't think of many things I would rather not do than again restrict my constituents' lives in Gloucester. But until we've immunised those most likely to need hospital help, the responsible thing today is to support the government. And this third lockdown, it is incredibly important that we help as much as we can all those involved in distributing the vaccine to get us to the exit strategy as soon as possible. I know that the process of sharing information locally has been a real problem for some colleagues, but that's not the case in Gloucestershire, where for 9 months now, all 6 of us county MPs have met regularly with our NHS, primary care, public health and county council heads. And I pay tribute to them all, not just for the leadership that they've given to their organisations, but to the hard work of so many of their staff, both in health care, social care, and also care homes, to many of my constituents. The basic facts, however, that we are being given, we are often told are confidential. And therefore, can I ask the Health Secretary today to agree that the number of those in the top 4 categories in every area, the number vaccinated, the the daily rate required to meet the February 15 goals, and the situation daily updated are basic facts that should be shared to every resident in our country. Then we can have confidence in what is happening, what the situation is, and that we're going to arrive at the destination that we need to. That will also give people confidence that there is a real exit strategy as early as possible in the spring from the lockdown so that people can go back to work as usual. Secondly, Mr. Deputy Speaker, can I just highlight that although all of us agree how important it is to get children back to school, at the moment, confidence in when pupils will be able to go back is fairly low. And one way of being able to get round this problem, even though I know it contradicts the principles of how the JSVI organises their categories, would be to vaccinate the teachers so that heads would know that all their staff would be there and won't be at risk from pupils spreading the virus inadvertently. Can I ask the Health Secretary to consider that as he considers all the other important issues about supply and distribution of vaccine as soon as possible? Thank you.
Thank you, Richard. Video link. Fleur, ignore the timer. We will stop you at 6:44, but we're pleased to squeeze you in.
Thank you very much, Mr. Deputy Speaker. I am very glad to be speaking in such an important debate. And I'd first of all like to say thank you so much to all the staff at St George's Hospital and Queen Mary's Hospital in Roehampton who are working so hard at the moment to deliver many of the life-saving care that we're talking about today in the debate. And my condolences to the over 1,000 people who have died and to their families in the last 24 hours, which really brings home why we need to have these measures, hard though they are. And so I will be voting for them and supporting them. Our hospitals are under stress. We need to have these measures to save lives and protect the NHS. I am highly disappointed about the failure of the track and trace system up to now, which I think has been part of the reason why we're having to see these continuing lockdowns, and we are not overcoming this disease as they have done in other countries. And so getting to get grips with real track and real tracing back to 100 contacts each has got to be done. In terms of vaccines, I welcome this being rolled out, and I look forward to a community-first way of rolling these out in which local GPs, those who are trusted to provide and administer the vaccine, will be leading the way in this. And I really hope to see a vaccination centre in Roehampton, in my constituency especially. On economic support, I'm disappointed to see that many people are still left out of this support, and a business rates holiday will make all the difference to my constituents and businesses. And finally, scrubs. There's still a failure to contract for scrubs. There are still volunteers making scrubs for our NHS providers, and this needs to be sorted out. And I would really welcome hearing from the Minister if I can meet with those who are involved in contracting on scrubs and those experts in my community who are doing this still on a voluntary basis where it should be done nationally. So thank you very much.
Thank you for being concise as well, Fleur. Wind-ups, Alex Norris.
Thank you, Mr. Deputy Speaker, and I'd like to put on record my thanks to you and your staff for what is now the secondary call of Parliament for important business. I know that a lot of work goes into making that possible, and we really appreciate that. But it is important that we're here today. It is sobering, the daily figures that colleagues will have read whilst we've been sat during this debate. 1,041 more of our countrymen and women who have lost their lives to this horrible virus. It is a sobering moment, and with that in mind, we will support these regulations today. We don't think it's inevitable that we're in the situation that we're in, but it's clear that we are in a very challenging moment indeed, and in these dangerous times with our NHS working at such high capacity, it is in the national interest to protect it and to make these very difficult decisions. Now, I hope people watching, if you're one of the very many people who've been excluded from government support so far, or if you've missed out on self-isolation support, or if you're concerned about business support or reductions in welfare support going forwards, I hope that from our benches you will have seen the support from Walthamstow, from Leeds East, Manchester Withington, Barnsley East, Sheffield Central, Bristol South, Sefton Central, Blaydon and Putney, all giving you voice, similarly to those very many clinically extremely vulnerable who have so often felt ignored. I hope that they saw in the contribution from the Lewisham Deptford that they are not, and in same for the frontline staff contributions made from Worsley East and Liverpool Riverside. Many points were made earlier today on schools, which I won't emphasise any further other than the contributions from Eltham, Sheffield Central, Luton North and Cambridge. And there are important points made about the border from the members from North Normanton and Cardiff South and Penarth that I will reflect on shortly. And then many colleagues on my side, Wirral West, Hartlepool, Sheffield South East, Worley, Cardiff South, all made references to the vaccine, as indeed many did on the government side, Berwick, Bridgewater, South Leicestershire, Middlesbrough South and many others, but it was particularly the contributions from the members from Winchester and Forest and Dean about the government committing to publish a schedule of precisely what vaccine they're going to receive and when, and how that's going to be rolled out. I think the government ought to do that. There are important contributions made from government benches on the exit plans and support for business, as well as children in early years, and the contributions from Cheshire and Amersham, North Somerset, Altrincham, Sale West, Poole, Bromley and Chislehurst and Wokingham regarding oversight. We, of course, as an opposition, would support further and in shorter order review of these regulations and further debate to make sure that they are as effective as is possible. The colleagues from East Antrim, New Forest West and Romford all made points about the scientists. I would refer to, and I would perhaps fall on the Margaret Thatcher's maxim of advisors advise and ministers decide. Ultimately, if those colleagues are dissatisfied with the actions of the government, it's for those ministers alone to account for them rather than those scientists who are giving their best endeavours even if we don't agree with them. Now, I thought it was interesting that not a single colleague mentioned that we are exactly where we were 1 week ago. Mr Deputy Speaker, I was in this place, the Minister was in her place and you were in your place, discussing regulations. That failed. And, you know, that is very funny, but actually it's not funny at all when you think about it. And I asked the Minister 3 times to say that the government thought that their final attempt to salvage the tier system would work. And I had no such commitment made. And so I don't think perhaps it's a surprise that it fell over, even if it's a surprise that it fell over as quickly as it did. And that is a characterisation of a failure to grip this virus, as my honourable friend from Ilford North said, just so slow and always short, trying to do the bare minimum and never frankly doing enough. And it was, again, in a similar vein, I think, quite disappointing that the Secretary of State's contribution, his 23 minutes, could have been an intro to a general debate on vaccines, because that's all he spoke about. And of course the vaccine is important and is our way through this, but actually it's a failure to grip at a ministerial level that there are many other things other than the vaccine that they have control and say over and simply have not done well enough on. But this lockdown that we will no doubt support tonight will not make our problems go away. Lockdowns don't solve anything, they buy you time to solve things. So in my limited time remaining, I will highlight some of those that I think the Secretary of State ought to have referred to, and I hope that the Minister will too in her winding up. On economic support, again, not a word for those many millions excluded from support so far. They have gone a long time now without support. They deserve more than the glib comment they had from the Prime Minister this morning. I hope the Minister might do a little bit better. The Chancellor should be here, giving us a chance to scrutinise those plans. He was very keen to at the beginning, but we've not seen him now for a very long time. On test, trace and isolate, it remains the significant gap in our fence. You know, what fools we all look now that when the virus was at its lowest ebb in the summer, that system was not sorted out. And instead, you know, whilst the testing number at the beginning of the system remains a very good one, turnaround time doesn't hit its targets, tracing never hits its targets, and we know that not enough people isolate because the support for them is not good enough. The fact that we've failed to fix those problems, I think, reflects very poorly on the government. On the border, now I'm always loath to make international comparisons, certainly beyond Europe, but our daily death total today is more than the entire death total during this pandemic in Australia. And there are ways in which we're similar, ways in which we're different to them. But I think we should reflect that on the 20th of March, they closed their border. And that for anyone returning home during that time, they had a 2-week quarantine. But other than that, that was it. We're now still talking about test and release and other such measures at the border. It's an extraordinary failure. And just to make a couple of points on the vaccination to finish, you know, the vaccine and its procurement and its development has been a success, this government. And you know, I've said that multiple times from this place and will continue to do so. Whether they have a successful vaccination programme remains to be seen. And, you know, there is frustration, I think, across both sides of the House that there isn't yet a sense that this is going to be a 24/7 service, that we're unleashing all those people who want to volunteer to contribute. I think it's very surprising to see pharmacy on the front page of national newspapers. That's the length that pharmacies feel they're having to go to get the attention of the government. If the government are sure that they don't need this extra support and that they're still going to deliver on time, I think they should be clear about that. And I'd like particular clarity from the Minister. We keep hearing the Secretary of State and the Prime Minister, they've changed their form of words in the last 3 or 4 days to now saying that everyone in categories 1 to 4 will be offered the vaccine by the middle of February. What does that mean? What does that mean in terms of the modelling? Before, we thought that by the middle of February we wanted everyone in those categories to be vaccinated within obviously the limits, of course, of people not choosing not to take it up. But what that cannot be is a paper exercise. It has to be the fullest effort. Well, the minister seems to dispute this, so I hope she will take her time and contribution to do so. Because actually the vaccination programme represents a deal between the British people. We're asking the British people now for a significant period of time to endure significant hardship. And that's the British people's side of the bargain. The government's side of the bargain is an effective, safe and timely vaccination programme. They have to deliver on that. And I'll finish in that spirit with a simple message to my constituents and to constituents across the country. Stay at home, protect the NHS, vaccinate Britain. Thank you, Mr Deputy Speaker.
Minister.
Thank you, Mr Deputy Speaker. The regulations before us today set out measures that none of us want to take. Yet they are measures that we must take if we're to control this new and aggressively infectious variant of coronavirus, which is spreading rapidly across the country. As we have heard from the Prime Minister and the Secretary of State for Health earlier today, we are up against it in a race of vaccine versus virus. We are vaccinating faster than any other comparable country, but even as we do so, we also have a relentless rise in the number of new infections each day, hospital admissions and, sadly, deaths. We now have over 30,000 people in our hospitals with COVID. And earlier this week, the UK's chief medical officers advised that we should move to alert level 5, meaning that if action is not taken, NHS capacity may be overwhelmed within 21 days. The consequences of that and the decisions that it could lead to are not decisions we want our doctors to have to take. And therefore, I say to honourable members, that is why we must adopt the measures before us today. But of course, just as we don't want to impose these restrictions on people, we must be ready to lift them too, as soon as we are in a position to do so. Because we know lockdowns come at huge cost, economic, social, and particularly to the many thousands of children who are no longer going to school. I will indeed give right on.
These regulations can continue until the 31st of March, but can my honourable friend confirm that in fact these will be reviewed fortnightly and any regulations that are considered unnecessary will be lifted as soon as possible?
Well, I thank my honourable friend for his intervention there. And in fact, many other honourable members have also asked today about the duration of the restrictions and about ongoing parliamentary scrutiny. And I can say that the regulations provide for these restrictions until the 31st of March 2021, not because we expect the full national lockdown to continue until then, but to allow a steady, controlled and evidence-led move down through the tiers on a local basis. And the restrictions will, of course, be kept under continuous review. We have a statutory requirement to review them every 2 weeks and a legal obligation to remove them when they are no longer necessary to control the virus. And I can reassure some of my honourable friends, also the Right Honourable Friend for Altrincham and Sale West, for Cheshire and Amersham and for the Forest of Dean and others, we absolutely do not want to continue these restrictions longer than is necessary. Most particularly, we do not want to keep children at home and being homeschooled, and I say that as a parent right now with 3 children who have spent the day, I hope, being homeschooled. My husband has been in charge of that today, but we don't want that to be the situation any longer than we have to. Schools were the last to close, and the Prime Minister has said we want them to be the first to open. Of course, they are still open for children of critical workers. And I just want to pick up on a point from my honourable friend for Bridgewater and West Somerset. That should include those involved in the construction of critical national infrastructure, such, I believe, as the Hinckley point power station. While with great reluctance we have had to keep most children out of school, we have also had to require outdoor sports facilities such as golf courses to close. Mr Deputy Speaker, several honourable members have challenged this, and I want to tackle it head on. And I say to honourable members who've raised this, if you make an exemption for golf, you have to make an exemption for other outdoor activities, tennis for instance, outdoor bowling, climbing walls, riding centres, dry ski slopes, go-karting. I could go on, but people would then say to you, I'm being told to stay at home, but I can go and do all those things, so you don't really mean I should stay at home. So quite apart from the fact that even in, one moment, quite apart from the fact that even in those outdoor settings people congregate, we actually do need to be really clear that the message now is stay at home.
I mean, I'm pretty thick when it comes to logic. So you can go on your bicycle, and that's exercise, but you can't go and sit on a riverbank on your own in a solitary way. What is the problem with that?
I don't believe that my honourable friend is as he describes himself, but what I do think is quite clear is that we are saying to people stay at home, except for a very clear list of essential reasons why you can leave home, for instance, such as children who are eligible as children of critical workers to be in school for healthcare appointments and indeed to exercise. But we really do need to make sure it is absolutely clear that people should, other than those specific reasons, stay at home, because that is what we need to do in order to control this raging virus. And that is the message that all of us need to convey to our constituents. I will just try, I've got very little time, so I want to cover a couple more of the points that may have been raised, including ones raised by my right honourable friend. As honourable members have referred to, this national lockdown is different to previous lockdowns because we have the vaccination and the end of this is in sight. We've already vaccinated over 1.3 million people, including nearly 1 in 4 of those over 80 who've had their first jab. And by the middle of February, we expect to have offered the first vaccine dose to everyone in the top 4 priority groups identified by the JCVI, care home residents and staff, people over 70, all frontline NHS and care staff and the clinically extremely vulnerable. And that answers the question posed by the Shadow Health Secretary as to when NHS frontline staff will have had the opportunity to be vaccinated, as they, together with social care staff, are in the groups to be offered the vaccination by mid-February. The member on the front bench opposite asked about this point about offered, and he will know that vaccination is not something that is mandatory. We are educating, encouraging and informing people of the important reasons why they should step forward and have the vaccination, and that is the way that we are going about it. My honourable friend for Middlesbrough South rightly said that we should stop at nothing to get people vaccinated, and I could not agree more. That is why my honourable friend, the Vaccination Deployment Minister, is working with the NHS and getting millions of people vaccinated in just a matter of weeks, involving hospitals, GPs, community pharmacies and a workforce that includes thousands of volunteers, including health professionals, returning to the front line to play their part. And as the Health Secretary confirmed earlier, we've already acted to reduce some of the bureaucracy and particularly some of the training modules which was being required for those NHS returners. So we are ready to vaccinate just as fast as the vaccine can be supplied. I have heard several honourable members call for more data on the vaccination rollout, and I can assure them we will see the publication of weekly data tomorrow, and daily data publication will start next week. And that data will show our accelerating vaccination programme, protecting more people day by day, so that in time we will be able to lift many of the restrictions that are before the House today. So in conclusion, Mr Deputy Speaker, we do have some difficult weeks ahead for all of us, and especially for those at the front line working in health and social care, who we cannot thank enough. But we are now in the final stretch with the end in sight, so we must keep our resolve, get behind these restrictions that are needed to control the virus until the vaccine has reached those that it needs to. And I commend these regulations to the House.
The question is motion number 3 relating to public health as on the order paper. As many as have voted, please say aye. Aye. The contrary, no. No. Division, clear the lobby. Order. The question is motion number 3 relating to public health as on the order paper. As many as are of that opinion say aye. Aye. Or the contrary, no. No. Tell us for the ayes, Maggie Troop and Tom Pursglove. Tell us for the noes, Christopher Chope and Christopher Green. Lock the doors. Order, order.
The ayes to the right, 524. The noes to the left, 16.
The ayes to the right, 524. The noes to the left, 16. So the ayes have it. The ayes have it. Unlock.
I beg to move that this House do now adjourn.
The question is that this House do now adjourn. As many as that can say aye.
Aye.
You know, I think the ayes have it. The ayes have it. Order. Order.